Good morning, everyone. Good morning, everyone, and welcome to our public hearing on the impact of COVID-19 on our prisons and our jails. We've received a lot of information to discuss this topic. We're going to do a thorough analysis of what's happened in our facilities during COVID. I am the co-chair of this committee is Senator Gustavo Rivera, who will probably by the end of the day be on his fifth day of hearings total. And thank you, Gustavo, for agreeing to co-chair this hearing. And we're ready to rock and roll. Now, I want to recognize some of my colleagues. They will be working, presenting during this hearing or asking questions. So I'll start with anchors, and that's Senator Gallivan. And we have other senators. As they come in, we'll be introducing them. Before I commence, I want to set down the ground rules, how we're going to proceed. But before that, I'm going to start with an opening statement and then allow my co-chair, Senator Rivera, to make his opening statement, and then we'll start the more formal part of the proceedings. So for me, I've been extremely concerned about the impact of COVID in our state prisons and our jails beginning in March. Although New York facilities, correctional facilities, have not seen this kind of devastating illness and death rates than many other facilities around the country, that could change now with what we're seeing that's happening in terms of infection rates upstate. Last week, a church in Chemung County had a cluster of cases, which then spread to the county jail. We heard a rumor that 10 or more officers were sent home from the Elmira Correctional Facility for testing positive. Even though there are no reported cases amongst the incarcerated population of Elmira are listed on the DOC's website. As our communities reopen their gyms, their restaurants, their houses of worship, and schools, it's almost inevitable that the virus is going to spread. Furthermore, people are going to go inside for the winter and will no longer be able to work or socialize outdoors where it's much safer. Now that DOCS is open for visitation and transfers, I want to make sure that our incarcerated population is safe. I want to make sure that our correctional staff have the tools, training, and supplies they need to keep everyone healthy. We want to hear the plan for keeping COVID at bay in prisons and jails during the upcoming winter months. We want to hear the plan that DOCS is developing, and want to brainstorm with them about solutions. That is why primarily we're holding this hearing today. I'm not here, neither is my colleagues, I hope, to assign blame or point fingers, but to find out how to keep New York safe from this terrible disease that has already claimed more than 32,000 lives in our state and at least 22 lives among our incarcerated population, correctional staff, and people on parole. I want to thank everyone participating in this hearing. We look forward to getting all your information and ideas. Next, I want to introduce for his opening statement, my colleague, Chair of Health, and one of the hardest working senators in the state of New York, Senator Gustavo Rivera.
Thank you, Senator Sepulveda, for that. Good morning, everyone. Again, my name is Gustavo Rivera, State Senator for the 33rd District in the Bronx and Chair of the Health Committee. But before I was even a ranking member in the Health Committee, I was the ranking member in Crime Victims, Crimes, and Corrections. So the issue of criminal justice and the plight of folks who are incarcerated, as well as folks who are formerly incarcerated, has always been at the center of the work that I've done. So I'm going to be very brief because I want to make sure that we get to the testimony. We need to, in the public health crisis that we find ourselves in, if it's a public health crisis for everyone, then it means for everyone. Folks who are incarcerated are people too. And there are many things that we don't know about what's happened to folks who are behind bars. We need to make sure that we have as accurate as information as possible to make better policy, because we need to avert unnecessary deaths in every sector of society. And I know that it has been difficult to do so, but these hearings, the set of hearings that we've done in the last couple of weeks are precisely about that, to figuring out certainly what happened, but more importantly, what can we do going forward to avert unnecessary deaths everywhere in the state. And so today we go deep into jails and prisons across the state. And we want to make sure that we know what has happened there, that we hear stories from folks who are family members, as well as administrators of these systems, I'm looking forward to all these conversations and, more importantly, to the policy that will result from it. Thank you all for tuning in. Thank you all for being part of this hearing. And we should just get started. Back to you, Mr. Chairman. Thank you.
Thank you, Senator Rivera. Next, I will allow, he's a ranker of health, who's also participating in this hearing, Senator Patrick Gallivan. You're muted, I believe, Senator. There you go.
Got it. Thank you, Chairman. Good morning, everybody. As Senator Rivera said, this COVID crisis affects everybody, and our concern should be everybody and everywhere. And like Senator Sepulveda, concern should be for people in correctional facilities, and that's everybody in correctional facilities, the inmates as well as the staff. And at the same time, we have to make sure that the facilities remain safe and secure from other things. Corrections job is very difficult. There's no question about it. And now throwing this curveball with coronavirus, we have to make sure, and among the questions I'll be asking the commissioner, very interested in, is how are the normal operations going on? How are we still ensuring the safety and security of the facilities while we are trying to protect everybody inside the facility from coronavirus? So I thank the co-chairs for putting this together, and I will thank in advance all the people that are here to testify, particularly Commissioner Annucci and his staff, who I know has their hands full right now.
Thank you, Senator Gallivan. And before I lay down the ground rules for today's hearing, I just want to recognize some of our colleagues that are joining us. Both Senator Gustavo and I will be recognizing people as they sign on. We have with us today, we have Senator Julia Salazar, Senator Pamela Helming, Senator Patty Ritchie, Senator Zelnor Myrie, and Senator Brian Benjamin. Thank you all for joining us today and participating in today's hearing. So let me give you the ground rules. First off is each witness will have 5 minutes to testify. The clock will be viewable on screen in the Zoom gallery view. Each chair and ranker will have 5 minutes for questions. Other members will have 3 minutes. Please use the raise hand function to be recognized. All members and witnesses are reminded to not participate while operating a vehicle. We don't want anybody to get hurt. So without further ado, I'm going to introduce our first panel. With us today is probably the person with the most say of what we're doing at this hearing, and that's Acting Commissioner Anthony Annucci from the New York State Department of Corrections. Good morning, Commissioner.
Good morning, Senator. Joining me, Executive Deputy Commissioner Dan Marticello. Good morning.
Dan, how are you? Hope everything's well, Dan. Good seeing you. Okay, you can begin, Commissioner.
Thank you, Senator. Chairman Sepulveda and Chairman Rivera and other distinguished members of the Senate, thank you for the opportunity to testify before the Senate Standing Committee on Crime Victims, Crime and Corrections, and Health on the very important topic of the impact of COVID-19 on prisons in New York State. This testimony will pertain to the impact of COVID-19 in state facilities operated by the department. DOCS has taken immediate and appropriate actions from the onset of this public health emergency to contain the spread of COVID-19 among staff and incarcerated individuals. DOCS has worked closely with public health officials from the Department of Health, who have provided recommendations based on facts and emerging science. The department has developed a comprehensive pandemic flu protocol that has been modified for COVID-19. We maintain supplies, equipment, and other resources that are being made available as needed for impacted correctional facilities during the spread of this infectious disease. We continuously review our protocols and emergency supply inventories to ensure that the department's policies and procedures are as up to date as possible. The department also has negative airflow isolation rooms, regional medical units, access to a network of hospitals, and emergency control plans for each facility. DOCS has conducted tabletop exercises to prepare for additional positive cases. The department employs medical staff specially trained in infection control in facilities across the state and has contingency plans for each facility in the event of significant staff absences. In addition, a COVID-19 task force has been created and meets regularly to monitor and assess all actions and potential actions in response to this public health crisis. The department's executive team has been in regular communication with all facility superintendents as a means of monitoring in real time all COVID-19 related issues that arise within the system. Ongoing communication is delivered to staff and incarcerated individuals on preventative measures to stay healthy, including recommendations by the CDC and DOH, as well as cleaning guidelines issued by the Office of General Services. DOCS has taken a number of actions to reduce the spread of COVID-19 in order to protect staff and the incarcerated population, including removing non-essential staff from the workplace, the difficult decision of suspending visitation and programs, deploying masks to staff and the incarcerated population, and making hand sanitizer available. We continue to comply with CDC guidance and in consultation with DOH, evaluate all options for additional testing as part of our multifaceted response. The department has continually expanded the pool of incarcerated individuals being tested, which include those incarcerated individuals who are displaying symptoms of COVID-19, all incarcerated individuals who are quarantined as a result of a contact trace, as well as a variety of targeted testing cohorts. To date, we have offered over 13,000 COVID tests to the incarcerated population. The results were 773 positive cases and 11,201 negative cases. Also, the department has had 1,329 positive staff cases, of which 98% have recovered and returned to work. Our test results are regularly updated on the department webpage. Throughout the COVID-19 public health emergency, the department has implemented early release opportunities for individuals that are based on individualized reviews that ensure each person is connected to the services and support that they need to succeed in the community, such as housing and healthcare. These actions have resulted in the early release of 2,850 incarcerated individuals. As of yesterday, the total DOCS incarcerated population was 36,704. This represents both a total reduction in excess of 7,500 individuals since January 1st, and the lowest total incarcerated population since 1986. As New York State continues to implement New York Forward, the department's greatest concern remains the health, safety, and well-being of our employees, as well as the incarcerated population, particularly during this public health emergency. Toward that end, DOCS has developed and is presently implementing a comprehensive and gradual reopening plan that continues many prior initiatives, but also layers in new ones in an effort to minimize any unreasonable risks. As a result of this plan, DOCS has gradually returned non-essential staff, reintroduced a variety of specialized academic and vocational programs, resumed visitation, and reactivated intake from county facilities. As we move forward, it is critical that we continue to follow the science and remind staff, visitors, and incarcerated individuals to wear a mask and to social distance where possible. We will continue to stress that these are simple steps that should be followed to stop the spread of COVID-19 and other respiratory viruses. Thank you, and I will be happy to answer any questions.
Thank you, Commissioner. Right on. Well, you ran a little bit over, but thank you anyway. We will now, what I'm going to do, we're going to do this a little differently than most hearings. Senator Gustavo and I have decided to play cleanup, so to speak. We want to give our members an opportunity to ask questions. And then I guess both of us will check off our questions as we go along if they're asked by our colleagues. So I'm going to begin with Senator Zelnor Myrie. Senator, you have questions? Proceed.
Thank you, Chair Sepulveda, and thank you to Co-Chair Rivera. Commissioner, thank you for taking the time. Good to see you. I want to say at the outset that I've had a number of my constituents reach out to me during this crisis who were concerned about their family members inside, particularly at Elmira and Fishkill. We reached out to DOCS to get updates on protocol at the height of the crisis, and we were not able to receive, I think, satisfactory correspondence. In fact, we got form letters to most of our inquiries, particularly with individuals who had underlying conditions like breathing problems and high blood pressure. And so I just want to put that out there and hope that we can follow up with your office to ensure that the families are getting the most up-to-date information as possible. Secondly, during this crisis, many incarcerated individuals were charged with producing hand sanitizer for the rest of the state. And this was something that the governor touted, something that has been widely used throughout the state. And I'm wondering if you can give us an update, if you know how many incarcerated individuals are currently producing hand sanitizer.
Yes, Senator, thank you for that question. Be happy to give you the update. What I can tell you is that, as you know, we have vibrant Corecraft correctional industry programs throughout the state. They're engaged in a number of activities, and several of them were tasked with the responsibility of shifting and moving to, instead of production of regular sanitizer, the hand sanitizer. It was done at several facilities, Great Meadow to start with, Shawangunk and Albion recently. And I visited Great Meadow and I spoke to the men that worked on that line. And I can tell you that, like all New Yorkers, they were very proud to contribute to what they considered to be life-saving measures. I'm sure that there are individuals alive today because of the hand sanitizer that they produced. Now, we recently stopped producing hand sanitizer at Great Meadow. We produced enough. We're winding down at the others, and I believe Dan might have the current numbers of totals produced.
Yeah, to date, we've produced and distributed over 6 million bottles of hand sanitizer, and also have a supply that we provided to the OGS for storage for future deployment in the event there's a second wave or a need for additional resources.
Thank you very much for that update. And I appreciate that you have recognized how important this role was during this crisis and in preparation for perhaps a second wave. And my hope is that we will begin to compensate those who are incarcerated at a fair wage, given their important role in saving the state. I don't have that much time, and so I wanted to focus the latter half of this on the collateral mental health consequences of this crisis. And I'm wondering if you can speak to anything that Docs has seen on the inside dealing with higher rates of violence or suicide or any mental health consequence associated with COVID-19. This is something that we are grappling with throughout the entire world, and we have seen collateral consequences. And I'm wondering what Docs is doing and what you have seen to help people deal with this, particularly because there have been reductions in programming, which I think had been necessary. And just wondering if you can speak to that.
Thank you, Senator. First, we do have a significant proportion of our population that are on what we call the OMH caseload, meaning that they do require some level of services, sometimes acute situations that require a high degree of services from OMH that had to be suspended. We are gradually reintroducing those services so that those individuals who are separated can get the needed out-of-cell programming and therapy as we move forward. We want to do that in a responsible manner. So that is a condition that normally applies, that we're trying to move responsibly to restore services. We're mindful of the stresses that all of society is at. I think I can say, though, that everyone in our system, all staff, all incarcerated individuals, the parolees, the community supervision staff, recognize, and sometimes in a crisis like this, people come together, they're understanding, they're patient. We have put out over 1,000 memorandum to the system on just dealing with COVID-19. I have 6 binders worth of materials that we put out. At the height of the crisis, every single day, Monday through Friday, we had conference calls either with our hub superintendents Monday, Wednesday, and Friday, and with our bureau chiefs, regional directors Tuesdays and Thursdays. So we monitored everything in real time. We monitored unusual incidents. We monitored assaults. Basically, nothing that was a significant uptick. But certainly we appreciated, we got the message out that we appreciated their patience, their cooperation as we get through this crisis and get to the new normal that we hope we'll achieve soon.
Thank you.
Thank you. We've been joined by Senator Bailey and Senator Mayer. so that they know if any of you would like to ask questions, please raise your hand on the chat and we'll call you. I will now call Senator Patrick Gallivan.
Good morning, Commissioner and Deputy Commissioner. It's
Morning,
nice to see you. I wish it was in person.
Thank you.
First, I'd like to just say that, I mean, to you, your executive level staff, and then of course the entire workforce should be commended for the steps that you've taken to control this coronavirus, especially at the beginning when we had no idea what it was. And I've talked to a number of individuals, both correction officers all the way up to the superintendents. And I know so many of your facilities did not have one instance of coronavirus throughout. And no doubt it's because of the steps you've taken and the hard work. One of the steps that I believe that you've taken, I want to ask you about is, my understanding correct, that you have now eliminated the double bunking in the medium correctional facilities?
Well, first of all, Senator, thank you for acknowledging the hard work of staff. Just like all the other first responders, they had no choice. They had to come to work. They had to manage the prisons, and all of them are heroes in my book. Thank you for acknowledging them. With respect to the double bunking, the top bunks, I put out a memorandum last week that we would facility by facility be dismantling, not physically taking them down, but taking them out of use. So if we ever need them in an emergency, we can do that. And our strategy has been to achieve disbursement wherever possible. So we have thousands upon thousands of vacancies throughout the system. To give you some historical perspective, we are well into the third term of Governor Andrew Cuomo. The last time the population was this low, we were still in the first term of Governor Mario Cuomo. So that has enabled us to disperse the population and no longer rely on the double bunking that we had, where we had as many as 60 in a dorm.
So will we anticipate going forward a stable or a continuing reduced statewide jail population? So absent the emergency, we can assume now that we will no longer have the double bunking, that this will be something that will be the standard practice going forward.
Well, what we're looking at, Senator, is a continued dramatic decline in the state prison population. If you recall my testimony in January, I pointed out that calendar year 2019, which was before COVID-19 was even part of the vocabulary, that was the single greatest decline ever in the history of this agency, 3,100 plus decline. And this is well after the Rockefeller drug laws kicked in, and that was during the first decade of the new century. So long-term trends have really declined the population, and that decline only got accelerated by all the additional factors in 2020, including the COVID-19. So we're not looking at anything yet that even indicates the rate of decline is slowing. And we've just started intake, and the backlog in state readies is not very big. It's not like we've been building up in the counties 1,000 or 2,000 individuals that are waiting to come in. Those numbers are very low. I think close of business yesterday was under 400 state readies that are waiting to come in, and we're doing that gradually and steadily. Intake is now 3 days per week.
Thank you. If I could talk about the drug testing, my understanding is the drug testing, because of coronavirus, ceased sometime around March for the obvious concerns, which I understand the step that was taken at the time. But now that we know that there are safety precautions that we can take, and we also know what can happen with drug use in facilities and what it can lead to, when will you start the drug testing again, if you haven't?
Well, it's a bifurcated question. One is that we had to stop drug testing because of problems with the vendor that we had in effect. We're going to a new vendor. And Dan, I believe the new contract has been approved by the controller.
Yeah, correct. In terms of the urinalysis testing, where we had initially suspended, we've now promulgated a contract for outside confirmatory laboratory testing. We have resumed doing suspicion testing. We have not resumed just random testing of the population. So we are doing some level of testing where appropriate. And we anticipate with the new contract, we'll be getting back to a regular testing regimen.
All right. My time is up. Thank you.
Thanks.
Thank you, Senator Gallivan. If time permits, we'll see if we can have a second follow-up to ask more questions, but we'll see how much time we have and how much time the commissioner has. Now I'm going to call Senator Brian Benjamin to ask questions. Senator.
First of all, thank you so much, Co-Chairs Sepulveda and Rivera, for taking on this very important topic at this time. Thank you, Commissioner, for the work that you're doing and for being here. My time is limited, so I'll be very quick. I want to, for me, short of a vaccine, testing is the essential issue. So I want to ask you a couple of questions on that front. You mentioned that incarcerated individuals as well as staff have been tested. How frequently does that occur?
Well, we greatly increased the rate at which we are testing. And we started out testing, and I'll read very quickly the order. Incarcerated individuals displaying symptoms, then those who were quarantined as a result of a contact trace. Then we tested all the individuals in our 5 regional medical units. Then we tested the individuals on our senior living dome at Ulster. Then we tested all pregnant or postpartum incarcerated individuals at Bedford. Then system-wide, we tested all individuals 55 and older. And as a result of that, we got back out of 77 positives, 58 at 4 facilities. So that we then decided to test all the population at those 4 facilities, which were Shawangunk, Wallkill, Greenhaven, and Fishkill. Then we decided, since the female facilities weren't too far from there, we tested Albion, Bedford and Taconic, as well as Albion. When you do testing, you have to stop all movement. So we figured if we did the females, it would be minimum disruption. And now we decided to test all of the facilities in the Western Hub, which is our largest hub. And we've divided up into 2 parts, and we were going to complete the first 5 facilities: Rochester, Attica, Groveland, what else, Dan?
Orleans and Wyoming.
Orleans and Wyoming. So those will be completed today. Then we're going to do the rest of the hubs in that facility. One of the reasons we decided to do the Western Hub was because there was a slight uptick in the communities where those facilities are. And so far, we have not gotten back a single positive. I can tell you that the number that we tested in that, the results right now for those 5 facilities, 3,363 submitted, 3,254 negative, 0 positive, rest pending.
Gotcha. All right, I see my time running. So let me shift to another question here. One of the things that you mentioned in your testimony was that visitations were not being allowed due to COVID at this time. A, can you expound on that? And B, if visitations aren't allowed at this time, what is the system facilitating to help make sure that incarcerated individuals are getting the opportunity to communicate with their families and loved ones in a very trying time? To some of the points that Zelma was making, Senator Myrie, we want to make sure that incarcerated individuals, particularly in a time like this, and their families are able to connect and communicate if visitation is a problem.
Senator, we have resumed visitation. We initially had to suspend it, but resumed it August 5th in our maxes and then the weekend system-wide. So we put in a number of restrictions and conditions to minimize the risk. We do screening of visitors up front. We're operating at half capacity. We use a requirement for everybody to wear a mask. We're only allowed to do a brief hug at the beginning of each visit and at the end of the visit. And we use clean the vending machines when they use them. We recognize visiting is important. And that's why, as we test going forward, we want to see if there's any increase in positive cases now that we've had visitation open since early August. We also continue to make available free phone calls through our vendor and free secure messaging. That'll continue for some time. So we recognize visitation, communication, very important for families. It's fundamental corrections, strengthen family ties.
Thank you.
Thank you. Senator Benjamin. Next, we will have, oh, and I want to recognize that Senator Brad Holloman has joined us. Welcome, Senator. Next, we will allow Senator Julia Salazar to ask questions.
Hi. Thank you for joining us today, Commissioner. I want to start by asking about deaths in DOC's custody. How many people in total have died in DOC's custody since the beginning of this crisis in March of 2020? And how does that rate compare to the same time period in 2019? Do you know?
Well, I can tell you that first we've had, unfortunately, 17 incarcerated individuals that have died as a result of COVID-19, 5 staff, and 4 parolees. I can get that number comparatively, the total deaths for that period in 2019. I don't have that off the top of my head. What I can also tell you is that I've been in touch. I'm a member of an association. Every corrections commissioner in the country is. And in comparing other systems with far less population, they have had 3 times as many deaths. I know New Jersey, unfortunately, has had a high number of deaths. So any death is one too many, but we are at least gratified that it could have been much worse. A lot of hard work by a lot of people to produce a comprehensive response to keep everybody as safe as possible.
Do you know what the demographic breakdowns are for the people who died in DOC's custody this year, and perhaps how many of them had a pending clemency application or had a scheduled release date when they died?
I don't have that off the top of my head. I do know that that demographic information was requested by, I believe, Senator Sepulveda, and I believe I did provide him with demographics on that. I can't answer for any of them having a clemency application, but I can tell you that geographically they were concentrated in the areas closer to New York City. And as you may know, we have a policy of closer to home transfer. So people are awarded with transfers to facilities that are closer to where they came from. And a lot of the individuals come from New York City. So that is where a lot of them ended up. And that unfortunately could impact the racial demographics of who died as a result of this disease.
Thank you. Just for my final question, due to time, are there any deaths that you believe or could reasonably believe were caused by COVID-19 but have not been included in the official count? And are there any deaths from since March of 2020 that still have no official documented cause?
Actually, Senator, we included in that 17 a death that really should have been a cancer death. The person had been to an outside hospital. He was diagnosed with COVID, but he also had cancer. He was released back to a facility. He ultimately died, but in the interest of being all-inclusive, we counted him as one of our deaths, so he's one of the 17. I am not aware of any other situation. We are scrupulous in making sure if it's COVID, we're going to count it as a COVID death.
Thank you. No time's up. Appreciate it.
Thank you, Senator Salazar, for your questions. You may have an opportunity to ask afterwards. So next, we're going to give the floor to Senator Helming. Senator Helming.
Thank you, Senator Sepulveda, and thank you, Senator Rivera, for hosting this hearing. Commissioner, it's great to see you. Mr. Monticello, good to see you again. As Senator Gallivan said, I wish we could hold this in person and we weren't looking at each other as these little square boxes on our Zoom. I heard part of Senator Gallivan's questioning and discussion and some of your responses over the double bunking issue. This is an issue that for many, many years, several of us have been advocating for the removal of double bunking. This is an issue that's supported by advocacy groups for our incarcerated individuals. It's supported by the correctional officers organization and so many others. In my opinion, it's important for me personally that we take action as a legislative body to eliminate the practice of double bunking. I'm extremely, extremely disappointed that the Senate didn't take this action and pass this legislation when we were in Albany over the last couple of months. But you have talked about changing policy, and I'm just curious, how important is it in terms of health and safety for both incarcerated individuals and the people working in the prison system that once and for all, we stop the practice of double bunking by legislative action?
Well, Senator, as you know, I never comment on any pending item of legislation. I can tell you that I put out a memorandum and either last week or the week prior that system-wide, I think it's 3,188 top bunks that we are taking offline, meaning that no one will be able to be housed in those bunks.
Okay, Commissioner, I'll find your report and I'll read it. So you don't have a comment on whether or not it would help your case if you had legislative action taken?
I can't comment on legislation.
Okay, good. I just want to go back to a moment. Senator Benjamin talked about testing, and I'm curious, when a corrections officer is forced to mandate to quarantine for a certain period of time and therefore absent from work, how is he or she, are they paid? Do they continue to get their regular pay? What if they're out of sick time? And how does that impact your overall workforce?
Well, the question goes to the circumstances of when someone was quarantined and then what circumstances. Early on, if they were quarantined as a result of
Yeah, the Governor's Office of Employee Relations put out direction to state agencies that is, if someone is quarantined as a result of contact with a known positive or is positive for COVID-19, that they remain in full pay status without charge to leave accruals.
So they shouldn't be mandated to use their sick time. That's good to know. And I'm almost out of time, but I want to just comment. I'd love to come back to talk more about PPE, visitation, the transfer of prisoners, what was happening. Thank you, Senator Sepulveda.
Thank you, Senator Helming. I just want to put out there, I understand that there are peripheral issues that impact COVID. Talking about double bunking, I understand it's important. We have a bill, I have a bill for double bunking. But I just hope that my colleagues can focus specifically on COVID and the impact on facilities and not bring up peripheral issues that really are not on topic what we're trying to accomplish today. I gave leeway to my colleagues, but going forward, if I think anybody's deviating, I may not give as much leeway. So thank you very much. Next to speak is Senator Bailey. Senator Bailey.
Good morning. Let's see. Good morning, everybody. Thank you, Senator Sepulveda and Senator Rivera. It's good to see justice running through the Bronx. Commissioner, I wanted to ask a couple of questions. The first being concerning transfers. I've had a lot of questions from constituents who, since transfers have been resumed, the individuals and their family have been moved to locations further. Can you comment on when when transfers were resumed and what the rhyme or reason was behind them?
Well, first of all, Senator, the ability to move from one facility to the next is critical to our operations. When we had to lock the whole system down, that was a shock to the system in that everybody had to remain in that correctional facility, regardless of security concerns or known enemies, et cetera. We did the best we could, absent really exceptional circumstances. So now we reached a point where we can slowly resume transfers, which are made for a lot of reasons. But as we move forward, one of the things we're trying to do is make best use of our facilities where we have the most vacancies and spread out the population. It's not typical that somebody, unless I'm missing something, is getting moved to be away from their families further. But I'll look into that. We'll see. Dan, are you aware of anyone that's gotten moved?
No. And also just one additional point is, as we started to do transfers within the system, in order to reduce densities on our transportation vehicles, we reduced the capacity. So the numbers that transfer each week are much lower. So if it's a 40-person coach, we're only putting 20 individuals on it. A 20 person, we're only putting 10. So that has slowed some of the movement, so we can be very methodical and specific and intentional about the movement going on in the system.
I have limited time, and I have a specific instance that I'll be happy to forward to you after the point of the hearing. The next question is, we spoke about testing and the vaccine. At some point in the near future, we are going to have a vaccine. And as it is always said, those who fail to plan to fail. Is there a plan, once a vaccine is in place, to ensure that the individuals who are incarcerated, who have a right to healthcare just as much as anybody else does, is there a plan for them to be able to obtain that vaccine? And again, it's not population-based, because hopefully the population will continue to decrease once we get that vaccine. But is there a plan? How are we going to administer it in the facilities throughout the state?
If there is such a vaccine, Senator, I envision it operating the same way that we are presently administering the flu vaccine. We just got our first 3,000 doses of the regular flu vaccine. We're offering it to the individuals in our regional medical unit and Adirondack. We're expecting the next batch of about 10,000 shortly. There was a slight delay in that flu vaccine, but we make that available to what we consider to be the vulnerable populations, and then to whoever else after that asks for it. And so just the way that operates, we envision that if a vaccine is available for COVID-19, we'll make it available in the same way through the same types of procedures.
Yeah, through our centralized pharmacy operation, we have multiple contracts with drug vendors to ensure that we receive adequate supply and have the ability to place orders. So as the commissioner mentioned, just like the flu vaccine, we would be in line for that vaccine as well and would begin to administer it to the population.
All right. Thank you for the opportunity to question, Chairs. Thank you, Commissioner.
Thank you, Senator Bailey. Next, we have Senator Shelley Mayer. Senator?
Yes, thank you, Senator Sepulveda, Senator Rivera. Thank you, Commissioner. Nice to see you. You know, I have Bedford and Taconic in my district, so my questions are specific to that. Senator Salazar asked you about the number of deaths due to COVID. You gave the number. Do you have that by facility?
Yeah, it's on our website. I think 5 were at Fishkill. Sing Sing was one of them.
Do you know Bedford or Taconic had any?
One woman from Bedford, I believe.
Yes.
did pass away.
Okay. You mentioned about across the board testing in the Western New York sphere, or whatever your term of art is. Did you do across the board testing at Bedford? Because I think, as you know, during the height of the pandemic, we certainly had a lot of complaints about Bedford's living conditions and the need to do testing. Was there across the board testing done at Bedford?
We've tested all limited Bedford, Taconic, and Albion. We initially tested the pregnant and postpartum individuals at Bedford, and then we tested the entire population.
At Bedford?
At Bedford, Taconic, and Albion, yes.
Oh, and Taconic and Albany. Okay, and lastly, on May 14th, together with Senator Sepulveda and Senator Harckham, I wrote a letter to the governor, CC to you, requesting that basically we would expedite release of those who were either scheduled to be released this year, to basically speed up their release, to accelerate the parole process, and that the superintendents could make recommendations for release given the issue of COVID. We did not receive a response to that, but I would like to ask, was there any acceleration of the parole process for those who were eligible for parole this year so that parole hearings could be heard earlier? Because my understanding is the parole process was slowed down, not expedited during this process.
Senator, what we did was a huge initiative that basically expedited the release of approximately in excess of 2,000 individuals. Those who were scheduled to release had a release date of 90 days.
Yeah.
What we did was we put them on the out count of residential treatment facilities. So they're still counted as the population, but they physically are in the community. They're supervised by parole officers, and they're no longer behind the walls. So even in our figures today, where the population is listed as 36,701, is at least several hundred that are in this status, no longer living behind the walls, but are in the community. And in addition to those that are not convicted of an A1 or an A2 or B through E violent felony sex offense for that category and have residence when they get released, we also took the pregnant individuals and postpartum, and if they were within 6 months of their release date, we put them into that status, so they're no longer living behind the walls.
Was the age of an inmate in and of itself a factor in having someone be considered for one of these earlier release programs?
It initially was, we started with, I believe, 55 and older, and then we just removed age as a criteria. So it applied to anybody who met those criteria that I just described, who was within 90 days of the release date, or female that was within 6 months.
But not of the, you did not, were the parole process expedited? In other words, more parole?
Nothing separate was done to expedite somebody's appearance before the parole board.
The chairwoman of the parole board, though, did provide direction to the commissioners when holding parole board hearings that if an individual was eligible for an open date or earlier, that they would exercise that ability or strongly encourage. Obviously, each parole board determination is based on the commissioners and their independent decision-making. The department does not play a role, nor can the chair influence those outcomes, but it was reminded that that was a possibility in those instances.
Thank you. Thank you very much, Chairman.
Thank you, Senator Mayer. Next, we will give the floor to Senator Betty Little.
Okay. All
Are you
right.
there?
Yeah, I am. Just a second.
Alright.
I'm
There you go.
sorry. All right.
I hope you're not driving.
I am not driving. I am sitting in my car, but I had an appointment I had to get to and did not want to miss this. I want to thank you for having this. I also want to thank the commissioner and Dan for how they have really prevented this from being a catastrophe. I have 9 facilities in my district. They're all congregate settings. They're very similar congregate like a nursing home, and yet we have avoided major deaths in these. Yes, every death is sad, but it could have been so much worse. It's just amazing what you have been able to do. The extra space that we have is important, and I know that that has helped. I'm glad that you have taken away the double bunking in the dorms. I know that with the space we have to avoid anything in the future, one thing we've learned is maybe being able to have less than 50 even in a dorm facility so that they have more space and less congregation and fewer people using the same bathroom that is associated with that. But I can't say enough about what you have done. All the correction officers as well. I mean, they really worked hard, took precautions to make sure they weren't being exposed to COVID and they weren't going to bring it into a prison. And it's just been phenomenal what you have accomplished here. I know Franklin Bear Hill and Upstate have had times when they have had people quarantined and they had a separate place to quarantine them, a dorm and all, and yet we've never had a case. So very important for what you've done. The other question I would have, I'm glad that we are back to doing some visitation. That is so important to these people. The loneliness, the isolation is tough. The free calls and everything that you've accomplished has got to be very helpful. But are the work release programs going to be able to be started in the near future, or has COVID really curtailed those going forward?
Yeah, we've resumed work release as well. So individuals are going back out, they're going to their jobs, and we're continuing to monitor that as well as all the other regular visiting we're doing to make sure that we are keeping COVID at bay as best we can.
All right, and the new facility at Adirondack for older inmates, 55 and older, I think was a great idea. So I'm very happy to see it utilized that way, since the teenagers, fortunately, are not going to prison like the people thought they were. So I just want to thank you very much. You've done a great job. It could have been It could have been a really huge problem for the state to have had this spread within our prison population. So thank you.
Thank you, Senator, for acknowledging the staff. I think we have the best staff in the country, not just the ones that come to our correctional facilities and community supervision, but here in Central,
Right.
our healthcare staff, the infection
Right.
control nurses, phenomenal work.
Absolutely, and all essential workers, and they worked hard to make sure they could still work and be there and help out and not carry this into the prison. So they are phenomenal group too. Thank you.
Thank you, Senator.
Thank you, Senator Little. Next to Matt is Senator Brad Hoylman.
Thank you. Thank you, Acting Commissioner. A couple of quick questions because we only have 3 minutes. First, you mentioned the flu vaccine. Is every incarcerated individual entitled to a flu vaccine?
Well, we don't have enough vaccine to vaccinate every single individual, so we have to prioritize by
Do you have to ration flu vaccines?
the supply we've gotten or able to get is about 13.
Okay, I find that absolutely unacceptable. Second question, I wanted to ask you about antibody testing. Have you begun to explore whether individuals carry the COVID-19 antibodies? Is anyone entitled to an antibody test?
Antibody testing was done for the staff, and Dan can give you the specifics on that when it was done.
Yeah, we offered antibody testing to the staff statewide, and it resulted in approximately a 7.9% infection rate in terms of those that had antibodies, which was well below what we found in the community at large. So it just shows that with essential staff, wearing the mask was extremely important to make sure that we reduce the spread of the virus.
So no incarcerated individuals have been tested for antibodies?
No, only diagnostic testing, sir.
Is there any plan to test individuals who are incarcerated for antibodies?
So the focus right now is to do targeted testing in the form of diagnostic testing, as well as test those that display symptoms or are part of a contact trace. So that is the focus as of now.
So given the rationing that I hear from you about both the flu vaccine and antibody testing, are we to assume that if and when there is a COVID vaccine, say early next year, that that's going to be rationed too, and that incarcerated individuals are not going to be entitled to a COVID-19 vaccine?
No, Senator, as we spoke earlier, we have a central pharmacy where we have relationships with drug providers that will allow us to gain access. And in terms of the flu vaccine, while we have 13,000 on order and committed to coming to us, we've placed an order with in excess of 30,000. So we're anticipating that we're going to be able to administer it to large parts of the population and hopefully the entire population as we move forward. So
I hope that's the case. And my final question, I know docs released select incarcerated people age 55 and older during the pandemic and also tested everyone 55 and older. Could you explain why age 55? Is this the age at which docs begins defining people as older incarcerated individuals?
I think 55 and older was an original dynamic in our release process, but recognizing this virus is impacting people of all ages, we dropped that age requirement early on, and we've expanded it to anyone that met the crime cohorts as previously testified by.
And finally, is there any distinction of who has been diagnosed with COVID-19 and who has died from COVID-19 who might be age 55 or older? Are you able to tell us that?
Again, the commissioner can get the demographics that are available. We've had 17 deaths while in custody, one of which was really of cancer, but we could get the specific information in terms of age if that's something you're interested in.
Thank you. Yes. Thank you so much. Thank you. Thank you, Mr. Chair.
Thank you, Senator Harlan. The next person to question will be Senator Robert Jackson.
Start video. Well, good morning, everyone. And first, let me thank the co-chairs, Sepulveda and Rivera, for holding this hearing. And good to see all of my colleagues, Commissioner. And let me thank you and your staff for coming forward to this hearing. I represent about 13 miles of Manhattan, and Edgecombe Correctional Facility is in my district. Are there any reported cases there of either the residents, meaning incarcerated individuals, and or staff, to your knowledge?
Yeah, in terms of the incarcerated individuals, we have had 0 cases of incarcerated individuals at Edgecombe Correctional Facility. Unfortunately, we did have a staff person from Edgecombe that did pass away as a result of COVID-19. We've had 5 deaths among staff to date.
Not 5 at that facility or just overall?
No, overall.
Okay, thanks. And I heard one of my colleagues asking about whether or not staff have to use sick leave if in fact they contact COVID-19 or have to be 14 days of isolation with respects. But research has shown that people that are positive and then they're recovering, the recovery is even longer than 2 weeks. It could be several months and they still have symptoms. To your knowledge, have employees that have been out that may have used their sick leave beyond a 2-week period of time, are those turned into workers' compensation cases, if you know?
I'm not aware of them transitioning to any workers' compensation cases, Senator. I do know, as I mentioned before, that the Governor's Office of Employee Relations has put out the policy in terms of the 14-day without charge to leave accruals. If it's been turned into workers' comp, I'm not aware of any cases.
Earlier, approximately 9 o'clock, Community Alternatives held a press conference and some of the individuals that were at the press conference has lost relatives as a result of COVID-19 in the correctional facilities. Are you listening to what Community Alternatives is saying with respect to their relatives and inmates or the incarcerated individuals in the state prisons?
Senator, we have ongoing dialogues with various advocacy organizations. We have periodic phone calls with them, such as with PLS, Correctional Association, Alliance, I forget the full title. And we give them real-time information. We answer their questions as best they can. They relate back to us what they're hearing from families, including, by the way, when they gave us the feedback and said, look, when visitation has been suspended for so long, to not even allow a brief hug at the beginning of the visit, that's important. So we said, okay, let's allow the brief hug at the beginning and end of the visit, and we will continue to listen to them. Dan, anything you want to add?
No, the calls that happen about bi-weekly are really been invaluable in getting feedback from what the advocates and really our partners are hearing from the families of incarcerated individuals. So we can look at those issues firsthand and respond, as well as keep them educated. You know, there's a lot of rumors, there's a lot of things that you read in the press that aren't exactly accurate. So this gives us an opportunity for them to hear from us firsthand, and in turn for us to hear from them and make necessary changes as are appropriate.
Thank you.
Thank you, Senator.
Thank you, Senator Jackson. Is there anyone, any other member other than Gustavo or myself who want to ask questions? All right, seeing none, Senator Rivera will now follow, and then I will follow Senator Rivera when he's complete. Senator Rivera, continue.
Thank you, Mr. Chairman. I've got quite a few, so we're going to go right into it. Good morning, folks. First, on early release, in your testimony, Commissioner Arnucci, you spoke about early release opportunities. Could you describe what these early release opportunities are, and can you tell us how many incarcerated individuals were released because of these opportunities that you described?
Yeah, I believe I mentioned earlier, it was over 2,000 individuals that were released early, and the word release should really be replaced by transition. They're still counted as a population. They're living in the community. It was anybody that was within 90 days of their regular release date, we let them physically leave the correctional facility. So all told, that was over 2,000 individuals, as well as in local custody, there were about 721 technical parole violators for whom we lifted the warrant when we decided that they could be safely released, as long as the underlying violation wasn't serious, wasn't related to a domestic violence situation or a sexual misconduct situation.
Gotcha. So let's talk about quarantining for a second. Of the folks that you found that were positive, did you place any folks in special housing units when in solitary confinement as a means of quarantine?
Well, what we did, Senator, at Fishkill in particular is what you're thinking of. We converted what had been an area used for special housing or used to separate these individuals, keep them safe. What they were provided with, first of all, each cell is 105 square feet, has its own sink, shower, and toilet. We provided to them 3 tablets, one of which included the capability of making telephone calls to their family. One was a law library tablet, regular tablet, and they had their property as well. So it had been previously used for SHU. We converted for use to quarantine them safely and comfortably, basically under general confinement conditions.
So general confinement, so you did place people in solitary confinement to quarantine them.
It wasn't solitary confinement, Senator. It was physically previously used for that purpose. We converted it, just like our.
So the conversion, just so I can understand, sir. So what has the conversion, what did the conversion makes it a non-solitary confinement setting? Besides you calling it something else?
Property, having 3 tablets, the ability to make phone calls to their family, and add a cell phone.
Yeah, they had the same privileges that anyone in general confinement would have, or anyone serving in quarantine in any other location in the institution would have during that time period. It just provided them, instead of really living in a dormitory setting, multiple occupancy where they're sharing toilets and they're sharing sinks, it provided them with their own individual shower, their own sink, and their own toilet during that period.
Okay, so let's move on to testing. There was a conversation that you had with Senator Hoylman about testing. And so you spoke consistently about testing all staff, and that's perfectly fine. But you said that that as far as incarcerated people, so the people that are being held, they were not tested at the same rate in any way, shape, or form. Correct? You said that it was only I will paraphrase you. You said if it's needed. In other words, if there's people who are symptomatic, is that what you meant by that?
No, Senator, we are testing significant cohorts of the population. We're testing entire facilities at a time right now. The entire hub is being tested. All the populations at the 4 facilities I mentioned, Shawangunk, Greenhaven, Fishkill, Wallkill, Albion, Taconic, and Bedford. The entire population at those facilities were tested. The entire Western Hub will be completed by the end of September. Then we will decide where we go next. So significant cohorts of the population are being tested. To date, we've offered over 13,000. That number will significantly increase in the days ahead.
Okay. As far as contingency plans, so we're talking about whether there's a second wave, you spoke about contingency plans for each facility. And do those plans include regularly testing staff as well as incarcerated people system-wide?
Contingency plans are both facility-specific and department-wide that we create here at central office. And one of the things that's important is to have a really strong infection control unit, which we do have. We have 13 nurses that are infection control nurses. They step in whenever someone is a known positive. They identify who the contacts are. We then, at each facility, have what we call a 3-legged stool. One area to segregate those that are symptomatic, one that are just positive, and one that are quarantined as a result of a contact trace.
Since I only have limited time, I just want to say there was a conversation you had with Senator Zalazar a while ago, in which he asked you specifically about how many deaths you've had since March 2020, the racial demographics of those deaths, and how many people have died pending clemency applications, right? And you said on the record that you did not have those numbers, but you would get them to us.
Yes, and I believe I gave the demographics on that previously to Senator Sepulveda. I'll dig out the old letter. I'll make it available again. And I don't know if anybody had a clemency application, and I'll check.
Okay. Thank you, Mr. Chairman.
Thank you, Senator. And I think we'll give a little bit of time for a second round for some people. But I want to break down by topics a lot of the questions that I have for you. But let's start with I believe that the numbers indicate that as a state, we have tested far less incarcerated individuals than other states. Is that accurate?
I wouldn't say that's accurate, Senator. I'm on the phone regularly with correctional systems around the country. Everybody's protocols are different, and clearly we are significantly increasing the number and volume of tests we're performing.
Okay. Is that, now that the CDC has changed guidelines in terms of testing to include people that are asymptomatic, is that going to follow those guidelines?
And we've always tested people that were asymptomatic if they were part of a quarantine, a contact trace.
At all facilities?
Yes.
Okay. How many people, what percentage of the population have you said has received, that are asymptomatic, have received testing or have been tested?
Can we get that information?
Yeah, Senator, I mean, we've tested over 13,000 individuals. Right now, we are doing targeted testing in the West and the Western Hub, which will result in over 7,000 tests just in that area. And previously, we had tested targeted testing across the system, majority of which was asymptomatic testing. The over 55, the regional medical units, those pregnant and postpartum individuals, senior living dorm at Ulster, as well as the 3 female facilities and the 4 facilities in the Hudson Valley. So we've done large segments of the population who were asymptomatic, but it was targeted testing, and we'll continue to move throughout the system once we complete these 7,000. Our focus now is to get the swabs done, get the results back so we can identify the next geographic area of the state that we can focus on.
Are you in a position to test everyone in the facilities?
Again, we continue.
Including staff, I'm sorry, including staff.
So we continue to look at our next steps. We're focused on the 7,000 now, but we will be moving to other geographic areas of the state. In terms of the staff, Docs is not performing tests on staff. Early on, the governor, under his executive order, identified correction officers and other correctional staff as first responders and essential staff that can get tests through their providers and or a testing site run by the state. When that was expanded to allow for any New Yorker to receive testing, regardless of symptoms, again, all of our staff qualify for that. So they're eligible in the communities to regularly be tested as anyone else.
So you indicated that you've tested now, correct me if I'm wrong, about 13,000 individuals that are incarcerated?
Yeah, that number will dramatically go up. As the commissioner indicated, we're doing the 7,000 right now in Western New York, and then we'll be moving on to other parts of the state. So in the coming weeks, you'll see that number grow by over thousands of tests.
All right, so the population right now, I believe, is about in excess of 32,000 individuals that are incarcerated at the state. So we have like another 15 to 20,000 to go before we test everyone. Is that accurate?
That's approximately, yes, sir.
And the goal is to test all of them. Is that correct?
Yeah, we continue to explore all testing options. Again, we're focused on the 7,000, but we'll have sufficient testing capabilities to continue testing the population.
Let me ask you some questions about PPEs for individuals that are incarcerated. How often do they get new masks?
We replace them as needed. To date. It's either 10, 12, or even more that have been provided to the population. Corecraft has made a number. We've gotten some from our stockpiles. We've gotten donations, so we make sure that everybody has sufficient supply of masks that they can reuse and wash as needed.
So if everyone, so you make sure that you provide masks for every single incarcerated individual in the state system?
Correct.
Is that what you're saying?
Yes, sir.
Okay. Are they, by the way, do they sell the mask in the commissary just in case someone wants to get their own masks?
No, we don't sell the masks. We're providing them free of charge to staff as well as the incarcerated population. As the commissioner mentioned, we've partnered with a few advocacy groups that wanted to make donations to the population, as well as our own stockpiles. We've distributed over 12 masks, statewide, and then we've provided direction to facilities that as new masks are needed and they need to be replaced, they should be readily replaced for the incarcerated population.
Okay. Now let's go to, again, I'm trying to, the questions ask them in a particular subset of groups. Let's talk about housing within the facilities. dorms, you still have 60 people in 50-person dorms.
No, that's not correct, Senator. As I mentioned earlier, the top bunks have been dismantled. So in dorms where there were 60, where we had the back 10 as doubles, those have been removed offline.
And Senator, early on in the pandemic, the direction to our facility superintendents, even before the commissioner's recent taking down a memorandum to the system, we directed them to minimize and or eliminate where practical the use of the top bunks. Obviously, in some facilities where close to home and the facility was close to capacity, it wasn't initially available. But through that initiative, we had over 98% compliance in terms of vacancies in top bunks, which allowed the commissioner to provide the direction as of recent to take them actually out of the ability to be used whatsoever.
All right, thank you. Now, are there penalties to both the incarcerated individual and staff for not wearing face masks?
We put out direction on that, and initially we're trying to get individuals to comply because it's in their best interest. But it is mandatory for staff to wear masks, and we've put out stern instructions that all staff need to be reminded this is not an accommodation, this is not a request, this is a requirement. You have to wear masks at all these situations. We have not yet, to my knowledge, disciplined any incarcerated individual who is not wearing a mask, but neither will they be admitted to the area or allowed to stay in a program area that we're starting up if they're not wearing their mask.
Okay, and you said you haven't issued any penalty to either a staff member or an incarcerated individual for not wearing it.
That's strong direction that discipline is a possibility if people do not follow it. It is mandatory.
Okay. Now, I have visited some of the, as you know, some of the facilities throughout the state, and some of the shoes that I've seen are not well ventilated. Are you giving people fans? Are you keeping windows open? How are you working with the ventilation issue?
Sure, we're looking at the ventilation in all of our facilities. Most of the ventilation is fresh air ventilation throughout our system. We readily deploy fans throughout the areas as well as keep windows open. Obviously, if we're talking about a quarantine area, we want fans pointing out the window. We're not trying to spread the virus in the air. So particular instructions on the utilization in fans in quarantine areas or known areas of isolation have been issued by our chief medical officer.
How are you keeping people separated from each other in the max cell blocks?
So in the maximum security facilities, each individual has their own cell, which is helpful in keeping them separated, unlike the medium security prototype dorms. But we've put a number of protocols in place about movement throughout the facility with demarcations on the floor. We're sitting every other seat in the mess hall. In the visiting area, we've reduced the capacity. And in our academic and vocational classrooms, we've also reduced the capacity within that setting, making mandatory mask wearing for visits and programs, and we're all walking to the mess hall.
Okay. Now, are you screening staff as they come into the facilities?
Yes.
Yes, we have a questionnaire that we have staff upon entry into the facility, as well as we take the temperature.
This anytime.
If I may, since I know that you're the chair, but I'm co-chair, and you're very much over time. We need to move on. So if it just, there's like one last thing that I wanted to just get, which will take 30 seconds, but just so that.
Well, I'm going to give you a second. We're going to give a second round, Senator Rivera. So I was going to complete and then pass it back to you, and then any other member that has any additional questions. Is that okay?
Yeah, just, remember, we got a lot of people on the list.
Yeah,
Here till 7
I
a.m.
understand. But Commissioner Nushi has a big part of what we're trying to accomplish. So
Certainly.
all right, so let me continue. I'll have a couple more questions. How many people are currently in quarantine in our facilities?
Among the incarcerated population, as of this morning, we had 8 individuals currently in quarantine.
Say the number again. I'm sorry, I didn't hear you.
8.
Okay. Now, With respect to testing, assuming that the percentage of people testing positive increases and programs are again suspended this fall, what are DOC's plans to ensure that people's release dates are not further delayed?
So Senator, our program services staff are working under the governor's direction of Build Back Better. And we are currently working with our tablet provider to upload academic and vocational training to the tablet platform. And we anticipate in the coming month, we will be able to pilot that at a small number of facilities to work out the kinks and bugs to ensure that we can continue to deliver academic and vocational instruction. One of the particular areas that you talk about release in the correction law, it does require that the incarcerated individual participate in a certain requisite number of hours of instructional time. So with the suspension of visitation, we were tied by the language in the statute, but by exploring this additional technological capability, we think that we'll be well suited in the event that we need to take action to resuspend in-person programming so that services continue delivered to the incarcerated population moving forward.
And one of the focuses is for the non-essential staff, and I hate the use of that term, non-essential, all my staff are essential. But now that they're physically back in the facilities, they are also thinking proactively that if there is a second wave, how do they continue to deliver the basics of the program so that people can continue to get the credit that they need?
And just to be clear, this isn't a mechanism to replace any in-person academic or vocational training. Employees are valuable to us. I think that that's the best place for our individuals to learn in-person learning. But in the event that we can't do that, we want to have a fallback plan to build back better so we can continue to provide the necessary services so an individual can successfully transition to the community.
All right, thank you. Just one quick question. Do you know how many people have been released on medical parole since March?
I can get that number. I don't know it off the top of my head, Senator. I do have a policy. Any medical parole application gets on my desk, I try and turn around the same day so that there's no unnecessary delay in the process.
All right, thank you. I will now give the co-chair an opportunity to ask additional questions. We're going now to a second round.
This will be really quickly. Commissioner, we did track down the numbers that you shared with us. You shared them back in April or May. So obviously since then we have June, July, and August, and we're currently in September. So what I would ask you, please, is to update those numbers for us. So yes, we have those numbers. It's a little bit sad that you don't have them before you, but we do have them from all the way back in April and May. So please give us updated numbers. Do you commit to doing so, please?
Absolutely, Senator.
Senator, are you talking about the deaths in custody?
That is correct.
So since May, we've had no additional deaths in custody. We've had 17. So I think the information you did receive was up to date even today, but we'll verify that that is accurate. But we've only sustained the 17 unfortunate deaths of the incarcerated population.
And we'll check on the clemency question.
Thank you. That's all from me, Mr. Chairman.
Thank you, sir.
Thank you. Just want to make sure any of my colleagues have any additional. I think Senator Salazar. Senator Salazar? Senator Salazar, if you have additional questions?
Yes, only one additional question, just a follow up on the questions I asked before. I just want to clarify, what is the metric for determining if a death in custody is in fact a COVID-19 related death? Could you really spell that out for me?
Well, first of all, every death is required under the county law to be subject to the medical examiner of the county where the death occurred. So they pronounce the official cause of death. Also, the State Commission of Correction also reviews every death. There's an autopsy performed in every individual. And right now, anybody that's COVID-19 in an outside hospital, we don't wait for the autopsy. We count that as a COVID-19 death. As I said, with the cancer in the situation, we counted that as COVID-19.
Thank you.
Thank you, ma'am.
Thank you, Senator. Anyone else? All right, I have one more question myself. Commissioner, so DOCS has asserted that it doesn't have computers or software that will allow its employees to testify remotely. And the AG's office has taken the position that DOCS employees cannot testify from her office. You have appearances and trials that are being postponed, in some cases up to 6 months with no end in sight. What is DOCS doing to address the situations so that individuals in custody have time to access their attorneys in justice?
Well, Senator, it's a complicated question. You're right, it is a question of what we have available in our facilities. But I can tell you that there's a meeting this week with officials from OCA to see what we can do to effectuate that type of connection.
Yeah, Senator, the problem isn't that we don't have the capabilities to do so. It's the platforms that other entities, like the court administration, took up in order to do these hearings. Originally, they started using Skype for Business. They've now moved to Teams, and as they migrated to a new platform, it doesn't react well or interact well with Polycom, which is something that the state is on. So obviously, with the financial situation, we just can't replace all of our technology devices, but we are working with the court administration to ensure the seamless transition. There are some technical terms that I won't go into because I'm not that versed, but that would allow some connection through a secondary device. So we are engaged with the court administration to ensure that occurs.
Do you have a roundabout date when you believe you'll have this resolved? We have been in this crisis for several months now, since March, and I know that this has been a complaint that I've received from attorneys.
Yeah, so
You have a certain roundabout date you can say, I think by this day we'll have that resolved.
again, so we have done some on the old platform. As they move to the new Teams, we're working on that. They're not fully integrated to Teams yet, so it's really predicated on their timeline coupled with ours, but I don't think it's going to be a long timeline. I can't give you a date certain. It's, collaboration between two state entities, the court administration and DOCS, but I do think we have a path forward and that it won't be long, Senator.
And I was just in conversation with the Chief Judge Seiss, and I committed to him. We recognize the importance. Everybody's entitled to have their legal case heard in a timely manner.
Very good. Anyone have any other questions? All right, hearing none. Commissioner, thank you so much for taking the time to testify. If anybody has any additional questions that they want to ask, they can always give it to us in the chat. Commissioner, we'll have subsequent conversation based on your testimony. I will ask you specific questions on what you testified today as a way of follow-up. And I hope that we can do that in a relatively short period of time. Thank you both of you for testifying. And I look forward to continue to working with your agency and my colleagues to make this a lot safer, or as safe as possible for people that are incarcerated and of course the staff. Thank you.
Thank you, Senator.
Thank you.
You muted yourself, sir.
Oh, sorry. So we're going to start. There's been a change, correct? So Commissioner Brand will come in a little later, but she will testify. And let me see who will be the next person to testify is Patricia Yang, Senior Vice President of New York City Health and Hospitals Corporation, Correctional Health Services, and Robert Cohen, MD, a member of the New York City Board of Corrections. You have the floor.
I do? Yes?
You have.
Okay, thank you very much, Senator Sepulveda and Co-Chair Senator Rivera, all the senators, Senator Galvin, Richie, Myrie, Salazar, Helming, Benjamin Little, Bailey, Mayor, Farmland, and Jackson, and colleagues. Thank you for the opportunity. My name is Dr. Robert Cohen. I'm a physician and have been a member of the New York City Board of Correction for the past 11 years. I am not speaking today on behalf of the board, but as an individual, but I am speaking based upon my 40 years of experience in the field of jail and prison healthcare. I've worked as a physician at Cook County Jail and did research on epidemiology of epilepsy in the Illinois prison system. I was associate medical director of the Montefiore Rikers Island Health Services in 1981 and served as director of Rikers Island Health Services from 1982 through 1986. I served as vice president for medical and professional affairs within the New York City Health and Hospitals Corporation and as the director of the AIDS Center at St. Vincent's Hospital. I have been appointed by federal courts to oversee the implementation of consent agreements to remedy unconstitutional medical care in Florida, Michigan, Ohio, Connecticut, And for 15 years, I was appointed by the Federal Court of the Southern District of New York to monitor and work with docs to improve the medical care at Greenhaven Correctional Facility. I come to speak to you today about what actions should be taken to minimize the morbidity and mortality of coronavirus infection in New York State's jails and prisons going forward. The most important thing to be done is to discharge as many incarcerated persons as possible from the state's correctional institutions. Thousands of people and persons who work in New York City's jails became infected with the coronavirus in March. But with broad support from the physicians and nurses who work for correctional health services, the advocacy community, the Board of Correction, the City Department of Correction, docs through release, temporary parole revocation releases, district attorneys, the judges, the city rapidly reduced its population from 5557 on March 16th to 3832 on April 29th. That's over a 30% decrease in the population. And during this period, and this is very important, from March 16th through June 5th, the number of men and women 50 years and older decreased by 42%. Doctors caring in the jails for people who were at high risk for serious illness and death from COVID, many were released from the jails. Due to that effort to reduce the population by 1,700, the deaths in New York City were terrible, but few. 3 incarcerated persons and 11 correctional staff died. It must be noted, however, that thousands did become infected. And I believe that the low rate of death was due to the fact that we were able to have the sickest people removed quickly. Sadly, the population in New York City jails has been increasing over the past month and has now increased to 4,299, an 8% increase in a short period of time. We are very fortunate at this time to have a low rate of prevalence in New York, but we all know that could change quickly. I certainly the work that has been done in New York State and the numbers that Acting Commissioner Annucci described are important, but every correction department should be preparing for a second wave right now. And docs in every county in the state should be working with relevant agencies to decrease the population by releasing everyone over 50 years of age, all those at increased risk of serious complications if they became infected with coronavirus, and of course, those who shouldn't be in jail anyway. Smaller populations allow facilities to provide adequate distancing and accommodate the hopefully temporary loss to COVID illness of civilian and security staff during major outbreaks. The basic policies of distancing, wearing masks, maintaining necessary environmental standards must be reviewed and established. When I visited Rikers Island last month, social distancing was not being practiced, mask wearing was not being supported, and persons inside housing areas were not being provided masks. Incarcerated persons lined up without distance and sat together at small tables. If there were no pandemic, this wouldn't matter, but there is a pandemic. And it is very important that these kinds of policies be looked at again, and the county jails and the state prisons review their policies, masking, distancing, and environmental practice. Yeah, I just want to make one last point if I could. I know my time is up.
Yeah, quickly, please. Thank you.
The prisons and jails should be viewed as nursing homes right now. And the calls for mass testing are totally appropriate, but they only describe one point. COVID will come in a second wave into the jails and prisons via the staff. If the state works as it should by quarantining and testing everybody entering jails and prisons, then the transfer of disease is going to come from people coming from outside of the jails and prisons inside. And nursing homes are now testing all of their staff 1, 2, and 3 times a week. And New York State should consider having its prisons and counties also implement a process which will involve mass testing of staff on a weekly basis, and then, of course, testing of any clusters of COVID that pop up. Thank you for the opportunity to testify. I'm sorry it went so long.
That's all right. Thank you, Dr. Cohen. Now, Dr. Yang.
We can't hear you, Dr. Yang. We can't
Dr. Yang,
hear
are
you.
you muted?
Yeah, we can't hear Dr. Yang. Say something else, please, ma'am.
Hi,
There you go.
does that work? Okay, thank you. Good morning, Chairperson Sepulveda and Rivera and members of the Committees on Health and Crime Victims, Crime and Corrections. I'm Patsy Yang, that's Y-A-N-G, Senior Vice President at New York City Health and Hospitals for Correctional Health Services, also known as CHS. I appreciate the opportunity to testify on our considerable efforts to manage COVID-19 in the city's jails. I'd like to start by saying that there are currently no active cases of COVID-19 in the New York City jail system. Our last confirmed case of in-jail transmission was on May 19th. Although we did have 15 positive cases since then, all were individuals newly admitted from the community, and we were able to prevent the spread of disease to other patients. Most fortunately, we have had no COVID-related patient deaths apart from the 3 tragic lost ones in April. While other correctional facilities across the country continue to contend with the rapid spread of COVID-19, here in New York City, we have effectively bent down the curve. Our ability to manage such a highly contagious virus in such a uniquely challenging setting speaks to the efficacy of our COVID-19 response strategy. These 3 cornerstones of our approach were decarceration, containment, and maintenance. We know that the SARS-CoV-2 virus is still here, and the magnitude of any resurgence will depend in large part on our vigilance and rapid response. In partnership with the New York City Department of Correction, DOC, we continue to plan and prepare for reemergence of the virus in the jail, using our initial COVID-19 response as a blueprint, even while we modify our practices to meet the current needs of our patients and stay aligned with the best public health guidance. Our decarceration efforts centered on identifying patients who were most vulnerable to a severe course of disease should they contract the virus. Our compassionate release efforts, which preceded but were expanded greatly as a result of COVID-19, continued to this day. We work not only to help arrange for patients' safe release, but we also help protect the health of the people in the community by screening every patient whom DOC brings prior to discharge from the jails so that we can educate people who need to self-isolate and help them get accommodations in which to do so. The second component of our approach, which is containment, involves strategic testing and a stratified housing plan. During the height of the pandemic, we tested at a rate higher than that in the larger city. As of September 20th, we have tested 5,263 patients, of whom 570 tested positive. Importantly, not all of these patients remained in the system, and again, none of our current patients are actively infectious. With no current transmission within the jails, we are now focused on universally testing all individuals who enter the jail system regardless of their symptoms. The other half of our containment strategy is housing, where we developed an entirely new designation of housing for patients depending on where they were on the COVID spectrum. All newly admitted patients are quarantined until they test negative and/or show no symptoms over the course of 14 days. We also separately house patients who are highly vulnerable to a severe course of disease, from patients who are known to have been exposed, from patients who are exhibiting COVID-like symptoms, from confirmed COVID cases. Given the current state in the jails, most of these special housing designations have been suspended, but they are ready to be reactivated when and if the need arises, as we did during the height of the pandemic. The third component of our approach, maintenance, ensures that our patients get the regular health care they need in order to fend off COVID and its worst effects. During the pandemic, we also expanded our already pioneering use of technology. Our years of experience and our infrastructure allowed us to use telehealth video connections to minimize interruptions in care. Working with DOC, we also were able to establish new secure telephonic connections for patients in any housing area to directly contact CHS, whether it was to report a health concern or talk through anxieties about the disease. We maintained and in some respects expanded access to our discharge and reentry services. On a daily basis, I read reports criticizing the management of COVID-19 in prisons and jails across the country. Here in New York City jails, which were the epicenter of the epicenter, I am both proud and humbled by what CHS and DOC together have accomplished throughout this pandemic. We made decisions together based on an unprecedented pooling of the wealth of our respective clinical and security experience and expertise, and we're always informed by evolving science about this shape-shifting virus. During one of the most trying times in our city's history, I know we stand ready to face the challenges that lie ahead. Thank you.
Thank you, Dr. Yang. So any of my colleagues have any questions?
Isn't Ms. Cynthia Brand, Commissioner Brand?
We're gonna call her back when she's unavailable right now, probably till 12:30, I was told. So,
Good morning, Senator Sepulveda. This is Brenda Cook, the department's chief of staff. We won't be joined by Commissioner Brand today, as I believe you had been notified, but we have the Department of Correction leadership here, and Chief of Department Hazel Jennings will be delivering our formal testimony, and then we have an executive team standing ready to answer your questions.
no, I was informed that she would be available at 12:30, so you're saying that's no longer the case?
That's correct, yes.
Okay. So who is going to take the lead on testifying on behalf of the commissioner?
I will, Chief Jennings.
All right, Chief, you have the floor.
Okay, so good morning, Senator Rivera, Senator Sepulveda, and members of the Committee on Hospital and the Committee on Crimes Victims, Crime and Corrections. I'm glad to see that you're all healthy and well, and I am pleased to be joined today by the dedicated members of this leadership team and our valued partners from across our city's criminal justice agencies. Since we last testified before your committees, the department has continued to work around the clock to keep those living and working in our facilities safe. In the past 3 months, as correctional institutions across the country have had record numbers of COVID cases, the department has had no new jail-based transmission amongst those in custody and only 14 new staff cases. Our success is evident by the health of our staff and our population, and we are proud to share our COVID-19 mitigation strategies with correctional institutions around the country. I thank you for the opportunity to discuss how the department's effort to manage COVID-19 within our facilities and our plans to continue achieving this success in the event of a second wave. First, I would like to recognize the dedicated and hardworking employees of the Department of Correctional and Correctional Health Services for their incredible efforts throughout this pandemic. Since day one, they have remained committed to protecting the safety and well-being of those entrusted to their care at a great personal sacrifice. As the chief of the department, I am proud of their heroic efforts and remain honored to work beside them. COVID-19 continues to be unprecedented crisis and likes of which this city has never seen. Since the first days of this pandemic and every day after, the department has taken swift and decisive actions to keep everyone living and working in our facilities safe. Following an initial spike in cases in March and April, the total number of active cases amongst people in custody quickly declined. While other correctional jurisdictions are continuing to see the infection spread rapidly across their facilities, with positivity rates among those in custody spiking as high as 17 and 18% in prisons across Florida and Texas. This department has seen no new jail transmissions in over 3 months. We have achieved this success through strict adherence to several mitigation measures, which I will recap for you briefly. First, the department has implemented policies focusing on preventing the virus from coming into our facilities in the first place. This includes screening all staff upon entry to the facilities and testing all new admissions for the virus upon intake. Asymptomatic individuals newly admitted to custody are cohorted separately from the general population until they receive a negative COVID test or satisfy a quarantine period. Any new admissions testing positive are quarantined for a period of 14 days or until symptoms subside. All staff with a temperature above 100.4 or experiencing any symptoms are not allowed to be at work and are directed to stay home and contact our health management division. Second, department took critical steps to contain the spread of the virus. We leveraged and expanded our existing robust sanitation practices, activated protocols to provide personal protection equipment to both staff and individuals in custody, and established a tiered housing structure that separates individuals who are symptomatic, positive, or exposed to COVID-19 from the general population. Individuals in custody continue to be made aware of vital public health guidance surrounding mask use and social distancing via posters, informational flyers, and conversations with DOC and CHS staff. With its citywide partners, the department thoroughly examined its population with the goal of identifying who most vulnerable to the disease and could be better served in the community. As a result, the department released over 2,000 individuals over the past 6 months, with the effect of reducing housing capacity and increasing the feasibility for effective social distancing. While these procedures I have described were put in place in mere days, the department has internally re-examined and re-evaluated them.
Yeah.
addressing
This is the department's on now. They're finishing up.
You got 30 seconds.
We will continue to build upon these measures and make any changes as necessary to ensure everyone living and working in the jails remains safe. Thank you.
Before I ask for questions, I just want you to know that I see that you have executive members there at this meeting. I find it somewhat offensive that the commissioner, we've been dealing with COVID since March on major issues, and she couldn't find a few minutes to come and sit with us and take questions directly. So please convey to the commission that I'm none too happy about the fact that she's not here personally when Commissioner Nucci was able to be here in attendance.
Senator Sepulveda, this is Brenda Cook, the Chief of Staff again, and I apologize if it wasn't conveyed to you, but we conveyed repeatedly to the city administration staff, which I understood to be conveyed to you, that Commissioner Brand always had a conflict with this hearing date. She is testifying in a legal case, and so there is just, unfortunately, there was not an opportunity to have her in two places at once, and so. Again, I apologize that apparently message was not conveyed through channels, but we stand ready to testify.
I mean, I understand that you can't testify in two places at one. I get that. However, we could have made accommodations for her if necessary. I just think it's important for her. It was important for her to be here to testify, but let's not beat a dead horse. Thank you. So question for you. How many people have been released since the start of the outbreak?
So we have had, let me just get that information. So in relationship to COVID, we have had on our 6A program.
Can you get a little closer to the sound system because I'm having a little difficulty hearing you. Thank you. And I'll reclaim some time for you. So thank you.
Okay. So for parole lifts, we had 1,251 people. For our 6A program, there were 296. And for WRIT, there were 411 people total that was released solely for COVID purposes.
And of those individuals that are released, how many were released for health-related reasons?
So I think that all of those persons were looked at by CHS to see if any one of them fell into a criteria for health-related questions, and I'll let Patsy Yang answer that for you.
Okay, thank you.
Hi, this is Dr. Ross McDonald, Chief Medical Officer for CHS. The chief is right. CHS engaged in a process with multiple stakeholders to review patients from the population to look for markers of vulnerability and provided information to various stakeholders for a variety of different release efforts. So the numbers that Chief Jennings shared with you would have been informed by those health reviews.
Thank you. So now that we are getting closer to winter and a possible second outbreak, what preparations have you taken to ensure that we don't have the level of infection and deaths that you so far have been able to create the environment where we have the numbers that we have?
So I think that all of the measures that we previously put in place, and I will start from where we last left off. Initially, we engaged with CHS and we had a roundtable exercise to talk about different situations or crises that could come out, and that so that we would remain on the same page. We then, once we received our first case, we began issuing masks to all staff and persons in custody. We are now screening every person who are coming into our facilities where they have to answer a battery of questions and they're having their temperature taken. We are making masks available to every housing area 3 times a week so that we will keep a count of about 40 or more masks available for the population. Staff are able to pick up masks when they enter into the facility at any time, and we're making sure that we have gloves and disinfectant wipes and Virex solution for the cleaning, and as well as alcohol pads and other articles. So from the last pandemic, we had already had N95 masks in stock, as well as other equipment that could be utilized for personal protection. We have continued to purchase equipment to make sure that we have an adequate amount of supplies. We have issued out over 60,000 personal protection equipment. We will continue to screen staff, and we will continue to make sure that we do not have the housing capacity in each housing area over 50% so that we can achieve the social distancing. We also made one of our facilities, the new admission facilities, one for males and another for females. Now we have 2 so that all asymptomatic persons go through those facilities so that we are not contaminating or mixing in with the general population. We have a CDU unit where anyone with symptoms refusing to test or positive cases are housed. And we have an empty facility in which we opened up in the middle of the pandemic for the overflow for the communicable disease unit that we can open up on a minute's notice to house any fluctuation of people.
Your time is up here. I'm going to probably have a second go around, but let me allow my co-chair, Senator Rivera, to proceed with questions.
Thank you, Mr. Chairman. Let's talk about your policy on visitations. Are visitations currently being allowed in the city jail system?
Currently, we still only have video visitation, sir.
When are you planning to resume them, or are you planning to resume them?
Yes, this is Brenda Cook. We are working with the city's Department of Health and Mental Hygiene.
And the person actually, the masks make it weird. I don't know who's talking. At least just like take a little bit around when you're moving, just so I can say who's like, go ahead. Go ahead.
It's right here. So we are working with the city's Department of Health and Mental Hygiene to finalize the criteria of infection rates and metrics that would trigger modifications to reopening, both within our population in custody and in the community. We have been working with our labor partners and staff internally with respect to identifying the modifications to our visit spaces. And that includes the total number of people that would be permitted in the visit space, the sanitation of the space, and the protocols with respect to cleaning the space after the visits turn over, working out a pre-registration process, which we've been using for our video visitation units throughout the pandemic, but that we have not used previously for in-person visits, so that we could manage the inflow of the number of visitors to each facility to visit their loved one and register them for a visiting time. And so we're finalizing those determinations. Most importantly, the metrics on the infection rates with the city's health department. And then we will be prepared to reopen those in-person
Do
services.
you have a timeline for this?
The timeline is as soon as we can be provided those final pieces of information. I expect it to be shortly. We have been in the meantime, we stood up a entirely new to the department video visitation process in a matter of days in March. We opened that and we have since March conducted more than nearly 19,000 video visitation with people in custody and their loved ones. And so we will continue to support video visitation in
But
addition.
there's no, but just to be clear, because there's another thing that I want to talk about, but currently there's no internal deadline for these procedures to be developed. I mean, I understand if it comes back and it says like, we don't have the capacity to do it, that's one thing. But if not, shouldn't there be a deadline internally to say like, this is when we're going to have these, that we can actually allow families to start visiting?
When we have the information on the infection rates, the metrics for both in our custody, what the rate would be that we would be needing to be mindful of with respect to making modifications to the resumption of internal visits or the community infection rate. Those two data metrics are not determined by the department. We are waiting for that information.
So, because I need to move to something else. So it's the Department of Health's fault, is what you're saying?
We're working in connection with the Department of Health, and so we are waiting on their guidance for that.
Gotcha. And so as far, this one is, however, on your plate, services the nonprofit providers have within the jails, those has also been suspended. Is there a timeline for the resumption of those?
So I'm gonna direct this question to the Deputy Commissioner of Programming, Judy Beal, who's sitting across from me, and she will acknowledge herself and then answer the question.
Good morning. We are currently not having our community providers come into the facilities, but they are working with us collaboratively to provide individualized program packets for the people in our custody. Our program staff are, however, in the jails.
Right, but as far as the providers, like nonprofit providers who provide services, is there any plan to, if they can fit certain, I mean, and obviously I understand and value that there's safety parameters that must be observed, but if the nonprofits are saying they would abide by these terms, whatever it is that's determined, you don't have a timeline for reestablishing these services to continue to be provided?
Our goal is to bring our own staff back into the jails full-time prior to bringing back community providers.
And there is no timeline for that either? As far as the full staffs, or maybe I missed that?
No, that's underway. That's underway as well. The programs division staff have never left the jails throughout the pandemic. There are certain programs that we had not congregate. We were not bringing people to congregate settings as a result of COVID. And so some of the dynamics of the delivery of those, we are returning to those services along with our other congregate services, in-person visits, barbershop, et cetera.
Thank you. That's my time. Thank you, Mr. Chairman.
Thank you, Senator Rivera. Now, Senator Zelnor Myrie has some questions.
Thank you, Chair Rivera and Sepulveda. I just have one question, and I believe either the department or Dr. Yang can answer. Do we have an exact number of individuals admitted to city jails over the pandemic period by way of a technical parole violation?
Yeah. We don't have that. So hi, this is Chief Jennings. I don't have the information broken down by how many parole. We currently have 197 parole violators only in the department. And from January to August, we had 10,037 new admissions. But I can get you specifically how many parole violators were entered into our custody. We just have to get those numbers and break them down in that manner.
Okay, great. No, we would really appreciate that. I think the reasoning for the questioning there is obviously we don't believe that anyone should be subject to a circumstance in which they are more vulnerable to COVID-19 than necessary. But I think it's especially egregious if someone is subject to that exposure by way of a technical parole violation. And I think it's important for us to know what percentage, even if we don't have that raw number of those who are incarcerated in our jails have been subject to that. Thank you.
Thank you, Senator Myrie. Any other questions? All right, I'm going to follow up with a couple more questions. Are there any pregnant women currently incarcerated?
I don't believe we have. No.
Not a single woman is that's expecting is incarcerated in your facility?
No, not currently.
Okay, now, how are the new admissions housed?
So new admissions, during the pandemic, we have all women going to Rosem Singer. And so we worked with our partners at NYPD where they opened up 2 additional precincts in which persons who were suspected of having symptoms went solely to those precincts. Anyone who went through those precincts went directly to our communicable disease unit. If there was anyone else that's not, all of our asymptomatic persons went to 2 facilities, Rosem Singer and the Manhattan Detention Complex, where they are cohorted and they are stayed until after they complete their testing or they're quarantined for more than 14 days.
All right. Have there been any, I'm sure that wearing the masks is mandatory with staff. Have there been any penalties for any staff member for not wearing the mask? And has there been any penalties for any incarcerated individual for not wearing the mask?
No, we have not imposed any penalty.
But it is mandatory, correct?
So it is recommended, and we have put out multiple teletypes. We have also put out multiple posters. We have people who are monitoring the Genetec, calling the house areas, notifying all persons that they must be wearing masks. And we are making sure that we educate and that we tell people that it is an individual responsibility to make sure that they are wearing the mask to keep people safe.
So basically, just to clarify what you're saying is that you recommend it, you don't make it mandatory, and you essentially leave it up to every individual to decide whether or not they're going to wear a mask.
It's
You educate them, you whatever information. I think 99% of the population already knows what would happen and how face masks save lives. So explain to me why that's not mandatory.
Senator Sepulveda, it is, I'm going to help out and clarify here. It is mandatory for our staff to wear masks. It is also, by state law, mandatory for people in custody to wear a mask when they're in a setting where they can't socially distance. We are not, however, penalizing people in custody in the housing unit who are living with other people, like people doing in housing units in the community who don't want to wear a mask with people with whom they already live. We are repeatedly educating people in custody and our staff about the significance and the importance of wearing the mask as it relates to COVID. I know our partners in correctional health are also repeatedly educating their patients and their encounters about the importance of wearing the mask. It is mandatory for our staff to wear the masks. We have repeatedly reinforced it with staff, but we, as the chief said, we have not issued any formal discipline to staff regarding the mask. We have many mechanisms to identify and correct. If I see, as I'm in the facilities, or as anyone here is in the facilities, if I see folks with the mask under their chin or not on their face, they're directed to wear the mask, and staff put on the mask. That's what we do.
Senator Sepulveda, it's Patsy Yang here. Our health staff, universal precautions and PPE are pretty much second nature to them. But nonetheless, correctional health does have a policy, and people are subject to discipline should they not comply. We've also worked with the Department of Correction to reinforce the need, particularly in healthcare areas in the clinics, that people need to be masked, both health staff, DOC staff, and patients.
I mean, it's clearly you've done some work with that, Dr. Yang, but I have some concerns that it's not mandatory. When we all know that the best way to prevent the spread of the virus is to make sure that people wear their masks. And if it's mandatory for staff, but they're not wearing it, are there any repercussions, or even individuals that are incarcerated? I'm very concerned about that policy, but you're a doctor,
Well,
knows a lot more about it than I do. I have concerns.
No. Correctional Health Services, we have our own policy on top of what's required by the state and the city. And again, staff at the health service are subject to disciplinary action should they not comply.
But no one has been subject yet. So what you're telling me is that everybody's wearing their mask at all times.
The health staff are certainly doing that.
Okay.
It's masks, it's appropriate, whether it's a surgical mask, an N95, face shield, goggle, eye protection, gowns, gloves, caps. It's appropriate to the procedure in their setting.
And how is the one last question, because I know my time is up, but how are we enforcing social distance guidelines with staff and individuals that are incarcerated?
So in the housing areas, we have put visual cues as to where people could sit at the tables. And we have also stated how many people can be in the day room at any given time and how many people should be in the shower at any given time.
All right. Any other questions, Senator Rivera?
I'm good, Mr. Chairman. Thank you.
All right. Any of my colleagues have any questions? All right, hearing none. Thank you, all of you, for testifying. Give my regards to the commissioner. Hopefully we'll have a conversation shortly. But thank you again, and let's take the next panel.
Thank you.
Thank you.
All right, our next panel comprised of Stephen Drake, who's the executive board member of the New York State Public Employment Federation, and the new president of COBA, Stephen Basio. So let's start with Mr. Drake.
Good morning. Thank you, Chairperson Sepulveda and Rivera, distinguished members of the Senate and Crime Victims, Crime and Corrections and Health Committee. We appreciate you holding today's hearings and providing stakeholders the opportunity to address you on the impact of COVID-19 pandemic on the individuals and staff at the state's prisons and jails, and how we can work collectively to improve conditions for both staff and the individuals under their care. My name is Steve Drake. I'm a vocational supervisor at Mohawk Correctional Facility and have worked for the Department of Corrections and Community Supervision for over 27 years. I'm also a member of the PEF Executive Board. The Public Employees Federation represents over 52,000 state workers in the Professional Scientific Technical Bargaining Unit, and many of the frontline and essential members of the state workforce are PEF members like myself. PEF represents nearly 4,950 employees in the Department of Corrections and Community Supervision, as well as the staff at the Albany County Probation Department. These members serve as parole officers, parole revocation specialists, nurses, social workers, dietitians, psychologists, psychiatrists, developmental specialists, teachers, offender rehabs, translators, and numerous other positions. PEF members have always been instrumental in providing health and rehabilitative services for the state's incarcerated population, as well as helping to provide reintegrated services for individuals upon release. At the Department of Corrections Community Supervision, despite the challenges posed by the nature of this highly communicable disease, I would like to commend how our PEF members have gone above and beyond to help to keep New Yorkers and the individuals under their care safe and secure. Given this framework, I'd like to highlight some serious issues that remain unresolved. In order to avoid potential worst case scenarios in these confined close proximity facilities, we believe issues need to be addressed immediately. Funding and staff. Let's be clear, the state's response to this pandemic and its efforts to keep staff and individuals in correctional systems safe were seriously handcuffed by the long-term systemic reduction in the state workforce, a trend that has been ongoing for over a quarter of a century. If the state wants to be successful in its laudable efforts to reduce the number of incarcerated individuals, then the state needs to provide social, psychological, nutritional, and other resources and support for at-risk individuals to be successful in their communities and to provide enhanced education and workforce training to them to provide ongoing opportunities for success. This becomes even more important during the pandemic. Our nurses continue to face unmanageable staffing shortfalls in the midst of this pandemic. The typical tools of management to address chronic workforce shortages continued unabated include the use of mandatory overtime, staff redeployments, lower minimum staffing requirements, and last-minute shift adjustments. These tools all increase stress on our families and negative impact morale and are more poor substitute for adequate staffing. As I have testified before you in the past, short staffing in all aspects of healthcare continue to be an uphill battle for both staff and the department. Many of our facilities continue to work with vacancy rates far exceeding 30 to 50% vacancy rates. Our infection control nurses, doctors, and support staff should be commended for their hard work through this pandemic. Additionally, we know that many of the individuals that we deal with suffer from mental illness and have other developmental disabilities. Yet the state has not dedicated the resources or staff to help deal with this reality, and in fact, has been cutting resources and staff at the very agencies that should be charged with meeting these needs, such as OMH and OPWDD. The gap in the continuum of care creates significant and unnecessary burdens on parole and other law enforcement officers, as well as local courts and social service agencies. So let's expand and retool the workforce to achieve the goals we all share. Take some questions if you'd like, or
Let's have Benny testify first, and then we'll take questions. You can proceed, Benny.
Good morning, Chairman Sepulveda, Chairman Rivera, and the distinguished members of your committees. My name is Benny Basio Jr., and I am the president of the Correction Officers Benevolent Association, the second largest law enforcement union in the city of New York. Our members, as you know, provide care, custody, and control of over 4,000 inmates daily in our municipals and the second largest municipal jail system. We are here today to discuss the impact of COVID-19 in the city's jail system. Before I begin, I want to read the names of 8 of my members who lost their lives due to COVID-19 and ask that we pause for a moment of silence after I read their names. Michelle Sumter, Maurice Lacey Jr., Eli Galan, Elvester McCoy, Connie Jones Hawkins, Quincy Simpson, David Williams, and Richard Kloss. Thank you. These brave officers lost their lives during this unprecedented public health crisis. Another 1,400 correction officers tested positive for COVID-19. And at the height of the pandemic in March, 3,000 of our members were out sick. According to data collected by the New York Times, the virus has sickened more correction officers in New York working in the epicenter of the epicenter than in most other large American cities, including Chicago, Houston, Miami, and Los Angeles combined. The reality is that the city of New York failed to do everything possible to keep my members from dying and from getting sick. From the onset of this crisis, we sounded the alarm about the deadly threats our members were facing. Rather than hearing our cries for help and collaborating with the boots on the ground, the Department of Corrections fought us every step of the way. Let me outline the biggest areas of contention. First, COBA had to fight tooth and nail to convince the DOC to shut down inmate visits. This process took 2 weeks, and the visits only shut down after the state prisons shut down inmate visits. So the question I pose to you is, why did we have to wait? Second, as the pandemic worsened and other agencies began to adopt protocols for protecting the health and well-being of our essential workers, we were met with silence from the senior managers of our agency. Recognizing that the agency was not actively and systematically distributing PPE, correction officers began bringing in their own masks to wear. When this happened, they were told that bringing in their own masks wasn't permitted and they should go home. The failure to allow officers to wear masks early on, coupled with the failure to provide PPE, dragged on for weeks throughout the month of March and into April. Finally, after realizing help was never on the way, COBA purchased over 40,000 KN95 masks and hundreds of gallons of hand sanitizer for our members to help keep them safe. In short, we did what the DOC and the city of New York failed to do. We also called for correction officers to receive COVID-19 testing on Rikers Island. That too fell on deaf ears. Our union then filed a lawsuit in March demanding that the city of New York be compelled to provide our members with PPE, COVID testing, and to increase the sanitization of the jails. It was our lawsuit that produced a settlement with the city to not only provide our members with adequate levels of PPE, but to also provide free COVID-19 testing at over 50 Northwell Health urgent care locations. The chief of the Department of Corrections waited until April 18 to finally release a teletype calling for the commanding officers of each facility to ensure that adequate amount of personal protective equipment is available for all uniform and non-uniform members of service. So just to be clear, it took numerous officers getting sick and calling out sick and a lawsuit to finally make PPE distribution mandatory some 6 to 8 weeks into the pandemic. That is inexcusable at best and borderline criminal at worst. To make matters worse, the department's response to the staffing shortage was to force dozens of officers to work triple tours of duty, which required us to file yet another lawsuit on April 23rd, arguing that forcing officers to work for 24 hours straight during the public health crisis is a direct invitation to infection and disease because sleep deprivation negatively impacts physical and mental health. Even Mayor de Blasio publicly called this a dumb managerial mistake. Another dumb managerial mistake was when the DOC gave 30,000 N95 masks to the FDNY from our stockpile, weeks after the mayor said the FDNY already had sufficient supply of PPE. So if we are really going to sit here today and examine the impact of COVID-19 in the jails, we first need to face the facts that I've just outlined. The fact is the record shows a series of gross management failures, negligence, and leadership voids that led to the unnecessary and preventable deaths of 8 of my members and suffering of my 1,400 members who tested positive. While all this was going on, my members still went to work and had to grapple with inmates assaulting them and deliberately coughing and spitting in their faces. Correction officers have always been the unsung heroes of law enforcement, and their bravery in the face of adversity throughout the pandemic clearly illustrates that. So let's fast forward to today. Fall literally begins today, and for months, the health experts at the CDC have been sounding the alarm about second wave of COVID-19 returning. I have not, as of today, seen a written action plan from the DOC to ensure the litany of mistakes made the first time around never happens again. To ensure the DOC is better prepared, I ask you to join me in holding the city of New York fully accountable for protecting the thousands of lives in our jail facilities, including my members. To start, the DOC can immediately prepare for the next wave of COVID-19, taking advantage of the low inmate population, which currently hovers.
Benny, let me interrupt you, Benny. I'll give you, we'll have a second round because time is up, and I want to give my colleagues an opportunity to ask any questions that they may have of you and Stephen. First of all, I want to, of course, offer my condolences to any member of COBA who has passed away. One death is one death too many. So I know firsthand the risks that each member takes every single day. I have visited some of the facilities, and I know the incredible work that members of PEP have been doing. I know they're overworked, underpaid, and they're taxed, and the work that they do is amazing. So I have nothing but the utmost respect for both PEF and COBA. So I want to thank both of you. Now, let me see if anyone has a question. Senator Rivera, before I ask, I'm going to give you an opportunity to go first.
I'll just say I'll express my condolences as well to all the members who you've lost.
Thank you.
And pass it back to you, Mr. Chairman.
Thank you. So I have a question for Benny. Benny, you explained the situation when this all began and all the efforts you have to make to ensure the safety of your members. How is the situation currently?
Well, currently, I just feel that the department has a real opportunity here to be proactive instead of reactive, in the sense where the inmate population is very low, and the opportunity exists to spread out the inmate population and have a less amount of inmates in each housing area to actually provide for social distancing properly. You know, right now we have a 50-to-1 ratio, and they could lower that and make it 15-to-1 to properly social distance the inmates in each housing area, because we have the staff capability to do it right now.
All right, and then are they providing you with all the PPEs now that you need? Is that an issue any longer or not?
I have not heard any issues about PPE now. As you know, Officers are now allowed to bring in their own masks, and I haven't heard any complaints about them not providing PPE as of today.
Stephen, is your membership satisfied that they're being well protected in our facilities?
Yeah, and early on, there was concerns over how we weren't allowed to wear masks. And then as the department said clearly before, they started issuing masks, and obviously the union did as well to assist, especially in the community supervision offices, to assist in putting out PPEs. But there's been good communication and statements in regards to sharing where we are and our levels of PPEs in the department.
All right, so other than the ratio of workers from PEF within the facilities, what other major issue does PEF have with respect to their safety and the whole issue of COVID in the facilities?
We continue to discuss with the department in regards to the ventilation systems, as they alluded to earlier, making sure that the ventilation systems meet the highest requirement to pose both safety for staff and inmates alike. And I know that we've had good dialogue in regards to where we're going with that. We would like to see it to be increased again to the standards of, like the quality is expected for gymnasiums and things of that nature, so that our staff and inmates could be safe at the highest level, to make sure that we're protected. Most of the systems have been or are being retrofitted to the MERV 13 filters when they can be, and they're allowing staff to utilize open window ventilation in the program areas and other areas to keep the fresh air coming in. And so we're still working with them to try to enhance that part of it, and we'd like to see a continuation on that side of things.
Do you have information of any members of PEF that have passed away that work in these facilities?
Directly in the Department of Corrections, there is none that were passed away that were PEF staff directly.
Okay, thank you. Benny, tell me now, what is it that COBA needs in order to feel safer within the facilities? What can we do, if anything?
We need your help. If issues arise, we need your intervention right away, because we can't afford for this to happen again. We need, if our members do get sick, to force the department for us to test negative before we were forced to come back to work. Last time we were forced to come back to work a little earlier than we should have. There was a whole lot of mix up with the health management division. Need to ensure that sanitizing is done properly and regularly, especially areas that are shut down for some time. They should do heavy power washing in some areas to better prepare this time around.
Okay, so you're okay now with everything else, all the PPEs, all the safety measures, and really, essentially, we're going forward to make sure, being vigilant, that you get all that you need there, and we're going to do whatever we can to help. We don't want anyone to be unsafe in their working environment. So regardless of what, we have an obligation to do everything we can to make our facilities safer, and to work with the union, COBA, or NYSCOBA, or PEP, whoever's in the facility, and we intend to do that. So thank you both for testifying today. And again, if you have more information or if anything else you want to discuss offline, you can always call us. We'd be happy to continue the discussion. And our ultimate goal is
Mr. Chairman, I believe that, I don't know if you're about to wrap up, but I believe that Senator Helming has raised her hand.
Oh, yes, thank you. I did not see that. Thank you. All right, Senator Helming, you can proceed.
Thank you, Steve, and thank you, Benny, for your testimony today. I truly appreciate it. Steve, the issues that you touched on, the short staffing issues, the mandated overtime, inadequate PPE at the start of this pandemic, those are the things I hear from PEF employees as well. And they're issues that have been around for a long time. They, prior to COVID, I think they were exasperated during COVID pandemic. I'm committed to doing whatever I can to help you and your members address those issues. Benny, I wanted to just comment more also than ask a question. I think you had said at one point that New York City jails shut down after the state did. And that is extremely concerning to me, because I think I remember reading that New York State correctional facilities were actually one of the last state prisons in the US to suspend inmate visitations. So did I hear you right saying that the city actually suspended those visitations after the state?
Our visits were shut down afterwards, as far as what that I know.
Yeah, so your point about both of you, Steve and Benny, that we need, as a legislature, we need to react quicker, right? We need to put more pressure on to get supplies out there that you need. I know you both kind of suggested that I think you're in sort of a good place with PPE and other things now. But again, I think we need to do a deep dive to make sure your members have all the supplies that they need, that visitations are being managed correctly, that inmate transfers, that we're looking at that, and that we're just doing everything we can to minimize exposure. Because Benny, my condolences to the 8 members that you lost. We cannot afford to lose anyone else to this COVID pandemic. So again, my heartfelt condolences and my heartfelt appreciation to both of you and your membership for everything that you continue to do. Know that we're here. We will do everything we can. If there's a specific list of items you'd like addressed, please send that around to all of us. Thank you both.
Definitely will. Thank you.
Thank you very much.
Thank you both for testifying today. I appreciate your time, and let's continue the discussion.
Thank you.
Thank you.
All right, so we are now going to proceed with our 4th panel. And first to come on is Danny Glover, he's a founding member and chair of AFJ Board of Directors, which is the Alliance for Family Justice. Mr. Glover. Danny, are you there? Well, let me introduce everybody else in the panel. Whoever's available can start. We also have Felicia Henry, who's a research fellow at the Correctional Association. We have Elizabeth Gaines, who's the president and CEO of Osborne. Amelia Adams from the Adams Advisory LLC Bard Prison Initiative, although there may be some issue about her actually testifying. And Lisette Benenga with New York Consortium for Higher Education in Prisons. Thank you all, and any of you can start the process.
Hi, my name is Sophia Elijah, and I am going to speak for Mr. Glover. He apologizes. He waited for quite a while, but he's on a film set. And so after about an hour and a half, he got snatched to go continue with filming. So I'm going to try to act like the actor. So his testimony would be, good afternoon. Thank you for the opportunity to address you. I am honored to be the founding board member and chair of the board of directors of the Alliance of Families for Justice, which is a nonprofit organization whose mission is to support, empower, and mobilize families with incarcerated loved ones and people who are incarcerated. This organization means so much to me personally because it speaks to my own lived experience. In May of this year, AFJ hosted a town hall during which family members spoke of the harsh realities presented by COVID-19 and the dangers that their loved ones faced and the fears they had for their safety being incarcerated. Their testimony was moving and haunting. It was haunting because the dangers were real and those in authority had made it clear that they didn't care. As I listened to many of the AFJ family members, they reminded me of the realities my own mother and father endured during the challenges of my brother's incarceration. I ask you to listen to the testimony that is going to come and to hear the cries of the family members. I will turn to my colleague now, Ms. Smith.
Thank you. This breathtaking experience has been one I will never be able to forget. Numerous sleepless nights delivering images of my husband's face, overcome with worry and grief, hearing the sound of his voice repeatedly telling me how deeply he misses the comfort of my touch, the smell of my hair, and his ability to honor our union with the kiss of my ring, a ritual we perform at the start of every visit. The inability to embrace one another and provide comfort during a time when the state of the country was in an uproar so deep that it attacked the mental well-being and emotional states of many is simply inhumane. I have endured many heartbreaks as a result of hearing stories of the deaths, behind the wall, attacks behind the wall, and insensitive actions all during this time, a time when my ability to physically embrace my husband as a gesture of comfort was not an option. A smile, a kiss, or even a gentle rub on the hand was again not an option. Not being able to unite with my lifelong partner, best friend, and confidant has been a struggle I wish was not my reality. My family and I have suffered as a result of not having physical contact with the one man who provides as much strength, guidance, and support to us as we do him. His ability to maintain a direct presence in the lives of our children have been put on hold, and an irreparable damage is now something we have been left to endure. Thank you for giving me some of your precious time today, as these words are my truth, my experience, and one I wish to be a catalyst for change in the future protocols within the justice system for times like these. Thank you again.
I will just add, as I'm Sophia Elijah, the Executive Director of the Alliance of Families for Justice. We have been working with family members across the state of New York since the beginning of the pandemic. Their concerns about the safety of their loved ones inside, and to push for safe and full visits to be restored as soon as possible. We have learned through meeting with family members on a weekly basis since the middle of May that the COVID pandemic has been used as an excuse to extract more punishment and more pain on people who are incarcerated and their families and loved ones. It has been devastating for all concerned. Just to put things in context, we have gotten over 20 reports in our office in the past couple of weeks of people who are receiving disciplinary tickets, tier 3 disciplinary tickets, after visiting with their loved ones, being thrown in quarantine for 14 days, and then the family members are being banned from visiting, and people are being given 90 days in solitary confinement.
Sophia, Miss Elia, let me interrupt for 1 second. We have to have the other panelists speak before you get a second chance to speak. I apologize. So when you have part of your group, I'll give you an opportunity afterwards, but let us have the panels. Go ahead. Elizabeth, why don't you proceed, Elizabeth?
Hi. Okay. I'm Elizabeth Gaines from the Osborne Association. I'm going to not talk really about some of the kinds of things Sophia and others. There's so many people testifying today, focusing on that inside part. I want to focus. Osborne has programs in 30 different docks facilities, as well as 7 jails when they're open, including 16 hospitality centers, 8 family centers, and video visiting with 10 facilities. We have not resumed any of those services except for video visiting. We have been able to do some hacks on services of some of our classes by WebEx, and also delivering materials to the parking lot where the deputy superintendent comes out, receives them, brings them to the people in our classes, and comes out. There's been some effort, and we hope to be able to resume soon. The release efforts that DOCS has made involved us to some degree. They were giving us weekly lists of folks who could be released early. And we made efforts, along with many of our colleagues, other nonprofits, to be able to make plans for people to come home early. Some of those plans included, we were through emergency volunteer services, got smartphones and reentry kits to provide to people. We had Uber, Lyft picking people up when they were coming back, and many of them were being placed in hotels in New York City that were leased by the New York City Emergency Management. The state did nothing. The state did not take on any hotels all along the thruway that could have been used for people coming home, and the city took on the entire burden. I think that would be possible. That should have been possible. The other thing that would have helped on housing would have been if Lincoln could have been reopened and used for people coming home as well. I particularly hope that you'll do something to stop further closures so that they can continue to thin the populations for the short term. The reality, though, is that the releases that DOCS was able to do within their legal structure are not even close. The approach to COVID's got to be releasing more people, and that is something that you as a legislature and the governor have way more power over than DOCS does. Less is more is pending, elder parole, fair, timely parole. Those things plus some effort to get the parole board to release more people under those rules would make a much larger difference than anything that can be done. Changing work release regulations so that more people would be eligible for temporary release. These are all regulations and laws that DOCS really doesn't have any control over. And I would really urge you to look at, and I know I'm very fortunate, we have 2 buildings in the Bronx. One of them is in Senator Rivera's district and the other is in Senator Sepulveda's district. Appreciate your having this hearing and all that you're trying to do. But again, I think that the legislature and the governor above all, who could be granting clemencies and could be issuing executive orders that would make it much easier to release people. One effort that I want to challenge, though, is that Adirondack, as moving people who were closer to home up until the middle of the Adirondacks and creating essentially a nursing home. We all know how well that's gone for New York State in terms of COVID and nursing homes. And I don't have a lot of confidence that this is the best way to handle older adults. We have an elder reentry program at Fishkill. Many of our folks were transferred far away. We don't actually even have the ability to connect with them. I do think that that's something to look at in terms of COVID. You confirm parole board members. I know that you can't tell them what to do, but I do feel like releases could be expanded. Last, I just want to say about Rikers Island and visiting. You also have pending the codification of visit bills, which would require all facilities to provide some in-person visiting. I think you can see that the city is resisting, and I don't know about the upstate jails. But I would also, I know Senator Sepulveda, you've been a sponsor and a big fan of this, and I really would hope that the legislature could come back together and move some of these bills forward that would increase opportunities both for release and mandate more visiting. Thank you.
Everyone on the panel has spoken? I don't think, Karima, have you spoken?
Let's set.
Can you hear me?
Yes, I have. Thank you.
All right. Ms. Smith, you're up. Did you speak already? She's muted.
I'm
You're
sorry,
muted.
Karima Smith? Yes, I have.
Yeah, Ms. Smith did. Ms. Bamenga would be.
Yes.
New
Got
York
it.
Board of Higher Education and Prisons.
Thank you.
Go ahead.
Thank
Ms.
you. Thank you very much, Senator Sepulveda and Senator Rivera, for convening this hearing and raising the issue of COVID-19's impact on prisons and jails. We are grateful that you are taking this time to better understand the impact of COVID-19 inside the prison walls. I speak to you today as a representative of the New York Consortium for Higher Education in Prison, NYCHEP. This coalition comprises administrators, educators, and alumni from Hudson Link for Higher Education in Prison, Cornell University, SUNY, CUNY John Jay College of Criminal Justice, the University of Rochester, and more than 24 other institutions and organizations that offer college programming in more than 30 prisons and jails in New York. NYCHEP embodies a shared knowledge of these institutions and provides a platform for programs to help each other grow, share best practices, and advocate for students. Our mission is to educate women and men who enroll in college programs during incarceration and to support their degree completion and reentry when they return to the community. My name is Lizette Bamenga. I am an academic coordinator with Hudson Link, and I am also formerly incarcerated. On this call are other members of NYCHEP's leadership team, Precious Bedell, who is the Assistant Director of Community Outreach for the Rochester Education Justice Initiative at the University of Rochester, and who is also formerly incarcerated, and Rob Scott, who is the Executive Director of the Cornell Prison Education Program at Cornell University. The first impact of COVID-19 was that prison staff, administrators, security, and programming began to eliminate contact between the incarcerated population and the outside world. Visits from family and friends and programs led by outside volunteers, such as our college programs, were justifiably suspended in order to curtail the spread of the virus. This complete shutdown of facilities left students in limbo, not knowing if they would be able to finish and earn credits for courses most of them already had been taking for 6 to 8 weeks. Our students communicated their panic with us by mail. For many of them, college is one of the most positive influences in their lives. Their opportunity to earn a degree gives them a better chance of overcoming the employment barriers that exist for formerly incarcerated individuals. The loss of face-to-face learning was devastating. While we worked to rapidly reconfigure academic programs, NYCHEP also wanted to prioritize the health and well-being of New York's incarcerated population. As the number of cases escalated in the community and inside prisons, our consortium coordinated on a major PPE distribution project with DOC's permission. We raised private funds for the purchase of more than 43,000 reusable cloth masks. These masks were sent to every correctional facility in the state for distribution to the population beginning in May. Here are some ideas of how the New York State Senate can be an effective ally to college and prison programs in our constituencies during the COVID-19 crisis. Number 1, restore TAP and advocate for Pell Grant eligibility for people in prison, which is Bill 790. Without the reliability of state funding, we are competing for limited resources. COVID-19 has only exacerbated this strain. The restoration for public funding for incarcerated people is needed now more than ever. Number 2, supporting the bill providing free emails for people in prison, Bill S 7727. Since DOCS closed its doors to outside programs, in order to meet U.S. Department of Education requirements for regular and substantive interaction with students, many programs have become dependent on JPay. JPay charges incarcerated people 30 cents per email, a cost that college programs now must bear. We need this email bill for academic reasons, and New York State families need it in this time of extra separation. Number 3, education merit time, Bill S 7633. Adding college credits to eligibility requirements to maritime allowances would be another way to release individuals, further lowering the total number of people in prison, which at a time like this is crucial. The Assembly passed the bill in July. Upon your return to session, we asked the Senate to substitute the Assembly bill and pass it. Number 4, NYCHEP is interested in working with DOCS to coordinate equal access to technology for remote instruction in all facilities with college programming. Our vision is to help expand access to quality higher education in prisons, and because of COVID-19, this now requires a coordinated effort to increasing technology within the facilities. I thank you for your time. My colleagues and I welcome any further conversation or questions to help improve the response of COVID-19 in New York State prisons and jails. Again, I thank you.
Thank you, Ms. Benenga. I have two questions for you. How many programs have ceased as a result of the pandemic, and have you been able to speak to some of your students?
Okay, so at the onset of the pandemic, once DOCS closed, we all had to cease, and then most of us were able to continue by mail, which was not a possibility for all programs because of Pell requirements needing and not accepting correspondence as a form of education. So we have been able to be in contact with our students. DOCS has made allowances for us to be able to use JPay, and now has made available WebEx to some of our programs, and that's how we're able to continue contact with our students.
Thank you. I have a question for Ms. Henry. Ms. Henry, you heard, I'm assuming you heard some of the testimony from both commissioners from the state and the city, and their assessment as to how things are going in our facilities. Do you believe that inconsistently what they're saying is what you're experiencing when you visit them or with the incarcerated individual? Is that consistent with what the commissioners are saying in terms of conditions?
Good morning. Senator Sepulveda, and thank you for the question. I actually haven't had a chance to testify. Would you like me to do that now before I answer
Yes.
that?
Oh, I'm sorry.
No problem. I'll
Yes.
start now. So thank you so much. Good morning or good afternoon, all of the senators, also of the Crime Corrections and Health Committee and members of the public. Thank you for this opportunity to participate in this public hearing. Each of the 37 individuals incarcerated in 52 prisons across New York State face a unique risk of contracting COVID-19. Prisons and jails have become hotspots of COVID-19 transmission at the same time that rates are falling in the communities around them. COVID-19, compounded with incarceration, is a crisis that cannot be ignored. The Correctional Association's authority under the state law to monitor prisons and report findings to the legislature and the broader public has heightened significance and relevance in the time of COVID-19, underscoring the continued need for comprehensive oversight. In a forthcoming report of findings from a monitoring visit to Fishkill Correctional Facility in July 2020, chosen due to the highest number of infections and deaths attributable to COVID-19 at any single prison in New York at the time of the visit, we discussed that 34% of 252 COVID-19 tests administered to incarcerated people had come back positive. 71% of incarcerated individuals reported having access to masks or hand sanitizer, but the vast majority of them observed and interviewed were not wearing them. In fact, many of the incarcerated individuals reported that prior to a distribution of 2 surgical masks on the day of the first visit, they had not received new masks since a donation of fabric masks in May. 50% of individuals reported being unable to maintain social distance, and 10 individuals reporting having had symptoms of COVID-19 but were not tested and instead quarantined with the rest of their housing unit. Additionally, at least 2 individuals reported that they had been sick and tested for COVID-19, but had not received written confirmation of their test results. Both of these individuals reported having filed FOIA requests to do so. Several individuals believed they had been infected with COVID-19 but had not sought care because the prospect of being transferred to a building created for solitary confinement provided a disincentive. Many incarcerated individuals did not seem to have access to proper education on the risks of COVID-19 and how best to take care of themselves during the pandemic, including how COVID tests are administered, proper mask usage, and even the signs and symptoms of COVID-19. Individuals expressed frustration and fear in the response to scarcity of early release opportunities and lack of consideration for clemency. Prison does more harm than good, observed one individual. It puts excess strain on families and it's like double sentencing. This is warehousing, said another. The system makes you lose hope. One individual described his perception of his vulnerability this way: we're like sitting ducks. Earlier this year, Caney was also able to conduct a family survey with over 100 family and friends of incarcerated individuals. When asked what the concerns of their incarcerated loved ones were, the top 3 were lack of personal protective equipment at over 86%, concern about medical treatment at over 67%, and facility staff response to COVID at over 67%. When asked to rate their satisfaction with the response of docs to COVID, over 44% rated docs at a 1, the worst rating on the scale, and over 95% rated docs the 4 lowest ratings on the scale. To achieve the greatest impact, our recommendations, which include essential measures such as increasing testing and public reporting of test results, increasing public education about COVID-19 for incarcerated individuals, expanding creative solutions for delivery of programming, and modifying facility operations to accommodate the need for social distancing must be grounded in a commitment to decarceration. According to one expert, choosing not to decarcerate is a policy decision that actively facilitates high rates of new COVID-19 infections and ultimately deaths among an already vulnerable and marginalized population. By choosing confinement, policymakers are exposing incarcerated people to much higher odds of COVID-19 infection. There is no better public health policy solution than decreasing the number of people behind bars. Their lives depend on it. Thank you so much.
Thank you so much for that testimony. Let me see if my co-chair has any questions. Senator Rivera?
I do. Thank you all for being here and for testifying today. I'll start with Ms. Gaines, but anybody else can actually jump in on this. I wanted to dig a little bit deeper into your concern about the potential setup of the Adirondack facility. Yes, I wanted to dig a little deeper on that with the recognition that with COVID-19, the people who are most at risk are folks who are older or folks who are sicker. And we know the data that exists about older incarcerated people who are obviously at risk under the best of circumstances. So you feel that setting up just one facility has some issues, and you mentioned some of them. So I wanted you to go back through that and then give us some options about potential things that we could do with the older population, besides passing fair and timely parole, et cetera. But under the current environment, and then some recommendations. Go ahead.
Well, first of all, social isolation is an issue for older people in the community, and it also is for people who are incarcerated. They may be less likely to have easy access to families and support systems. And so having them moved from where they were closer, say at Fishkill or in Western New York, closer to where people actually, families are, and putting them in the middle of the Adirondacks really increases their isolation. At this point, we have had several clients in our elder reentry program moved there from Fishkill, and we are hoping that the department will give us video access to be able to provide reentry and other services there. But at the moment, it's quite isolated and isolating. The other thing is that older adults may be more vulnerable, but they also have prefer, for the most part, to be in the vibrant place of where other people are and where activities are going on, where they can really participate. You suddenly take everybody, put them someplace where, first of all, this was an adolescent facility. So you have staff there that have no experience with aging and working with older adults. And we have offered to do some training around gerontology in prison because of our work with elders, but it's not an ideal place. My concern is that they were put there more because upstate New York didn't want to close a prison that was empty when they moved the adolescents than really thinking, not that I don't, attribute bad motives to anybody. And I think you should give Tony Annucci a raise because, the rest of us probably make more money than he does. But despite good efforts on their part to think about it, just think about what's happened in all of the nursing homes in New York and why putting
31 hours,
people
31 hours of hearings on the subject. I'm quite aware. Go
right.
ahead.
So given that, why would we think this was the right solution of pulling people out of places where they were generally closer to home and useful in their work? It's not like it's a medical facility. It's not, it doesn't have the benefits of a nursing home in the sense of experienced staff working and medical care that's appropriate to that. It's a medium security facility, so we have to assume that everybody there is within some reasonable time of release. If we have that many older people that we can put them in Adirondack, send them home.
With less than 2 minutes, tell us what are some of the options that we should explore besides expanding a facility like Adirondacks?
We should have all kinds of policies for older adults. We should be training people in geriatrics. We should be making sure that if somebody gets a ticket after they've not been in trouble for 10 years, test them to see whether they are having problems with hearing or comprehending. Expanding the availability within the RMUs for appropriate services for people.
RMUs, apologies, RMUs?
Regional medical units, if they require medical care. But the best example really is Ulster has a senior living dorm. And the way that works is people apply to be in it. The option here that would be the smartest, I think, is if you were going to create a facility like that, let people choose. If people don't have connections to their families and feel that they would be safer and better off in a facility like Adirondack, they could do exactly what they do with Ulster Senior Living, which is they could apply to go there. And then you would have people there who wanted to be there. We have people applying for other kinds of programs. I think if they feel like there's something about that facility that makes it great for old folks, I don't know why, then let among the 8,000 older adults that we have within our population, let them choose to go there. That would be my selection. And I'm sure Sophia and others have suggestions as well.
That's my time, Mr. Chairman.
Thank you. I believe Senator Zelma Myrie has some questions. Senator Myrie?
Oh, I'm sorry.
Senator Myrie, you there?
Senator, well, we have
believe-
Senator
I believe we
Myrie
can-
and then Mr. Glover, so.
Yeah, I
Yeah,
would.
I'm sorry.
No, I would allow.
I'm in the midst of working, but I want to thank Miss Elijah, Sophia Elijah, for making and certainly reading my statement. I've had the honor of working with members of the communities whose loved ones are incarcerated, and certainly as the director of Alliance of Families for Justice, Sophia Elijah has talked about my own experience with my own family and the trauma and all the anxiety that's created when you have to visit loved ones and while you're anticipating or anxious about what is happening to them. I've experienced that through my parents and certainly experienced that throughout my family. And we certainly just are appealing that you do the right thing. And certainly that the pandemic has created a crisis not only within this country and the rest of the world, but certainly that crisis is magnified for people, men and women who are incarcerated. Thank you.
Thank you, sir. Now let's proceed to Senator Myrie.
Thank you, Chair, and thank you, Mr. Glover, for taking some time. I know that your schedule is incredibly busy, so we appreciate the testimony. Some of my questions were already asked, and so I just wanted to thank Sophia. It's good to see you, and Rob. It's good to see you as well. Thank you for the work that you do both for our families and for higher education in our correctional facilities. As I mentioned earlier at the hearing today, in speaking to Commissioner Annucci, my office has received numerous complaints and reports from families about the conditions inside, both related to visitation, but also to retaliation, to the lack of programming, and just lack of transparency. So I just want you guys to know that we are here to lift up the voices of the families as well. Please do not hesitate to reach out to us if there's anything that we can do in our communication with DOC. So thank you very much for your work.
Thank you.
Thank you. Any other member would like to ask questions? Okay. Senator Rivera, do you have any other questions?
I'm good for the moment. Thank you.
All right. Thank you, all of you, for testifying today. Like Senator Myrie has indicated, we're here to help. I myself have a brother who's incarcerated, and I understand some of the anxiety that family members feel. So you have people that are sympathetic and understand that one of the most marginalized communities in our society are individuals that are incarcerated. So we're always here to help, and you can always reach out to my office or Senator Gustavo Rivera's office. Thank you.
Thank you so much.
Senator, can I say a comment before we leave?
Yeah, sure.
Yeah, I just wanted to get a feeling from you and Senator Rivera with regard to restoring the TAP and the Pell Grants for people. As a formerly incarcerated person who received an education in prison years ago when it was such a different arena then, you could get a bachelor's, and I also got my master's there. I paid for it, me and my family. But the constraints on funding is so strained. And also, most people who are incarcerated are first generation college students, and their families are really proud of them. And incarceration is such a place of marginalization, again, coming from marginalized communities. And college is one of the most positive things that we have going there. And just wanted to know your thoughts about Pell and TAP.
Well, look, to be consistent, I had indicated earlier on, after some of my colleagues spoke, that we have to keep this focused on COVID and the impact of facilities. Look, I'm in favor of restoring TAP. But that's a discussion that we can have either at the end of the hearing, or we can speak offline about it, because I need to be consistent about us staying on message and focus on what the issue is here.
Okay, well, thank you.
Thank you. All right, so we are now going to take about a 15-minute break for whatever reason. So we'll start the count, and when we start up again, I'll reach out to everyone. We have the timer on now, so it's an opportunity if you get something to get a drink, to eat, go to the bathroom, whatever you need to do, but you have 15 minutes. Thank you. Next panel.
1 second.
Okay.
Our control room is.
Welcome back, everyone. We're going to continue with the hearing. I hope everyone had an enjoyable break. Our next panel is consistent of individuals that are formerly incarcerated and have a wealth of information to provide. So please, we have with us Maurice Wilcox, the formerly incarcerated at Easton Correctional Facility. Yes, Albert Beckery, formerly incarcerated at Fishkill, and Jermaine Barrett, formerly incarcerated at Greenhaven. Let's start with Mr. Wilcox.
How you doing? Good day. I'd like to thank all the senators and to everyone who's testified, as well as anyone who's listening. I've been listening live for the entire morning. At the same time, you see in the background, I'm also a salon owner, so I'm also at work. However, some of the solutions that I've been listening to about the COVID problem in prison are kind of from being a formerly incarcerated person that just came home in July. The circumstances in the prison system are really dire, meaning that the PPE for whether it's staff, masks for prisoners, the congregation of trying to separate everyone 6 feet apart, it's almost impossible to do. You cannot do it in the yard. You cannot do it in the hallways. You cannot do it in the cell blocks. The cells itself, I heard that someone had read into the record about the conditions of the ventilation in cells. Easton Correctional Facility has 2 cell blocks, West Wing, East Wing, that do not have ventilation. Windows, yes, but do not have ventilation. The heated problem is a very difficult problem to deal with. So imagine trying to deal with a COVID crisis and situation. When you look at the overall conditions of the prison system itself, it's just impossible to really contain the COVID circumstances without release. You have to start looking at clemencies. You have to start looking at parole. You have to start looking at other issues and matters that would actually help. It is too condensed and congested in the prison system in order for us to do anything if we had a rampant outbreak. Being a salon owner here, the regulations that I have within the salon, just in making sure that temperatures are taken, stations are cleaned, the disinfectants, the sanitizing, the gloves, the mask, it's so hard in here. And when I look back from just coming home a few months ago, which 2 months ago, many people are not wearing masks, including staff. When administrators are around, of course, everyone is on their best behavior. The captains and the lieutenants and the sergeants and everybody plays the part. But when everyone goes away, no, they're not wearing masks and gloves at times, and you cannot control that. We cannot control, even if you gave tickets, tier 3s, tier 2s, tier 1s, you cannot control someone that feels like he doesn't want to wear a mask. One of the things that were brought up is, were there any tickets given out? That's just something that you just cannot control. When you look at the circumstances, what's happening on visits right now, that's a hard circumstance and situation because yes, someone may say it's retaliation based on how someone acted on a visit. Maybe someone gave a hug when they weren't supposed to. Someone gave a kiss when they weren't supposed to. But when you have loved ones that you haven't seen for months, when you have children that are crying prior to them leaving, it's very hard. The mental health on someone that has been inside for such a long time without a visit, without any trailers, with any of the sorts, who go down to see a family member and not being able to embrace or be able to touch. It's the mental conditions and the mental health of someone is also affected by this. So when you look at the overall solution, it kept being asked earlier, well, what are some of the things that we can explore? I was IOC chairman for many years throughout many facilities, and we've come up with all kind of things that we could have done prior to COVID, during COVID, and there's some things that are happening now. You have to look at decreasing the population. You cannot really attack this and you cannot contain it unless you look at decreasing the population.
All right, thank you, Mr. Wilcox. Let's have Mr. Is it Beckery or Beccari? Is he here?
He is, but he's muted right now. Unmute yourself, Mr. Beckery. Or maybe Mr. Beccari. We're about to find out.
No, Mr. Beckery.
All right,
Thank you, Senator Sepulveda and Rivera, and distinguished members and guests. Thank you for allowing me to testify today. I just completed serving 13 years as an inmate in the New York State prison system. I was released in July of this year. I served at Attica, Elmira, Cayuga, Orleans, with brief stays at Auburn, Ulster Green, and Wallkill. I spent my last 17 months at Fishkill. With regards to the coronavirus, I resided in a Fishkill dormitory with older inmates, many with serious health issues, not all, just some of them, one of whom was Louis Leith. Mr. Leith was a gentle-spirited 68-year-old African-American and a fellow military veteran with 26 years in prison. On March 30th and 31st, a Monday and a Tuesday, Mr. Leith went to sick call complaining of flu-like symptoms and was sent back to our housing unit each time without being tested or given adequate treatment. On Wednesday, April 1st, around 7 a.m., Mr. Leith was found on the floor of our housing unit bathroom in distress. I personally pushed Mr. Leith in a wheelchair to the infirmary where he was finally admitted. That was the last time I saw my veteran brother, Mr. Leith, alive. Within a couple hours, our housing unit was placed under quarantine. Around 11 a.m., the residents of our housing unit, about 40 inmates, were summoned to our outside porch where Superintendent Leroy Fields, accompanied by senior staff members, informed us that Mr. Leith had tested positive for the coronavirus. Mr. Fields patiently answered all of our questions. And during this meeting, one inmate explained to the senior staff how Mr. Leith had been repeatedly neglected. Mr. Fields, really incensed, repeated the account word for word, indicating he would investigate. During the quarantine, our meals, medications, insulin for diabetics, and family food packages were delivered to us. Medical personnel took our temperature daily, and Mr. Fields authorized all-day access to our outside porch for fresh air while doubling our cleaning supply ration every day. All inmates in our unit were issued surgeon-type masks while our corrections officers were issued N95s. During the quarantine, Captain Washer, who's a great guy, came in on a weekend in his civilian clothes on his own time to provide us with an update, remind us to wash hands and use our masks, and assure us that the staff is doing everything in their power to keep us safe. And that personal touch really meant a lot to many of us, and is a credit to Captain Washer and the senior staff at Fishkill. It's commonly known that prisons are not conducive to preventing the spread of viruses. However, the unique physical layout of the Fishkill facility is far worse than most facilities. Something that Mr. Wilcox mentioned. Each of our two large housing units, Fishkill, each containing numerous housing units, there exists a long maze of hallways, what everyone refers to as the walkway. They collectively are several hundred feet in length, and these walkways force inmates and staff to pass within 2 or 3 feet of each other. And you'll cross between 50 and 100 people several times a day. Combine that with the shared mess hall, common bathroom, showers, and TV room, and the possibility of preventing the spread of a virus seems nearly impossible. However, there's one other aspect of the Fishkill facility and many other facilities around the state mentioned by Senator Sepulveda and Mr. Wilcox that poses a grave threat with regard to airborne viruses, and that is the issue of air quality within each dormitory. Fishkill was constructed 124 years ago. Not a single housing unit of which I am aware has any working active ventilation system. They have fans inside blowing, air around, but nothing actively bringing in outside air. They've been boarded up or painted over a long time ago. And this means that fresh air can only come in from open windows, which provides marginal circulation during the summer, and during the winter is an ongoing serious source of tension between residents who desire fresh air for their health and those who don't want to be cold. I've experienced non-functioning fresh air ventilation systems in upstate facilities as well, several of them. This lack of air circulation is a problem during the flu season and a disaster during the pandemic. It is my hope and prayer that the docks pursues ongoing vigilance and addresses this critical issue of providing a healthy environment. And I want to thank again Senator Sepulveda and Rivera for allowing me to testify today.
Thank you, sir. Now let's have Mr. Barrett testify. He's formerly incarcerated from Greenhaven.
Good afternoon. Good afternoon. My name is Mr. Jermaine Barrett. I've been incarcerated for 15 years. I was just released July 28th. I'm also a graduate of Columbia University Prison Education Program of 2018. I'm here to testify to the unconducive situation in regards to safety and health that was in particular at Greenhaven Correctional Facility. March 14th, as you know, the visits were shut down. It wasn't until maybe a month or so that there was any recourse in regards to masks, gloves, sanitation supplies, cleaning supplies, things of that nature. Initially, when everything was shut down, more or less we were left to our own devices. Individuals try to be proactive and use preventive measures by wearing handkerchief that state issues supplied. And we were told not to, based on the impediment of our ID or of our facial area where we couldn't be identified. And then maybe several months, well, not several months, a month or so down the line, we would issue those same handkerchiefs for anyone that didn't have any handkerchiefs to use as a face mask, which was somewhat inadequate because I was located in part of the UPD section of Greenhaven, which is the unit for the physically disabled. So if you're in a wheelchair and you lack the ability to use a sewing kit, how are you supposed to hold a mask over your face? There were several issues that actually took place throughout my incarceration or at that particular juncture of the pandemic. Was an individual named Mr. Smalls, who was also located in the honor block, which is right above the UPD section. He complained 4 times, went back to sick call 4 times and was told to go back. As it was stated early, if your temperature is not over 104, it wasn't any immediate action being taken place. He had flu-like symptoms. He had he complained about breathing. And again, was told to go back until he succumbed to his injuries and died. Greenhaven in general, as it was already stated, and other prisons lack the ability for social distancing. We have open cells with bars. Cells are lined up right next to each other. Other individuals who also exhibited COVID symptoms were, sent back from sick call. Some made it to actually into the infirmary where they were warehoused and put in rooms that were unclean because porters were told not to do their job because of the high infection rate we was told in regards to COVID. And throw in the rooms and had to fend for themselves more or less and put on a 14-day quarantine. They finally made an adjustment as a recourse to move individuals from one housing unit or one block and house any individuals that were sick, or any individual that exhibit COVID-like symptoms, and put in isolation for 14 days. One individual in particular, I was also in the honor block, was put in isolation. He told me that he didn't get that he got received ibuprofen. He never got tested for COVID upon returning back to population, and still had symptoms, and to the point where his family had got involved, and through his lawyer, wound up getting in contact with medical, and they finally gave him an X-ray and found out he had pneumonia in one of his lungs, and they treated him for that particular thing. And actually, this individual worked in a mess hall, serving general population, and there was other individuals like himself who also worked in the mess hall that got sick because it was a big outbreak in the mess hall. So again, just to reiterate, it was bottom line, state facilities, in particular Green Haven, are not conducive. It's very inadequate in regards to the medical that is already being received prior to the COVID epidemic, and it's just being further exacerbated with the pandemic. And individuals are really at a loss, and it's not, we don't have the medical staff to adequately care for the inmate population. So again, it's recourses in regards to clemencies, also recourses in regards to medical release based on underlying issues, in particular individuals that have one lung, asthma, diabetes, and things of that nature that are not being recognized. And again, I appreciate your time and this opportunity. Thank you.
Thank you, sir. I want to thank all three of you for your testimony. I have Senator Zelma Mari, who's up for some questions. Senator?
Before we continue, can I add something?
Quickly.
Okay, yes. I did 22 years incarcerated. I was in Green Haven, Sing Sing, Fishkill, Otisville, Easton, and all, as he just said, the way the entire system is set up, between air quality, between passing in the hallway, between having to converse, between a simple pat frisk, it's impossible. It's impossible because of the circumstances and pretty much geographical locations within the facility for anyone to be within 6 feet, to be sometimes within 2 to 3 feet. It is so difficult because of the fact that I've been to all of the facilities. It's just impossible. It is too condensed and it is impossible. And I just wanted to say that because of the fact that I've been to so many of the law facilities that I was able to attest to that. Thank you.
Thank you. Senator Mari?
Thank you, Mr. Chair. And I didn't have a question. I just wanted to thank all three of the witnesses for their testimony. I know that it's not an easy thing to come before a legislative body and to share your own personal experience. So I just wanted to thank you for that and for the feedback that we will take back and hopefully take some action on. Thank you.
Thank you, sir.
Senator Rivera.
Thank you, Mr. Chairman. I also thank all of you for being here today. Mr. Wilcox, you came back in June, you said?
Yes, I was released in July of this year.
Gotcha. And Mr. Beckery?
July also.
July. And Mr. Barrett?
The same, July 28th.
Okay, first of all, welcome back home. That's number one. Number two,
thank you.
You each had a little bit to say about this, but obviously in July, we were, the pandemic was still very much in full force, right? And you were incarcerated during the worst parts of it in March, April, and May.
Yes.
So I wanted for you to give us a sense about some of the conditions during those times, particularly as it relates to PPE. We've heard different reports about the fact that incarcerated people were not allowed to use hand sanitizer. There was limited access. There was limited access to soap, so the hand washing was limited. We already know about the conditions about the particular living facilities, which are, as we talked about earlier, as far as double bunking, which are very close. So all of those things were part of the issue that made it worse. But if you could talk a little bit about what your experience was during those times, since we have some limited time. I'll go with Mr. Barrett first, and then I'll go back to Mr. Wilcox and then to Mr. Beckery. Mr. Barrett, if you could.
Actually, that was one of the main complaints in regards to being able to wash your hands on a frequent basis. Obviously, security overrides everything. So they're not going to open up your cell because I'm in a locked-in cell situation. However, with the UPD wing, you have the opportunity.
UPD, I'm sorry, sir, UPD?
Yes, that's the unit for the physically disabled.
Thank
We're
you,
primarily individuals that, sure, no problem. Primarily individuals that's on that wing are in wheelchairs or are missing limbs or things of that nature. You have the ability to be out on a unit throughout the course of the day when it's not count time. So, but with that being said, the cells are locked. So if you're eating, if you're having a discussion, or if you need just purely just to wash your hands for whatever reason you need to wash your hands, that doesn't happen unless you have to lock in. So the lack thereof regards to being able to wash your hands is just, or the ability to wash your hands is just not there. As a recourse, they did place a hand sanitizer machine at the control console, which is located outside the unit. But even with that being said, we have to ask officers to let us out.
A quick thing, and then Mr. Becker and Mr. Wilcox, did you say something about 104 degrees? You were told specifically that unless somebody was had a temperature of a 104, that then they wouldn't even be admitted. Could you tell us a little bit about that again? Was it you or Mr. Wilcox that mentioned that?
Actually,
you did. So it's your experience. What your testimony is your experience was that you were told that unless the temperature was 104 degrees, that you would not be tested or admitted. What was it exactly that happened?
Well, actually, it was testified earlier that someone had said. I think it was the individual from.
So this was not your particular experience.
No, actually, it wasn't my experience because I never got sick. However, it was individuals that were turned back from being fully admitted into the infirmary because their temperatures wasn't high enough, and medical staff opinion to be admitted.
That's what I'm saying. So you actually saw people coming back who were not admitted, who even though had a fever, because the fever wasn't high enough, they weren't actually admitted.
Yes, sir.
Okay, Mr. Beckery, could you tell us a little bit about the experience that happened during those times leading up to July release?
Well, Mr. Wilcox was correct in saying that when the sergeants and lieutenants and the various brass are around, everyone wore their masks. But when it was just us, our dorm officer, or you're at work or whatever, a lot of people didn't wear masks.
So the officers and staff did not wear masks,
including staff members. That's correct. It's just it's just the nature of doc.
And were you aware of anybody who was as far as incarcerated people, anybody who was not provided a mask and then held to account?
Oh, that's a good question, Senator. First of all, masks were plentiful. They were made available on a regular basis. They'd hand out new masks. If you lost yours or it got dirty or you dropped it or whatever, they'd replace it. There was no shortage of masks at Fishkill, in my experience. And as far as hand sanitizer, a large dispenser of hand sanitizer sat on the CO's desk at all times. And when you walk by, you could just sanitize your hands many times. So that was available. And like I said during my previous testimony, the superintendent mandated the doubling of antibacterials, and they added bleach and the cleaning supplies every day for, usually there's a 1-day run for what they call the caustics or the cleaning supplies. And double that every day right up until the day I left.
Gotcha. So my time has expired, but thank you, Mr. Beckery. And Mr. Wilcox, you certainly talked about this earlier, so thank you for sharing it earlier. Thank you, Mr. Chairman.
Thank you, all three of you, for testifying. I've visited some of these facilities that you've mentioned and see how hot it is and poor ventilation. I have personal views. I've seen them all. And I too have some concerns about the ventilation system in those facilities. They're very old facilities. They are not built. Some of them weren't even built over 100 years ago. So we're aware of it. We thank you for the testimony, and we'll raise that issue and continue to raise it and continue to prosper. You guys have done very well here. Thank you so much, and God bless.
Thank you. Thank you, Senator. Thank you personally, too.
You're welcome. All right, so we will now move on to our next panel. We have 5 members of this panel. We're going to start, let me announce them all, and then we'll go one by one. First is Karen Murtaugh, the Executive Director of Prisoners Legal Services that does fantastic work in the state. Stan Herman, the Executive Director of the New York County Defender Service. Kelsey De Avila, Project Director of Brooklyn Defenders. Susan Gotterer, Nassau County, and forgive me if I mispronounced that, Nassau County Chapter Director of New York Civil Liberties Union. And Martha Greco, Prisoners' Rights Attorney for the Bronx Defenders. Welcome all. Let's start with Karen. Karen, I hope you're well. Why don't you begin?
Thank you, Senator. I hope you're well also. Thank you both Chair Sepulveda and Chair Rivera and members of the Senate Crime Victims and Corrections Committee and the Senate Health Committee. Thank you so much for holding this critically important hearing and for inviting PLS to testify. I'm Karen Murtaugh. I'm the Executive Director of Prisoners Legal Services of New York. And as most of you know, our organization is focused on conditions of confinement in the New York State prisons. In 2019, between January 1st and September 1st, PLS received 6,133 requests for assistance. This year, during that same time frame, we received 7,539 requests. And of those 1,400 additional requests, over 1,200 were solely about COVID. So we have submitted extensive testimony regarding the concerns that were raised in those requests. And I know my time is limited, so I'm going to focus on what's at the end of my testimony, which are 9 recommendations that we make that we think could help alleviate some of the issues that have been brought to our attention. First, and what we believe is most critically important, is to address the issue of people being held past their scheduled release dates due to suspension of programs. As stated in our testimony, we have heard from hundreds of individuals who have been held in prison past their CR date, merit release date, denied limited credit time allowance, any type of early release through no fault of their own because they couldn't take the program that they were supposed to take because they were all suspended since March. So we recommend that the legislature take action to amend any statutory criteria regarding programming, or at least temporarily suspend any statutory criteria regarding programming so that failure to complete a program due to no fault of the individual cannot be held against that person. We also recommend that if failure to complete a program is the only reason a person is currently being held in prison, meaning that they've been denied parole or merit release or LCTA, that the legislature mandate that docs and parole release them to community supervision. Because what docs or parole can do is to simply mandate that the person released find that program on the outside and comply with any program requirements that they want to set. We suggest that the legislature require docs to consider medically vulnerable people for early release who are within 1 year of their next release date. That is not a standalone requirement right now. Right now, it's just if you're nonviolent and you're within 90 days of your earliest release date. We think you should do this for 2 reasons. One, it is to protect these individuals from contagion and possibly death, especially if a second wave should come. And 2, it is to help reduce the prison population and to allow for better social distancing. There's absolutely no reason this can't be done, just like it's being done with the early releases that are happening now. Docs and parole still consider safety and security of the public before someone is released. They could do this with medically vulnerable people. In addition to that, and it goes along with social distancing, the legislature could look at the existing bills, the Less is More bill, Fair and Timely Parole bill, Elder Parole bill, with a focus on increasing social distancing in the prison by decreasing population. We also recommend that just like school districts, docs be required to develop and implement a remote learning program for all students within docs. Docs is a school district. All the school districts in the state have had to do this, and this has been going on since March. So there's no reason that remote learning, especially since tablets are available to the entire prison population, shouldn't be being done within docs. I'm going to run out of time. So this is another major issue, and it's with respect to PLS and our ability to represent our clients. Because they stopped visitation, we couldn't go into the prisons. Now there is visitation, but we're also very concerned about the health and welfare of our attorneys and bringing COVID back into the prisons, which we don't want to do. There's a directive with docs in terms of phone calls that only allow 1 30-minute phone call a month with a client. That's not enough. Docs has given us some exceptions to that when necessary, but the bottom line is we need video conferencing with our clients. They're doing it in Albany County jails. They're doing it in other federal facilities across the country. There's no reason we can't do it. And hand in hand with that goes the issue of docs and the AG's office not being available to engage in litigation. They say that they don't have the technology. Well, they Zoomed this morning, and the legislature didn't have all this technology in March, but you're holding a Zoom meeting. So we ask that whatever needs to be done be mandated that they do this.
Thank you, Karen. And stay on because we may come back to you. Next is Stan Herman, the Executive Director of New York County Defender Services. Welcome, Stan.
Thank you. My name is Stan Herman, and I'm the Executive Director of NYCDS. We are a public defense office that represents New Yorkers in thousands of cases in Manhattan's criminal and Supreme Courts every year. Thank you to Chairs Sepulveda and Rivera for holding this hearing on the impact of COVID-19 on people incarcerated in New York jails and prisons. Please note that I've introduced substantive written testimony, including a report produced by my office based on a survey of incarcerated clients in Rikers Island. During the height of the coronavirus pandemic in March and April of this year, our entire staff was working around the clock to file writs of habeas corpus to allow our most vulnerable clients to be released from New York City jails. The number of NYCDS clients incarcerated at the beginning of the pandemic dropped by nearly half. Our collective efforts paid off, and together with other stakeholders, the city jail population dropped to the lowest we have seen since 1946. Yet now, as the pandemic continues to rage across the country, we are seeing the city jail population begin to rise once again. While we had a fair amount of success at the city level, securing release for our clients in pretrial detention or serving misdemeanor sentences, we saw almost no movement at the state level. Governor Cuomo has only granted 3 clemencies amid the COVID-19 pandemic, fewer than most Democratic and Republican governors across the country, including California, Kentucky, and Illinois. For NYCDS clients in state custody, we had no meaningful avenue for redress to demand their release. And so they continue to sit in prisons that do not allow for social distancing, do not have sufficient PPE, in close quarters with guards and other staff who cycle in and out of the facility and their communities on a daily basis. I want to now focus my remarks on the untenable situation at DOC facilities in New York City, which is the persistent and inexplicable lack of mask wearing by correction officers. In sum, based on direct observation by my staff, at least half of New York City correction officers are either not wearing masks or wearing them around their chin with their nose and mouth exposed, and thus rendering them useless. It is unfathomable that after what this city and state have gone through during this pandemic, that we have persons refusing to wear masks in a jail of all places. While the infection rate is low throughout the state and the city, the virus is still very much here. Last week, we had 5,537 new cases and 60 deaths in New York State. That included 38 deaths in New York City and 2,399 new cases in the city alone. Earlier today, I was stunned when we had conflicting testimony from DOC Chief Jennings, who clearly stated upon a question by Chair Sepulveda that it was a recommendation that staff have to wear masks. She spent a lot of time talking about the education campaign around wearing masks. And then that was immediately followed by the Deputy Commissioner of DOC saying that it was a mandate. Which is it? How is it that here on September 22nd, we have a conflict over whether wearing masks should be mandatory in our jails? I also hope that many of the members on this committee will follow up with Department of Corrections Union President Benny Bosio and ask him why his members are not wearing masks. They lost 8 members to the virus. Another 1,400 tested positive. And yet every day, hundreds of their membership are refusing to wear masks while at work. My lawyers and our clients personally make these observations of maskless COs every day. Based on our observations, COs do not believe it's mandatory. And even if they do, the lack of any disciplinary action means it's a powerless policy. My lawyers and staff need to be able to visit incarcerated clients to provide the level of advocacy that they deserve. However, I will not ask my staff to place their health at risk because correction officers are choosing to ignore what the CDC director, Surgeon General, Dr. Fauci, and Governor Cuomo are asking of all Americans to help combat this virus, which is wear a mask. What can you do? Well, you can demand that New York City Department of Correction issue a written policy for mask wearing by its employees with real consequences for non-compliance. You can pass a bill to allow for the release from jails and prisons during emergency situations. Last month, your colleagues in the New Jersey State Senate voted in favor of a first-in-the-nation proposal to potentially free thousands of people from New Jersey prisons because of the high risk of coronavirus infection. And you should follow their lead. Lastly, you can pass decarceration legislation that is pending in this body, elder parole, fair and timely parole, and the Less is More Act. Please use your positions as New York State leaders to demand accountability from DOC and ensure that incarcerated persons are being provided with the same dignity and protections that all New Yorkers are receiving during these unprecedented times. Thank you.
Thank you, sir. Next, we have, let me make sure I have the right order. Kelsey de Avila.
Hello, everyone. My name is Kelsey de Avila with Brooklyn Defender Services, and thank you, Senators, for holding this important hearing. As it's been stated today and by experts across the country, in order to keep people safe and save lives, we must release people from jails and prisons. Jails across the state are seeing an increase in population. New York City alone has gone up hundreds in the last couple of months. And if there's one thing to take away from this hearing, it's that there's a desperate need to decarcerate. And I do want to just kind of talk about a few things of points of concern that came up. First is about guidance on safety protocols. Based on conversations and testimony, even today, New York City DOC is saying that they're waiting to receive guidance from DOH about reopening in-person family and social visits. Yet DOC is operating legal visits with what we believe to be no guidance at all. It's unclear where DOH is involved in this process and why there doesn't seem to be much pressure from either agency to establish any form of guidelines or policy. Today, DOC Chief Jennings said they're keeping housing capacity at 50% to allow social distancing, but that is simply not true. Right now, majority of units are close to or at capacity. The jails will once again be the epicenter if we are not prioritizing the needs to protect people in city jails. And I know she wasn't here today, but yesterday at the city council hearing, Commissioner Brand was asked about legal video visits, and she was presented with all the issues: poor quality, availability can be weeks out, there's cancellations without reason. And the commissioner stated, and nonchalantly really, that attorneys can just come in if they really wanted to talk to people. And the answer I felt was very dismissive. It showed a lack of interest in protecting people. It did not assure the public, especially people in custody, their loved ones, attorneys, social workers, that the department is taking seriously the threat of COVID, the threat of spread, and the importance of safety measures for all, her staff included. And secondly, I want to mention kind of about movement and testing practices. In a pandemic, we look to our public health experts, but the responses from DOC and CHS leave us questioning who exactly is making the calls here. DOC is actively moving people all the time. Every day there is movement, not just by the staff, but people in custody. They're being transferred from unit to unit or facility to facility quite a bit. We worked with a man recently who was transferred to 4 different facilities within a week. When asked, CHS stated that it's not practical to test upon transfer because transfers within custody happen frequently. But these transfers are happening at the guidance of DOC. They're not from the guidance of CHS or public health officials. And with that, there's a lot of confusion around testing practices. Just yesterday at the city council hearing, CHS said that people are getting their results with 1 to 2 day turnaround. But my office spoke to someone who was verbally told by CHS just this month that they will get their test results in 10 days. So which is it? I think for the most part, BDS has spoken to a number of people who never received their test results in the first place. Their attorney got their results before they did because we put in a records request. And people are being moved to another facility without knowing if they had COVID. And it's resulted in a lot of mistrust towards staff and tensions within the unit. You know, people are rightfully scared. They don't know if a new person entering their unit will get them sick. CHS leadership is giving a very different story than what people in the jails are experiencing. And by CHS failing to communicate with people in the jails, it's potentially putting people in danger. And to that point, and just like Mr. Ramon was saying, DOC's clear lack of compliance, correction officers are brazenly not wearing masks, and they feel emboldened. And that's because DOC leadership is failing to enforce, and every day they're putting others at risk. And furthermore, the state has not publicly reported the number of people who caught COVID-19 in the jails and died post-release. Advocates and attorneys were working endlessly for their release, but for many, we know it was too late. But to understand the true impact COVID-19 had on the jails across the state and the spread of COVID-19 in our cities, we must know this number. And I really want to thank Senator Salazar for her questions on data and deaths, because it was clear that we don't have any answers and that there's still a lot that we don't know. And I just want to end on this, that there are multiple release mechanisms available to the state, perhaps most significantly the clemency power held by Governor Cuomo, yet none has been utilized to release even those most at risk of death due to COVID. Instead, Governor Cuomo issued clemency to only 3 people, which I know was stated. Attorney General Tish James has even defended the state against lawsuits seeking to release pregnant women and other vulnerable people. And the state's failures have in fact resulted in tragedy. I mean, before the predicted second wave hits, we urged the legislature to pass and governor to sign elder parole and fair and timely parole, which together would guarantee all people in prison a meaningful opportunity to be with their loved ones and communities. Thank you.
Thank you so much. And I just want to say before I even go around a second round is that I am very concerned about some of the testimony we got from people city commission, from the city's doc. I too felt there was a little level of flippancy in some of their responses, but you know, we'll deal with that afterwards. The next speaker will be Susan Gotterer. I hope I pronounced it right. Susan, forgive me if I didn't. You can proceed, Susan.
Thank you. Thank you so much for holding this important hearing, Senator Sepulveda and Rivera, and for giving me the opportunity to speak here today. I am Susan Gotterer, the director of the Nassau County chapter of the New York Civil Liberties Union. NYCLU is the New York State affiliate of the American Civil Liberties Union and is a not-for-profit, nonpartisan organization with 8 offices throughout the state and over 180,000 members. I'm here to share the experiences of incarcerated people and their families during the COVID-19 crisis at the Nassau County Correctional Facility, specifically with an eye toward future preparedness based on written science-based protocols, humane communications policies, and internal administrative consistency. I'll begin at the macro level and the idea of leadership. Like Governor Cuomo, County Executive Laura Curran never in all her daily briefings expressed concern for those inside or for their families, sending a very clear message that they didn't matter. As the crisis began, advocates began to receive frantic calls, people sharing their health issues and pleading for help because now they were not facing 6 months for parole violations, low-level offenses, or even innocence. They were now possibly facing death. As a result, advocates repeatedly asked the county executive to consider compassionate release, we asked her to publicly state the importance of safeguarding the health of incarcerated people and to share in writing the health policy document guiding the county's actions, all of which she never did. Communications with family was also sorely lacking. It wasn't until April 28th, well over a month into the crisis, when a notice to families was finally posted on the county's website. And this happened after only some advocacy by the community. The palpable fear was exacerbated by the facility's notorious history of medical neglect, mismanagement, and violence, and leadership silence was feeding that flame of fear. Now allow me to share some of the issues we found during COVID at the Nassau County Jail. The solution to social distancing was keep lock. This means people in their cells for 22 to 23 hours. And we just want to say Keep Lock is not a solution to social distancing. There was also no separate policy for people with mental illnesses. And we know that the situation as certainly concerning Keep Lock really ups the ante on depression, anxiety, and suicidal ideation. During the 1 hour for yard time, people were asked to come back in to take medications or use that time for phone calls or even showers, not its intended use. Oxygen was being administered inside cells with no apparent regimen of constant medical monitoring. Family members of diagnosed patients were going 3 and 4 days with no contact from their family members. They were not notified when their loved ones were taken to the hospital, and the policy was that they would be notified if their loved ones were admitted, which also means they could have been intubated by that point. There were also reports from family members of COVID patients in cells together, which the administration denied, but then we found out later that people were moved after we made those complaints. We had reports of correctional officers delivering food without masks or gloves. People inside the jail reported a lack of access to masks and hand sanitizers. We don't know if language access was provided in any information about COVID. And again, there was no written science-based policy available to the public. Now, you may hear from the county that Nassau did a good job based on its numbers, but human beings are not numbers, and leadership matters. And I'm quite sure that nobody was in that facility sentenced to death. So we ask you to consider all these things. NICLU also asks that we consider, for those already out under community supervision, pass the Less is More Act so they are not reincarcerated, expand compassionate release for elders and the medically vulnerable, release all incarcerated people who are pregnant or part of the nursery population, release all transgender and gender non-conforming people who are highly susceptible to abuse and medical care failures while incarcerated, and for those who must remain inside, pass the Halt Solitary Confinement Act. And finally, as a matter of fundamental human rights, DOCS must take every precaution to ensure the people in its custody are protected from COVID, ensuring wide availability and use of appropriate PPE and mass testing for both incarcerated people and people working in the system. We're asking for the document that guided the principles of protection inside the jail. They can't present it, they haven't presented it, and we ask that you ask for it.
Thank you so much, Susan. Right on time. Next, we have Martha Greco from the Prisoners' Rights Attorney, Bronx Defenders. Welcome, Martha.
Thank you. Good afternoon, Chairs Sepulveda and Rivera and committee members. My name is Martha Greco, and I'm a public defender at the Bronx Defenders. Thank you for your attention to these critical matters and for the opportunity to testify before you today. I'll be focusing on the city jails. The impact of COVID-19 has dramatically worsened conditions in New York City's jails, exposing persistent violations of the minimum standards for the treatment of people in custody and a troubling lack of transparency and accountability. Our clients are afraid for their lives. They're understandably distressed. Through our clients' experiences, we highlight for you today the following major concerns. Before the pandemic, the city jails were already isolated from the public eye. Despite the vast majority of people in New York City jails being pre-trial detainees, convicted of nothing, simply awaiting trial on bail that's too high for their families to pay, the conditions mirror those of maximum security prisons. Over the past 6 months, the jails have become dangerously more isolated and neglected. Now that courts are beginning to operate in person again, our clients are supposed to be produced to court within a few days of entering custody to determine whether a grand jury has indicted them. It is unclear how this necessary movement to court works with new admission testing and quarantine protocols, as referenced in Dr. Yang's testimony. We've already had a client not produced to court because supposedly his test results weren't available. Failing to produce someone to court because COVID test results aren't available affects our clients' legal rights. Access to counsel for incarcerated people has been significantly limited since the onset of the crisis. Video conferences continue to be the only reliable and safe way for attorneys and advocates to communicate with our clients in custody, to conduct virtual court appearances and competency exams. We have seen the department struggle to produce our clients by video for court appearances and counsel visits, sometimes requiring the case to be adjourned and creating unnecessary delays in due process. There are also often issues with the audio in the video conferences, including loud background noises and the ability to hear conversations happening between other attorneys and their clients in neighboring booths. Our clients are frequently produced late to the video conference, cutting into the 30 minutes allotted. These conditions impair our clients' access to their defense team. Finally, while we continue to push for statewide legislative changes and the passing of the HALT solitary confinement bill, advocates are anticipating a welcome end to solitary confinement in New York City jails. The city's Board of Corrections proposed changes are due to be released in October. We are very concerned, however, that implementation of the board's new restrictive housing rule will not be successful without access to counsel in the disciplinary process. Since the onset of the pandemic, a once skeletal due process structure for disciplinary infractions has all but ceased to exist. With all of our clients who have been placed in solitary confinement during the pandemic reporting to us that they received no due process hearing. We've seen time and time again, neglect and isolation are deadly, especially now. As part of the overhaul in restrictive housing and the disciplinary process, the department must implement a system similar to that of Washington, D.C. They should notify an incarcerated person's attorney when their client receives a disciplinary infraction and offer the opportunity for an advocate to be present at any fact-finding. We appreciate that the department takes a non-punitive approach to mask requirements for their staff, and we hope that this philosophy will extend to people in custody in the disciplinary process. Approaches to violence in the jails that are truly restorative always involve a support person for the people on both sides of the conflict, as this increases accountability and investment in the process and long-term change. Having an advocate by their side heads off any potential issues that are caused by the increased isolation due to COVID-19. While finding ways to release as many as possible should always be the priority, for those who remain incarcerated, it's critical that conditions be improved. Everyone in custody deserves to have access to the medical and mental health care that they need and to a team of outside advocates. The pandemic is not over. It has ceased to ravage our state for right now, but a second wave is predicted. The state must act now to prevent the pain and suffering of so many more people inside our city jails and use the pandemic for good, as a catalyst to create life and liberty affirming ways of addressing violence, ending our destructive addiction to incarceration and solitary confinement. Thank you for your time.
Thank you so much, Martha, for your testimony. Me personally, I'm going to tell you, I'm going to follow up with many of the panelists, especially this group, to just get some more information on what their experiences have been. Myself as a practicing attorney, I find it disturbing that you can't access your client in a way that, with modern technology, what we have, you should be able to have a fruitful discussion with the client at all times. So we will follow up with you. Certainly, I know that my colleagues that are on and the co-chair will follow up on potential legislation. But thank you again for your testimony. Now, before you go, let me see if, well, first let me announce that we've been joined by Senator Biaggi, and Senator Myrie has some questions. Senator?
Thank you, Mr. Chair, and thank you to the panelists. I want to focus on the communications with your clients and the adjustments that DOCS has made. I'm just wondering, and anyone can answer this, on how confident you feel in the attorney-client privilege in the context of it moving to video conferences, and just kind of talk about what that experience has been like and just what your level of confidence is.
So I think what I'm hearing from my attorney, Senator, is really the quality is really a very big issue. I've heard instances where they could hear the conversation taking place at the booth right next to them, which is obviously very concerning. There's been technology issues. Sometimes you can't really see your client. So I think for me, it's a quality issue at this point. I really don't know enough about kind of IT work to address the security issue. I hope and pray that it is a secure line. But for me, the most important issue right now is the lack of good quality doing these video conferences.
And I would just like to add that this is different than it was before the pandemic. We've had video conferences always, but for some reason now the video conferences are more exposed to the general jail. You can see officers, you can see people milling about in the background. That didn't used to be the case. So it's probably because they've had to add more booths, which of course we appreciate. But there needs to be a respect for the confidentiality of that conversation.
Thank you.
Okay, any of my colleagues, Senator Biaggi, would you like to ask some questions?
I'm on deck.
Senator Biaggi? Okay. Well, thank you all for participating in today's hearing.
Senator, Mr. Chairman?
Yes.
I think you're
Oh, I'm
co-chair
sorry.
wants to speak.
I'm so sorry.
The only bald guy on your screen, bro. Mr. Snoggin. Come on, buddy.
Yes, Senator Rivera.
Thank you. Actually, thank you all for being here today. I actually want to throw it to any of you, but I'll start with Ms. Diavila. Obviously, you are far more experienced than I will ever be in how the criminal justice system works on a day-to-day basis, and I wanted to kind of dig deeper into the intake process actually at city jails. If you could talk a little bit about, what are some of the health and safety concerns there? What potential exposure there is, since part of what we're trying to do here obviously is develop better policy for the future. If there's something in the intake process that we could actually mandate be changed or tweaked, kind of talk us through that a little bit, please.
Yeah, so I mean, just kind of going through the process, when someone's arrested, they're arrested by police officers who aren't wearing masks. So there's your exposure right there. And then you are sent to, in Brooklyn, you're sent to, the central booking, the Brooklyn Criminal Court, where it's been reported, you're still in a large kind of holding, it's a cage. So it is, you're in a cage with, other people with a lot of close proximity. And then, if bail is set, you're on a bus, on a DOC bus where people are being handcuffed directly sitting next to a person. And then you go into an intake unit. So right now, it's MDC in Manhattan, AMKC on Rikers Island, and then for the women, the Rose M. Singer Center. And you enter the intake where you're still, again, in another cage, close proximity with other people, unclear, who has access to masks, if there's any PPE, or if at that point, it's there's just so much, close proximity and not a lot of sanitation happening. And it's also a very transient population and area. So people are constantly in and out. And then from there, after they have their 4-hour intake with CHS, we know that they are then sent to new admission housing. And I think this is an area of point of concern that we don't have a lot of information, and it's unclear why CHS hasn't been transparent about this. So when you enter the new admission housing, you're entering in a unit where you've entered a day where people have entered days before you did. So now you have populations from different days entering the jail in the same unit. And we believe people are being tested maybe 2 to 4 days after entering that unit. So if, the first person who entered on a Tuesday, they're tested first before a second person enters that unit, right? So you'll get your test results back. And if they come back negative, you could be moved to another unit or another facility altogether. But you've potentially been exposed to a second person who's entered who hasn't gotten their test results back. Now, CHS said yesterday, and I've mentioned already, that they have a turnaround time of 1 to 2 days apparently, but we're hearing very opposite things, that people are getting their test results days and days, being verbally told by CHS that's 10 days. So it's really unclear, what exactly that process looks like. And this is where CHS, it would be great if they could share that information, be transparent in what their policy is, because if it's true that people are waiting 10 days to get their results, they are being exposed to a number of people in this new admission housing unit that is getting people in and out before they're getting their test results.
Since my time is limited, I figure if you could nod the other folks, if that describes kind of the situation, whether it's in the Bronx or in Manhattan, that kind of describes basically what's happening in all these different places. And so, and you're saying that you have looked for more information regarding the new admission housing unit, and that you're getting from the agency itself, they're saying that the turnaround time is 1 or 2 days, as well as tests being turned around very quickly. But from your clients, the experience that you hear is completely different.
Yeah, that's correct.
And that is also across the board from the other folks. If you can go like this or do like this. Go ahead.
Senator. And if I could just add that the lack of access to Department of Correction officials has been a really big problem. As a head of an office, I've been on stakeholder meetings with the chief court clerk, with administrative judges, with DAs. But the one party that has been missing at every single one of those stakeholder meetings has been the Department of Correction. They simply have not taken part, and I'm at a loss for words as to why.
That has been the experience with everybody else as well. Okay. Thank you for that. Thank you, Mr. Chairman.
Thank you. And guarantee you that Senator Gustavo and I will really look into this to see why the lack of information. So thank you all very much. Anyone else want to ask any questions? All right. Well, thank you again for coming here today, and I hope to be speaking with all of you in the immediate future. Have a good day.
Thank you, Senator.
All right, on to the next panel. We have with us Sharon White Harrigan, the Executive Director of the Women's Community Justice Association. We have Sobi Gebrselassie, and again, forgive me if I mispronounce your name. The Prisoners' Right. We have Kenyatta Thompson, the lead organizer for Cattell Center for Health, Equity, and Justice. Michelle Lewin, the Executive Director of Parole Preparation Project, and Andrew Ward, the Supervising Attorney for the Fortune Society. Thank you all for being here today. Let us start with Sharon White Harrigan. Welcome.
Well, thank you. Thank you, co-chairs and any other distinguished committee members. Thank you for this opportunity to address the impact of COVID-19 on prisons and jails. My name is the Reverend Sharon White Harrigan, and I am the Executive Director of the Women's Community Justice Association, also known as WCJA, and the co-creator of the Justice for Women Task Force, which is a special initiative under WCJA. And as women, mothers, academics, religious and non-profit leaders, healthcare providers, and formerly incarcerated and system impacted advocates, we have recognized the imminent danger facing incarcerated women and mothers during the current COVID-19 pandemic. We as a collective have formed the Justice for Women Task Force as a statewide response to urge the protection of women behind bars during this unprecedented pandemic. And our mission is to uphold and protect the inherent dignity, value, and human rights of incarcerated women in New York State. And while we were pleased that the New York State governor had announced that he would release certain individuals from the Department of Corrections and Community Supervision custody, and while we also were encouraged that the New York City's mayor continues to reduce the population at Rikers, there is much more that can be done during this crisis. We respectfully seek more releases, transparency, humane medical conditions to aid the women behind bars known as the invisible population in this pandemic. Little to no information exists on women eligible for release. And beyond demanding release, we stand by ready to offer the community support and affordable housing needed to successfully bring these women home. Furthermore, the women at the Rose M. Singer Center on Rikers can be placed into the community in a trauma-centered space much sooner than 2026. 3/4 of the women behind bars are mothers, many with babies in prison nurseries, as well as over 170 women housed in Rikers in custody at the Department of Corrections. Women and mothers are often the primary caretakers of their family. They are the heart and the pulse of the community. So we urge you to release the mothers so they can return home to their children. We are equally concerned for the welfare of correctional officers and other prison and jail staff to take every precaution and preventative measure to protect everyone and immediately halt the spread of the COVID-19 virus. We, the many of us who are formerly incarcerated women, here the state and the city executives assure the public that no life is expendable. Yet the plight of the incarcerated women, our sisters, goes unseen and unheard. Public health experts have repeatedly stated that people in jails and prisons must be released, which has successfully been done in other nations and states without any threat to public safety. We call on for responsive intervention for all incarcerated people. We demand an immediate and gender-specific response to be taken to prevent illness and potential deaths of pregnant women, the elderly, the disabled, and all women, girls, intersex, gender non-conforming, and trans persons in New York State prisons, county, and New York City jails. We call on the state and the city to release those with high risk of infection immediately, those who are older, pregnant, those with underlying health conditions, and mothers with babies in the prison nurseries. We recognize the high risk of infection posed by keeping babies and mothers in prison and urge their joint release as a family prioritized. Release not only those convicted of non-violent offenses, but older people, as research by leading criminologists shows that older people in prison convicted of violent crimes are the least likely to reoffend and return to prison. Immediately release those held on technical parole violations, all incarcerated people who have been granted clemency, and those within a year of their release date. While it was announced that all those held on technical violations would be released, many remain in prison. The first two individuals to die of COVID-19 behind bars, individuals were on parole and they were killed by a lack of expediency. Release all women to the least restrictive environment possible. All persons who can be moved to community supervision should be. These environments must adhere to Center for Disease Control guidelines, and all those returning to the community must have a discharge and treatment plan, including medical and housing resources provided by DOCCS and DOC. Award clemency.
Sharon, I have to stop you now. We'll see, we have a second run around, but right now I have to go to the next person.
Okay.
Bear with us. I'm
Thank
sorry,
you.
I have to cut you off. All
Thank
right, next is Sophie Gebrselassie. Please forgive me again if I mispronounce your name.
No, that was perfect.
Oh, it was. Oh, thank you.
Yes, my name is Sophie Gebrselassie, and I'm a staff attorney with the Legal Aid Society's Prisoners' Rights Project. Thank you for providing this opportunity to address how the state can better respond to pandemics in its prisons and jails for the safety of New Yorkers, both within and outside correctional walls. Experts universally recognize that releasing a critical mass of people is the most effective way to mitigate the risk of pandemic spread in carceral settings. Despite ample tools at their disposal, however, neither the governor nor New York State docs has acted to release a critical mass of incarcerated people. The 2,000 plus people mentioned by Acting Commissioner Annucci this morning is simply not a critical mass. And Governor Cuomo has granted only 3 clemency applications during the pandemic. The governor and docs' decision to ignore hundreds of requests for clemency, medical parole, and other forms of release from the most vulnerable among us is inexplicable. For example, clemency was denied to a man with an incurable lung disease who had already been granted parole. He was only seeking to leave prison a few months ahead of schedule during a pandemic after serving 22 years. A woman who was bedridden due to a series of debilitating strokes was denied medical parole. Instead of using these tools, the governor and docs commenced an informal early release program that the commissioner described this morning for a small subset of individuals, but even some of the applicants seeming to meet the narrow criteria have been denied without explanation. As another example, several pregnant women who were incarcerated were unable to avail themselves of the release initiative that the commissioner described this morning. What is the purpose of existing release mechanisms when even during times of crisis, the state refuses to use them? We urge the legislature to investigate why more people were not released during this crisis. If mechanisms like medical parole must be altered to expand their criteria, to act faster, or to provide more meaningful review, we encourage the legislature to do so. DOCS is obligated to protect those who remain in its custody, but DOCS was late to implement a COVID-19 prevention plan, and as you've heard all day, practice has not necessarily matched policy. As you've also heard before, since March, DOCS has failed to afford sufficient PPE, ensure mask compliance, and enforce social distancing and cleaning guidelines. As our state prisons began to more frequently implement quarantining measures, we've heard harrowing accounts of punitive treatment in quarantine, retaliation against whistleblowers, and unsafe and draconian practices framed as COVID prevention measures. For example, in June, as you know, DOCS hastily transferred nearly 100 older and medically vulnerable individuals to the Adirondack Correctional Facility. There, they are being denied medical treatment and forced to congregate on job sites, at recreation, and in communal bathrooms. To the extent that the legislature can inspect conditions at correctional facilities, we urge you to do so. Please also investigate the decision to create a prison nursing home in Adirondack, and to ensure that DOCS devotes sufficient resources to creating safer conditions for incarcerated people. It is impossible to develop best practices without knowing true rates of infection. That is why we remain concerned about the lack of adequate testing in correctional facilities. For example, as of last week, less than a quarter of incarcerated people in state prisons have been tested. As you've heard this morning, DOCS's stated policy is to test symptomatic individuals or individuals who have had no contact with symptomatic or positive individuals. But the CDC has made clear that such testing is not enough. We understand from Acting Commissioner Annucci's testimony this morning that testing is increasing, but it remains insufficient as it was described. What the CDC recommends is routine, broad-based testing for all incarcerated individuals. DOCS should therefore adopt universal testing protocols, like weekly testing for all those who live and work inside its correctional facilities. Overall, we urge the legislature to ensure that our prisons and jails implement pandemic response measures that are in line with scientifically supported best practices. To this end, the legislature should also ensure transparency and accountability so that policymakers and advocates can assess the efficacy of these measures and their impact on those in custody. This includes making sure that testing and infection rate data is consistently and accurately reported in a way that advocates and policymakers alike can understand. Finally, DOCS's impotent response to this crisis must be tied to New York's continued embrace of incarceration to address social problems. The pandemic bolsters calls to divert resources away from carceral agencies and towards measures that keep communities healthy and safe. Services like mental health and disability supports, public health infrastructure, and educational and rehabilitative opportunities. The legislature plays an indispensable role in making this budgetary shift a reality. Please also consider passing the pending decarceral legislation noted by many advocates today. Thank you for your time and attention.
Thank you so much for your testimony. Next, we will have Kenyatta Thompson.
Thank you so much, Senator Sepulveda and Senator Rivera, for holding this vital, important hearing on the impact of COVID-19 in prisons and jails across New York. While we have flattened the curve in New York and are far along in the phased reopening, too little has been done to address the impact of the pandemic on people detained in prisons and jails throughout our state. This is an urgent issue as the world continues to grapple with the pandemic, because prisons and jails are notorious incubators of contagions due to close quarters and unsanitary conditions, like my colleagues before mentioned, and because incarcerated people and their families have been largely ignored by the state's response to COVID-19. As of today, the New York Times reports that jails and prisons make up the top 10 COVID-19 cluster sites in the country. Incarcerated people and correctional staff are both at heightened risk for COVID-19, and this jeopardizes community members outside of prisons and jails as well. This is just one reason public health experts have actually called for decarceration to protect incarcerated people and communities outside of prisons and jails from COVID-19. I'm the lead organizer with the Cattell Center for Health, Equity, and Justice, and our members and our staff have both been impacted by COVID-19, including some of our members who have loved ones incarcerated in New York State correctional facilities. The stories we hear from these incarcerated people is that the virus is spreading and people are getting sick. But the Department of Corrections and Community Supervision says that there's no real problem and testing is limited, as Sophie stated before me. As of September 2nd, only 15% of the total prison population had been tested for COVID-19, which is significantly less than the general population, where 29% of New York residents have been tested. How can docs prepare a proper public health and safety plan for people who are incarcerated in our state prisons without widespread and regular testing? I'll actually give you that answer. They just can't. The pandemic revealed that our state lacks a coherent plan to address such health crises overall, and especially address these crises in our prisons and jails. Early in the pandemic, before the deaths in New York City began to mount, Katal and other groups actually called on Governor Cuomo to immediately release people from prisons and jails in order to prevent widespread suffering and death from those inside of correctional facilities. And this included calls to release people who are elderly over the age of 55, folks with disabilities, people with compromised immune systems, people close to the end of their sentence who were going to get out anyway, and people incarcerated on technical parole violations. There are more than 5,000 people in the state who are incarcerated for technical parole violations. And these are things like missing an appointment with a parole officer or being late for curfew. This group makes up about 10% of our entire prison population in the state, our state prison population. Even more, nearly a third of new admissions to New York State prisons in 2018 were due to people being re-incarcerated for technical parole violations. Quite alarmingly, New York re-incarcerates more people for technical parole violations and non-criminal violations of parole than any other state in the country except for Illinois. New data by the Bureau of Justice Statistics shows that New York sends more people who are on parole back to prison for drug treatment than any other state combined. Thus, in New York, our parole system has become a major contributor to mass incarceration. And the vast majority of those who are reincarcerated for technical parole violations are people who look like me, Black and brown people in our communities. And the racial disparities are pretty stark. In New York State, Black people are incarcerated at a rate of 5 times that of whites. And in New York City, where I'm from, the New York City jail rate for incarcerating people with technical parole violations is more than 12 times the rate of whites than it is for Blacks. So I know I'm getting a little low on time and we've got a whole lot of things to cover, but I really want to point out, as others have stated before me, that Governor Cuomo was pressured by many groups, including Katal and other community groups, to actually release people from incarceration due to COVID-19. And we actually formed our Free Them Now campaign in order to get the governor to take immediate action. And the governor did say he was going to release 11,000 people held in prisons and jails, held in jails for local jails for technical violations, but he ended up not being able to release all of the people he stated. So it was a good step, but it was very slow. And so we've continued to make these pushes. And so given that the governor has not taken immediate action, we need our legislature to actually take action. And so what we're asking from you is to pass bills like many of my colleagues mentioned previously, like our Less is More New York Act, which is a bill designed to get people out of incarceration due to technical parole violations, the Elder Parole Bill, Fair and Timely Parole Act, and some others. And namely, we need a comprehensive COVID-19 decarceration plan that includes aggressive implementation of decarceration, testing and monitoring, the provision of PPE, easing the housing restrictions for people upon their release, and requiring docs to make their plans publicly available and to have oversight by an independent council of health experts. So I see that my time is up. But again, I really want to say thank you to the chairs of this joint committee for having this public hearing. And the time is up. The time is now for us to act. Thank you.
Thank you, Ms. Thompson. Really appreciate your testimony. Next is Michelle Lewin.
Good afternoon. My name is Marvin Lewis. I will be speaking on behalf of Parole Preparation Project. I'm from Suffolk County, New York. I was just released August 31st, 2020 from Woodburn Correctional Facility after serving 40 years. I'm here today to express my concern about COVID-19 in New York State prisons. My number one concern is the lack of information and education given to prisoners about COVID-19. For example, when the flu epidemic hit Woodburn Correctional Facility, educational information was provided about safeguarding oneself from the flu. However, little effort However, little effort was made to educate prisoners about COVID-19. The most education or information we received about COVID-19 was from posted notices around the prison and the CNN and other news outlets. This created a heightened sense of stress, fear, and anxiety amongst all prisoners. Prisoners 55 and older, like George, Bourne, Trini, and Luke, are the only ones being tested, leaving the rest of the population at risk. Woodburn Correctional Facility is like that one house standing untouched as the tornado passed by for now. But testing is the key. Testing would give a better understanding of COVID-19 presence in the population and allow for a precise and effective deployment of resources. While I was at Woodburn, I was one of the first prisoners tested because I was over 55. And that was around July 2020. And the results took 2 weeks to come back. During this time, other prisoners and I were still walking the yard and communicating with each other, possibly carrying COVID-19. Leading into the manufacturing of the PPE, such as masks, hand sanitizer by prisoners, who ironically were not provided the equipment they produced until many months later. Without PPE, if the virus came in Woodburn, it would really kill them all. There are many CDC protocols being followed by the state. However, social distancing is extremely difficult within the walls of prison and has had little practical value. At the end of the day, we are all mingling. When COVID-19 hit Woodburn, many of us thought the parole board would let more of us go. We thought this especially because most of us at Woodburn had transformed our lives and over decades in prison. And because so many of us were older men who posed no risk to the public safety. But the parole board kept up with their practice of denying people release for no reason other than to punish us for the nature of our crimes and not the people who we had become. When I was released after 40 years in prison this August 31st, I was one of the lucky ones. So many people I was incarcerated with, some of my close friends, George Phillips, Clifton Williamson, Dow Butts, and Robert Abrams, who all remain in prison because they were denied parole during the pandemic. Their lives hang in the balance and are subject to a second wave of this virus. I pray that the tornado misses them again. But what do you think about the chance of that happening again? In closing, Parole Preparation Project submitted the recommendations in writing, but I strongly recommend the Senate pass the Elder Parole Bill and the Fair and Timely Parole Bill. And remember, the lives of my friends depend on it. Thank you for your time with this matter.
You are muted, Mr. Chairman.
Thank you, Mr. Lewis, for your testimony. Thank you, co-chair. The next person to speak is Andre Ward of the Fortune Society. Does fantastic work here in the city of New York.
Yes, good afternoon, Chair Sepulveda and Chair, Co-Chair Rivera. So many thanks for each of you for putting this together, in addition to the rest of the committee members. My name is Andre Ward, and I am the Associate Vice President of the David Rothenberg Center for Public Policy at the Fortune Society. The Fortune Society is a 53-year-old organization that supports successful reentry from incarceration and promotes alternatives to incarceration, thus strengthening the fabric of our communities. And we do this by believing in the power of people to change, building their lives through service programs shaped by the experiences of our participants, and changing minds through education and advocacy, really to promote the creation of a fair, humane, and a truly rehabilitative correctional system. On March 30th, an article that was featured in the Daily Eagle, it was reported that at least 167 people that were currently detained in New York City jails now have COVID-19, which was an increase of more than 60% since Friday, according to a daily report from the Department of Correction. Another 114 jail staff members have also tested positive for the illness, according to docs. More recently, in an August 10, 2020 article featured in the Daily News, it was reported that a total of 754 incarcerated people in all New York State prisons have tested positive for coronavirus. Of those cases, 608 have recovered, 17 incarcerated people have died of the disease. The Fortune Society is grateful for the hard work of advocates and lawmakers who amplified the need to release thousands detained at Rikers to stem the spread of the coronavirus. And we thank both the Board of Corrections for identifying over 2,000 detainees for release and Governor Cuomo for taking some action to release some of those who were detained. That's not enough, nor does it address the much needed safety protocols that need to be put in place to prevent the spread of the coronavirus in jails and prisons. There is also no evidence of measures being taken to humanely and effectively engage people in jails and prisons if some future pandemic occurred. And so what is needed is more when it comes to a scientific, medically effective, and humanely centered approach to addressing the pandemic in jails and prisons. This especially applies to those who are in positions of public trust, like corrections officers. What is needed is an actual monitoring of how people in jails and prisons are treated by correctional officers during any pandemic or national crises. This monitoring could come in the form of correctional officers being mandated to wear body cameras to ensure that detained and incarcerated people are treated with humanity and that the safety mechanisms that the department says they have put in place are in fact being used on a day-to-day basis. What is needed is mandated trainings in different ways to support people with opportunities to be able to deal with some of the things that come before them in the way of coronavirus. What is needed is the most modern medical equipment, supplies, and medication that can be used to engage detained and incarcerated people who have medical conditions, as well as caring medical staff who are culturally competent and can be in action quickly to address any medical related issue. What is needed is statewide release protocols for those detained and incarcerated during the pandemic. These protocols would take into account factors related to age, health status, proximity to release, as well as support by family, community, and organizations, as some of our colleagues have just mentioned. And finally, what is needed is adequate and supportive housing for those released that begins in jail and prison, so that individuals do not continue to feed the prison to shelter pipeline. There's a bill that's being proposed now, Bill 8689, in both houses that would start this process 90 days before release. This bill has been introduced by Senator Benjamin and Assemblyman Hevesy. What should also be included are important services related to one's successful reentry into the community. Some of those services include mental health and substance use treatment, education, training, and employment, and connection with benefits and family. As a formerly incarcerated person and man of color, I experienced medical neglect while in prison and witnessed countless others experience the same thing. And I can only imagine what they're experiencing now. What we're asking now is that others join each of you as leaders, Senator Sepulveda and Rivera, from the Senate and the Assembly, to ensure that those who are detained and incarcerated, especially during this pandemic, are treated humanely. And please, pass the Less is More bill, Elder and Timely Parole bill, and Halton Solitary Confinement bill. Thank you so much again for convening this. We appreciate that. Thank you.
Thank you, Andre, for your testimony. Any of my colleagues have any questions? My co-chair?
Actually, if I may, Mr. Chairman.
Yes.
Mr. Lewis, first of all, welcome back. And thank you for, let them. So welcome back, sir.
Thank you.
And thank you for being here with us. I wanted to ask you a similar question that I asked some of the gentlemen that were in a panel earlier. You were released in August. So
yes.
You just got back home a few weeks ago.
Yes. Yes.
So obviously you were there. In which facility were you?
Woodburn
Correctional.
Woodburn Correctional.
Woodburn Correctional. Okay. And so obviously you were there during the height of the pandemic. I wanted for you to share with us what your experience was related, as I asked the gentleman earlier, around issues of PPE. So whether you were provided with hand sanitizer or soap or masks during the height of the pandemic, and some of the difficulties that existed with keeping social distancing, et cetera. I just wanted to give you, because as we have seen in many instances during today's hearing, the stories that we get from folks who actually lived it or from family members of folks who have experienced it is different in many instances from what the agencies are telling us. So we want to give you an opportunity to kind of share that with us if you could.
Well, my experience with being inside in the beginning of the epidemic, we were, like I said, not informed or educated about the COVID-19. There was a late response in the facility where I was at.
Later, around which point, sir? When you say late, what do you mean?
Late response about getting masks, sanitizer. We had stuff like bleach and cleansers that we were using to clean with, but we didn't have the PPE that we eventually did get some months later. The mask came after we had been allowed to make our own masks from the handkerchiefs that we were getting from the state shop.
This is around what time, sir? If you remember general time, it would be great.
Yeah, this was around June.
Okay.
Yeah, around June. And then near the end or the middle of that month, the facility started to supply us with masks.
And then, so let's actually go back before that, because obviously that was late, both in the pandemic and also in your stay. But during, let's say, March, April, and May, when we were so concerned about when it was at its height in New York State, do you recall what was happening during those times?
Well, during those times, we weren't really doing anything as far as the PPE. Only thing that was being supplied to us was the regular cleaning supplies and bleach. You know, so we could. No masks. Oh, we didn't have any masks.
You didn't have any masks during this period of time. And this bleach, you were then like, were you told to wash your hands with bleach or something? Like what?
To clean the different areas that we were with bleach as a disinfectant. And then we got hand sanitizer.
That was around
June.
June. So March
to June, right? We were like on our own, basically.
Okay. All right. I just wanted to get a sense, because again, there's been instances in which the agency have told us that certain things happen at certain times, and the individuals who experienced it themselves or their families have told us something different. So, but again, thank you for being here, and welcome back. Hope you continue to enjoy your freedom, sir. Looking forward to seeing you and saying hello to you, and thank you in person at some point when this Rona madness is over.
Yes, sir. I'll be looking forward to that.
All right. Thank you, sir. Thank you, Mr. Chairman.
Sure. Same here, Mr. Lewis. Looking forward to hearing about your success story. It seems to be a trend during this hearing that you're getting a certain picture by the administration, by the agencies, and yet individuals that were recently released or go into the facilities are giving us a different perspective. So we have to essentially delve through this to see where the truth is and what we can do. So thank you all for bringing that to light today. We're going to now take a 5-minute break. So the next panel, I'll call you as soon as we're done. We need 5 minutes to rehydrate and drink coffee, whatever you need to do it now. Thank you. Thank you, everyone. Welcome back. We're going to now go to our next panel. We have Andrew Prakitz from and forgive me again if I mispronounce your name, Advocacy Coordinator for Justice, and Unity in the Southern Tier. We have Marvin Mayfield and Cynthia Carter-Young, statewide organizers and member leader for the Center for Community Alternatives. Deanna Hoskins, president of Just Leadership USA, and Alexander Horowitz, the executive director of New Yorkers United for Justice. Welcome, everyone. Let's start with Andrew.
Thank you. We want to thank Senators Rivera and Sepulveda for this opportunity to testify regarding COVID in the jails. My name is Andy Pragus. I'm joined by Professor Bill Martin. We are founding members of Justice Unity of the Southern Tier. Our organization advocates at the county and state level with incarcerated people and conducts regular visits to the jail, about 20 a week. Many in our upstate communities are desperately appealing for assistance. As a frantic mother with worry wrote us, she feared that her son would catch COVID after being placed in solitary confinement with people quarantined. I've called the jail, she noted, but the only information they will give me is about the medical facilities available if anyone is to become ill. She had a right to be worried. Indeed, Broome County is an exceptional place to study the impact of COVID-19. The county has the highest incarceration rate of any in the state, a death rate 4 times the state average, a jail population where Black people are overrepresented by 6 times, a parole revocation rate 4 times greater than New York City, an unending series of lost lawsuits for medical malpractice, a medical provider reprimanded by the Attorney General and a federal judge, and exceptionally brutal conditions for those with disabilities, as reported last week by Disability Rights New York. When COVID hit, these conditions worsened immediately. County officials' response was to refuse to reveal any figures on testing, infections, and PPE. Rather, Sheriff Dave Harder imposed severe solitary confinement on infected and uninfected alike. We later learned one of the first people infected was a jail guard tasked with transporting prisoners to a local hospital, resulting in the virus's spread to medically compromised inmates. It was only multiple protests and insistent media questions that forced April 7th that Broome County was one of 2 countywide hotspots. On May 4th, the county executive told the public that there were no more active cases in the jail. A Freedom of Information request to the county health department quickly revealed this was not true. Through it all, the sheriff continued to proclaim that jail was one of the safest places from the virus. People inside continue to tell a harrowing and terrifying story. Persons affected with COVID are still mixed together in a quarantine pod with persons arriving to the jail. New entrants to the facility are routinely put in solitary confinement. Just this past week, we were told that no one currently in quarantine and in the quarantine pod had been tested this week. Many feared being suspected of infection or even avoid testing, for that means weeks in brutal medical solitary and then quarantine under severe isolation. Consider the case of a woman who had been trapped in custody since late March due to continuing court closures. She cannot visit with her children. She has been quarantined for a long time with persons in disciplinary solitary confinement. She is forced to use poorly cleaned, shared showers and cells. There are others. A man held in Broome County Jail without knowing his charges tested positive. A young man with developmental disabilities now held for over a month and a half who does not understand the charges leveled against him. Yet another told us about her boyfriend with both asthma and COPD. When asked if he could get his inhalers, she said he had asked 39 times. If he keeps bothering the officer, she said, about his inhalers are going to discipline him. He'll no longer have access to phone calls, messages, or video calls. Other men with heart conditions, asthma, and diabetes held pre-trial have tested positive. Throughout the pandemic, we have seen many people, despite reforms to bail and discovery laws, held on minor drug charges, DUI charges, petty larceny, and the like. Others for technical parole violations. A disturbing number were locked up due to slowdowns and failures in the assigned counsel and public defender system. Jail procedures themselves drastically limited jail prisoners' access to confidential legal visits, especially early on, as we've heard others testify. People were moved to medical solitary or quarantine or denied access to outside communications and confidential legal contact. Prisoners are threatened with punishment for speaking out about conditions inside. In sum, the jail's response to the COVID-19 pandemic has been one of secrecy and punishment. We ask you, as a coalition of community organizers, asked Governor Cuomo on July 10th to ensure that counties do regular testing of people inside the jail, a transparent COVID dashboard with details reports on those tested, quarantined, and hospitalized, provide adequate sanitation and PPE equipment for everyone, give incarcerated free regular calls to family and friends, restore in-person visitation, release people who are 50 years older, have underlying health conditions, or are serving sentences of less than 1 year, provide local communities with adequate resources for those coming home, including a discharge, housing, and treatment plan. Over the long run, the state also needs to conduct an investigation of medical care before and the COVID-19 epidemic. We urge the state and assembly to pass Assembly Bill A4373 and Senate Bill S4842, which would establish the basis for the development of a long-term oversight based in local communities. In our written testimony, we have a number of appendices where you can see more about this and the activities that we had in Broome County in order to force the county to provide information about what's happening in the jail. Thank you.
Thank you, Mr. Pragas, for your testimony. Our next two speaker, Marvin Mayfield and Cynthia Carter-Young. I want to offer my condolences to Ms. Carter-Young. I understand that she lost her brother who died of COVID right before his release. And so my condolences to you and your family.
Thank you.
So let's speak Mr. Mayfield and Ms. Carter-Young.
Thank you. Thank you, Senator Rivera, Senator Sepulveda, for allowing us, myself and Cynthia, to testify today. As said, my name is Marvin Mayfield, and I'm the statewide organizer at the Center for Community Alternatives. Our organization, through direct services, organizing, and advocacy, the Center for Community Alternatives builds power with people who have been impacted by the criminal legal system. If you notice, I said the criminal legal system, not the criminal justice system. For the justice is an elusive creature for people of color, for where I come from. Well, organization, we work to dismantle systems of criminalization and incarceration and create transformative community-based alternatives. We work across New York State to have offices in New York City, Syracuse, and Rochester. If anyone has had the misfortune to be incarcerated in a jail or prison in New York State, they are well aware of the dangers that one faces every day. There's the ever-present violence, the neglect, the apathy, which are all contributors to the horrors of incarceration. If prisons and jails were dangerous then and deadly before this pandemic, then they're only more so now. There's always been systemic malnutrition, the unending stress, deprivation of quality medical care, racially targeted officer brutality, the torture of solitary confinement, and in state prisons, the sickness, death, and despair behind bars inherent to extremely harsh sentences and endless parole denials, which all contribute to a moral and human rights crisis in New York. Then coronavirus struck, spreading among the elderly and the immunocompromised people in prisons and jails, and leaving terror and death in its wake. All of the above mentioned horrors have sharply disproportionate impacts on Black people and other people of color. For example, 81% of the people who died during this pandemic were people of color. As people who have been incarcerated, people who have loved ones inside now, and other advocates for rights, dignity, and well-being of incarcerated people, we are deeply, deeply disturbed about the lack of an urgent response. New York State has offered little to no transparency on conditions behind bars throughout the crisis, and has released only a small fraction of elder and immunocompromised people, and used widespread and extremely dangerous solitary confinement in lieu of medically sound quarantine protocols, leaving incarcerated people extremely vulnerable as this deadly virus spreads. To continue to incarcerate people of this state at the current rate is effectively reinstating capital punishment and sentencing New Yorkers to suffer the death penalty. That's why we are urging the legislature to enact robust legislation to dramatically reduce the number of people in jails and prisons. We call on the legislature to pass elder parole and fair and timely parole to end death by incarceration sentences. we call on the legislature to protect pretrial freedom and commit to extending rather than rolling back bail reforms. Since the enactment of bail reform rollbacks, we have seen an increase of nearly 600 New Yorkers in jail each day, which translates to an even greater increase in jails, admissions, and therefore exposures to COVID. We asked the legislature to pass legislation to end the practice of incarcerating people for technical parole violations and to commit to sentencing reform that eliminates mandatory minimums, reduces maximum sentence, and abolishes New York's equivalent to the 2 and 3 strikes laws. We also call on the legislature to pass, to address conditions inside jails and prisons. This has to include passing the Solitary Confinement Act, as solitary confinement is a public health crisis in normal times, with surging rates of suicide and self-harm as lasting adverse impacts to physical and mental health, and to ensure that DOC supplies sufficient amounts of PPE, including ample supplies of hand sanitizer, soap, face masks, and other essential personal hygienic public health products. People must be given at least 1 new surgical mask per week, and administering mass testing. As of September 11th, DOCS has only administered 8,598 COVID-19 tests to people incarcerated in New York State prisons out of an incarcerated population of nearly 40,000. DOCS must ensure that every single incarcerated person has meaningful access to COVID tests, including first tests and subsequent tests following a positive. Thank you for this time, senators, for this meaningful hearing.
Thank you.
Now I want to pass it on to Cynthia Carter Young, a member of Center for Community Alternatives, whose brother passed away from COVID just a few weeks before his release.
Can we give her 5 minutes as well, please?
Thank you. Thank you for having me. My name is Cynthia Carter Young, and my brother, he passed away in Queensboro Correctional Facility at the age of 60 years old. And he was granted parole months before this pandemic hit. It was some paperwork that had to be filed, and he would have gotten out, but his date ended up being May 26. And on April 14th, my brother, he passed away complications of COVID-19. He was 60 years old. I understand that they had something in place at age 55. My brother, he was 60 and he had emphysema, which he had been treated and hospitalized at the facility before. If they had been treated for underlying conditions, let inmates go that's incarcerated, let incarcerated people be out because of underlying conditions, he should have gotten out. He should have gotten out because he was past age 55. From my understanding, they had lists of people, incarcerated people who was on lists to go out. They had about 3 or 4 lists. And from my understanding, what I gathered from people at DOCS is that my brother was on all of those lists that went to the governor for clemency, but he didn't get it. Our Governor Cuomo, he does not want to use clemency, and he should be pushed to use it. People are dying. We miss our brother. He was away from us for 25 years, and he passed away weeks before the date that they pushed back for him to come out. He went before parole, and parole was granted to him
back in December of 19. But his release date ended up, because of paperwork, May 26, which he did not make that date. He passed away on April 14th. I don't want any other family to go through what we went to. We have to sit and say, Leonard Carter, he didn't get to see his first grandchild. He never got to hold him or anything. I don't want another family to go through this. Our Senate, our governor, it needs to change for better. Incarcerated people are still people. They are human beings, and they should be treated as such. We shouldn't just throw them away. Thank you for having me. I really appreciate it.
Thank you, Ms. Young. Appreciate it. And of course, none of us can really understand the depth of COVID, losing a family member the way you can. So my sympathies again to you and your family, and we will do what we can to right this wrong. Thank you. Our next speaker is Deanna Hoskins from Just Leadership USA.
Thank you. Thank you, Senator Sepulveda Rivera and the members of the committee for the opportunity to testify. Again, Deanna Hoskins, President and CEO of Just Leadership USA, a national nonprofit that is led by directly impacted people. We are dedicated to decarcerating the United States by empowering the people and communities most impacted by the criminal justice system to drive, amplify, and sustain policy reform. We believe that policy should be equitable in the treatment of all people, ensure the human rights and dignity of all are protected, and meets people's basic needs so that they can live in safe and thriving communities and have access to the life they envision for themselves and their families. We also believe that policy should promote safety, health, healing, and restorative justice for all. However, we are currently saddled with a system that is still built on a historical legacy of slavery and oppression. This is reflected in everything from mass incarceration policies, healthcare, housing, and education. These policies drain resources and disproportionately affect Black and Brown communities. The arrival of COVID-19 has only exposed the systemic inequities and racism in this country's incarceration and detention policies. In particular, emergency planning is an area where we have identified an urgent unmet need. We have a responsibility to uplift the dignity and human rights of everyone, but the lack of emergency planning in correctional facilities is a violation of that responsibility. The country's commitment to protect the most vulnerable depends on us working together. By neglecting the safety of millions of people currently trapped in correctional facilities, our society is showing once again how Black and Brown people are treated in the United States. This type of systemic racism is the result of the generational legacy of slavery, and changing past policies is critical to decarcerate the United States. They were sentenced to time, not death. In a world with increasing natural and man-made disasters, having an emergency management plan in place to release the country's most vulnerable populations is the difference between life and death. Yet, while state emergency plans include labor by those detained, including digging graves in New York and putting out wildfires in California, there are little to no emergency plans to save their lives. Not only that, but the people in correctional facilities are mothers, fathers, teachers, and community leaders. They are human beings and their lives matter. Lawmakers have failed to create and support solutions that uplift the dignity and humanity of incarcerated people. On June 23rd, our team at Just Leadership launched the Just Us campaign, calling on legislators to enact proactive solutions to protect the human beings behind bars during COVID-19's second wave and forthcoming disasters. You can't solve the pandemic in the middle of the pandemic. We have outlined recommendations for immediate emergency preparedness plans for those in the criminal justice system. These policy recommendations could lead to potentially historic legislation in every state in this country. The recommendations include things like empowering the Department of Corrections to act without legislative or judicial intervention when a pandemic or crisis is declared, requiring the Department of Corrections to evacuate when necessary to decarcerate, utilizing public health triage mechanisms according to those at highest risk, such as individuals over 50, individuals with respiratory illness, those within 2 years of release, and pregnant women. These emergency management plans give institutions the foresight to quickly adapt to a particular disaster before it claims many lives. Because there are no plans now during the unprecedented epidemic, it has stopped correctional facilities from testing, leading to an untold number of cases and deaths behind bars, likely to spill out to our communities. We have heard from all kinds of people, though both those who are currently incarcerated and their families, who have been deeply affected by emergencies like COVID, and from correctional facilities not having plans in place to protect them and their loved ones. We've heard of Sonia and Charles, who died within 6 months of coming home. We heard of Cynthia's brother. Unlike most institutions, such as nursing homes and schools, correctional facilities are not required to have an emergency management plan focused on those in their care for accreditation, despite housing some of the most vulnerable populations. For too long, our systems have been unjust, unfair, and create incentives that promote racial discrimination, prevent meaningful change. We can have solutions that make our country better, that uplift the lives of all people, and work towards a truly just system, a system centered on human dignity with the voices of those most impacted heard and valued. Incarcerated people were sentenced to serve time, not death. We should not be executioners by our failure to act. I urge you to use your authority to make these vital changes today a reality. Thank you.
Oh, thank you so much, Ms. Hoskins, for your testimony. Next, we will have Alexander Horowitz, the Executive Director of New York United for Justice. Horowitz.
Thank you very much. Thank you, Committee Chairs Sepulveda and Rivera, the members of the committees, for allowing me to provide some testimony today. My name is Alexander Horowitz. I am the Executive Director of New Yorkers United for Justice. NYUJ is a bipartisan interfaith coalition of 14 local and national organizations, all deeply invested in criminal justice reform in New York. And we are deeply grateful to this committee for holding today's hearing. In almost every area of civic life in New York, mass testing has been the rule and the key to controlling COVID-19. There is one exception, and predictably and tragically, it leaves behind a group of our fellow citizens who even before COVID were in desperate need of quality health care, incarcerated New Yorkers. We're now more than 6 months into this crisis, and DOCS has neither released a cogent plan for COVID testing and control, nor has it responded to the many expert voices calling for mass routine testing. And to date, New York has tested a meager 1/3 of its prison population. We have conducted weekly analyses of COVID data from corrections since April, and based on DOC's own data, their testing strategy is mystifying. In August, Governor Cuomo announced that New York tested 100,000 people in a single day, and yet there have been 6 separate weeks since May, during which fewer than 40 COVID tests were administered among New York's prison population of 37,000 souls. In fact, New York has only conducted what could be considered large-scale testing efforts 3 times in the last 6 months, once in July, once in August, and last week in the run-up to this publicized hearing. The lack of commitment to regular mass testing puts New York far behind Florida, Texas, Wisconsin, Pennsylvania, Ohio, Michigan, Missouri, and our closest regional partner, New Jersey, that is currently testing its entire prison population for the 3rd time. Why? Because we know that tests older than 2 weeks are meaningless. To further complicate things, DOC's results defy the basic logic of COVID-19 transmission. Reported positive cases among DOC's staff outnumber positive cases among incarcerated individuals by nearly 2 to 1. Given what we know about the transmission of COVID-19, the density of prison facilities, as well as reported inconsistent use of PPE by DOC staff, it follows that incarcerated individuals should test positive at a higher rate than staff. And in almost every other state we have analyzed, that is exactly the case. New York is just one of 2 states in our weekly analysis with total positive tests higher among staff than incarcerated individuals. That raises serious questions of credibility. New York's testing in prison also runs counter to established guidance. The CDC conducted a review of correctional testing and determined that mass testing provides a, quote, more accurate assessment of disease prevalence than does symptom-based testing and generates data that can help control transmission. The CDC study further found that mass testing led to a median 12.1-fold increase in positive cases. Finally, the CDC found that symptom-based testing, which has been DOC's approach for much of this pandemic, can miss symptomatic individuals who avoid tests out of fear of medical isolation. This is no longer a hypothetical. CANI recently released a preliminary report on testing at Fishkill in which several individuals state that they believed they had contracted the virus but avoided testing so as not to be sent to medical isolation in solitary. DOC's top priority must be the health and safety of those in its custody and its staff. If that moral mandate is insufficient to motivate mass testing, however, the public health dangers of failing to do so must. This is because we know that prison walls do not contain the spread of COVID. In April, mass testing in Ohio corrections revealed a severe COVID outbreak in its Marion County Correctional Facility. 80% of the population there was positive for COVID-19. Further testing and tracing revealed that at least 66 cases of COVID in the Marion County community could be traced back to that prison, and the number of further infections from those 66 cases is totally unknown. Such an outbreak could be devastating to communities throughout New York State, especially those that surround the state's 52 prison facilities. NYUJ as a coalition applauds the state government and its leaders for their swift and science-based approach to controlling COVID-19 throughout the state and for providing compassionate care to those impacted by it. We come before this committee to urge that same approach, that same care applies to incarcerated New Yorkers and the people who work around them. And we are renewing our call for the immediate release of a comprehensive COVID-19 management plan from DOCS. In the early days of this pandemic, our coalition developed and released a series of principles that we believe New York should adopt to mitigate and manage the effects of COVID-19 in our justice system. I have attached those principles along with our most recent analysis of COVID data from corrections facilities across the country to our written testimony. I thank you for allowing me to speak at today's hearing. I thank you for the legislature's ongoing leadership on issues of health and safety in our prisons and that impact incarcerated New Yorkers. And we extend our sincerest condolences to Ms. Carter Young and everyone who has lost members of their families to this terrible disease. Thank you.
Thank you so much, Mr. Horowitz, for your testimony. And we will also be reaching out to you to further this discussion. Any of my colleagues have any questions?
Is Professor Just not going to testify? I'm sorry, Bill Martin. It just says Bill.
No, I was part of the team with Andy Pragas.
Gotcha.
But I can answer questions, obviously. We wrote the document.
Anything?
Yeah. So actually, thank you all for being here this afternoon. Ms. Carter Young, thank you for being here, and my condolences to you and your family on your loss. Mr. Horowitz, I want to actually dig deeper into a very important point that you made, which is regarding testing. Talk to me about, and obviously since you were, the time was limited, you just mentioned it, but I want you to dig a little bit deeper into the analysis that you have done into the rates of testing and positive tests and how those tests have come out positive in the prison population and in the staff in other states, because you said that you were very concerned that in many other states. So if you could tell us a little bit about what those results have told you and what New York, what is the difference between New York and the results that you've seen in those states?
Sure. Thank you, Senator. Our weekly analysis comprises about a dozen different states who regularly report on testing data in their prisons. And I mentioned a few of them in my testimony that we actively compare New York to. What we've seen and what is nonsensical about the data that we're receiving is that the ratio is upside down in New York between infections among incarcerated people and staff. Incarcerated people living side by side, no ability to social distance, it is only reasonable to assume that there will be a greater number of infections and greater transmission among incarcerated people than among the staff in facilities. And that is true in every state we analyze except New York and one other.
What's the other state?
Sorry?
What's the other state?
I believe the other state is Nevada, but I'll have to check that to be sure.
It is certainly whatever state it is, it's prison, both its prison population and its prison population is probably a lot smaller than the state of New York. There's no question about that, I'm sure.
That's exactly right. Much smaller. Almost all of these states have smaller abilities in terms of capacity to test and ability to test, which again casts New York way behind the other states. That inverted ratio should be a red flag to all of us, because the other thing that we know is that corrections officers are getting tests outside of the prison setting with their healthcare providers and independently, and perhaps with support from their unions. We know that incarcerated people are, of course, relying on DOC's medical services in order to get tested. So it simply doesn't wash. It doesn't hold water.
Gotcha. Ms. Hoskins, I know that you were, if you want to add something, or Mr. Mayfield, anybody else want to add here?
No, I was just totally agreeing, because what we saw at the onset of COVID, especially in Ohio, with the amount of individuals testing positive, once we started getting those reports, DOC stopped reporting so much. And what we discovered was that individual docs would send their people to the hospital. And actually, if they tested positive or they expired at the hospital, docs was not counting them as one of their reports to have to give to the public. So we started getting these skewed numbers across the states, and specifically in New York. It's like we almost went from a certain number of positive, and then we dropped down to 1 or 2. And to have staff, a larger number of staff testing positive than you do individuals in the facility, is kind of a skewed thing, because this is an outside-in virus, meaning the community brings it in. The staff is part of the community and essential employees. So we knew we were not getting correct numbers, which, from, like you said, you're getting certain reports of testing happening. And now we're hearing from people who were just released that that was not the case.
The reason I'm lingering on this is because we had, as I mentioned earlier, we did a series of hearings, 31 hours worth, of the impact of COVID-19 on hospitals and nursing homes. And there was a consistent question that we asked about reported deaths. So there have been many instances, whether it was regarding hospitals, nursing homes, report of deaths there. Today, we've had this conversation about rates of testing and the positive rates in staff, as opposed to individuals in the incarcerated people. We had a conversation earlier that you might have heard about some of the rates of people, the breakdown, the demographic breakdown of deaths within the deaths that have happened in the correction system, and some questions about whether the deaths stopped in May or whether there have been other deaths that could be COVID-related deaths since then. So it seems that there's a repeating pattern here, which is incredibly concerning, not only in the Department of Health data, but then you're saying in the Department of Corrections data. And this one in particular, I wanted to linger on, because if we had because we have a lot of data, as Mr. Horwitz said, about other states in systems that might be much smaller. And as you said, not only much smaller, but with less capacity to test overall as a state. And yet they were showing across the board that the rates of infection were double in certain instances, or certainly higher among the prison population of incarcerated people as opposed to staff. And yet in New York, it's flipped upside down. I would be concerned as well. And you can be sure that me and Senator Sepulveda will certainly try to get to the bottom of that.
Right.
That's my
Thank
time.
you, thank you, Senator. Thank you, Senator. And I just want to highlight or emphasize the
My
one
time
thing
is
that
up, but go ahead.
okay, what Alex said and what I alluded to in my testimony is that he said that any testing that that's older than 2 weeks is meaningless. That's why we need to continue testing, periodic testing, to ensure the reduction of this transmission.
Thank you, Mr. Mayfield.
And really briefly, in our jail, we've got figures from a FOIL of those who were tested and positive, nothing else. But there you have 19 staff who were tested positive and only 13 inmates. It's the pattern that's being, charged elsewhere. And we only have that because we foiled it.
Thank you, Mr. Martin. That's my time, Mr. Chairman. Thank you.
Thank you all very much. Any colleagues, any questions? All right, hearing none, we'll proceed to the next panel. Again, thank you all for your testimony and the invaluable information you are providing to us. I am chomping at the bits about the next steps I want to take as chair of the Corrections Committee. Senator Rivera and I are going to get together, put our heads together. I have more hair on mine than his, but we're going to put our heads together and see what we can do to come up with some real solutions. Thank you. All right, let's go on to our next panel. We have Saul Trefino, client from Housing Works, Nick Encalada Malinowski, Civil Rights Campaign Director for Vocal New York, Jerome Wright, statewide organizer for Campaign for Alternatives to Isolated Confinement, CALT, and Susan Lyon, community organizer for Release Aging People in Prison, RAP. Thank you all. We will start with Mr. You can commence, Mr. Trevino.
Yes, good day, everyone. My name is Saul Tofino, and I was incarcerated at Walk Hill Correctional Facility during the peak of a COVID pandemic. I was released in June of this year. I contracted the COVID-19 while I was inside. We had no information about COVID-19 except for what we've learned from the TV. We did not fully understand what this health crisis was. We were unprepared for this situation. Social distancing was impossible. Proper quarantine procedures were not followed. We had no access to mental health or support services. We were unable to go anywhere. The facility was in full outbreak mode. Things were out of control. We did not have access to masks, hand sanitizers, and cleaners until the end of April. Inmates began tearing their clothing to create face coverings. The CEOs informed us that we were defacing state property, which would result in facility infractions. Tensions and stress ran high amongst inmates and security because of the lack of information. That created an atmosphere of chaos and increase of violence from staff and inmates alike. It was a volatile situation. There was no escape from an invisible killer, and everyone was stressed out about it. I did not want to come forward. Nobody did. Nobody knew what was happening from men being transferred. Inmates feared retaliation, reported the illnesses and symptoms of COVID-19, especially from the 13th Amendment, because we were state property. There were significant sick call delays. No one had access to sick call when they needed it. They were only available on select limited days. If you got sick on Saturday, you had to wait to be seen. My first symptom was a high fever. I put in for sick call and I was finally seen about 9 hours after I was given a COVID test. They told me that I would be quarantined, but the next day I was told that I tested positive and to pack up that I was being moved. I was transferred from Walk Hill to Fishkill Correctional Facility and was immediately placed in a solitary confinement to be quarantined for 2 weeks. While there, we had no access to phones or tablets, leaving inmates unable to contact anyone on the outside. We were not able to send mail. It was my belief that corrections was afraid of letting anyone from the outside know that the inmates were getting sick and they were covering up for themselves. My family was not notified about my health or my transfer. All they knew, it was that they suddenly stopped hearing from me and that something was wrong. They contacted Albany Daily and asked about my whereabouts and were giving the runaround. It almost took them 2 weeks before they were informed that I tested positive for COVID and that they had been transferred, and I had been transferred to another facility. Not only did I feel like an outcast, I feel like nobody cared about me. I was so damn sick. It was crazy pain. Imagine having your worst cold or flu magnified by 10. I was severely sick for 2 weeks. Within those 2 weeks, I lost 20 pounds. I've made a lot of unhealthy choices. I was sentenced to 3.5 years, but not to death. And I thought I was gonna die. Constant transferring of inmates from cell block to cell block who were asymptomatic caused rapid community spread of COVID cases. Inmates even began filing grievances on one another when roommates returned from quarantine. There were no HIPAA rules complying to protection of medical information. There was no guidance until the inspector generals and medical staff began touring cell blocks and providing information. By then, it was already too late. Prior to that, there were no masks or no protective gear. I got my first face covering when I was getting into the bus to go to Fishkill. I did not receive a full packet with contained information about COVID-19 until after I recovered and was back at Walk Hill and only to contain one cloth mask. The biggest fear people had was dying alone, being by themselves and not having their family or loved ones around. The fear is intensified when you are sick, stuck in a cell by yourself, just you, your cell, and your God. After my release, I got connected with network support services. They picked me up and gave me a ride to a nice, clean hotel. They provided me with a book bag filled with emergency supplies, and I was given a cell phone, which they paid, and a $100 gift card. I'm also grateful I did not end up in the streets or a New York City shelter. More importantly, they connected me to Housing Works, Inc. I joined their reentry service. I joined their reentry services with the Justice Initiative program. As a result, I got a paid internship and I am scheduled to an interview for a full-time position, which I'm certainly I will ace and get. Overall, everything is coming great. I have a good support system in place because I was lucky enough to meet the right people. To be clear, no thanks to the Department of Corrections. Personal and class action lawsuits will begin happening now because of the negligence that I and so many others unnecessarily experienced. I am doing okay now, but everyone can say that. Not everyone can say that. What are the inmates experiencing now? Are they any safer than before I left? How are they ethically social distancing now? Are the officers and inmates being equipped with appropriate PPE now? How many inmates die by themselves in a locked cell, sick and afraid? I would like to know the answers to these questions. Thank you.
Thank you, Mr. Trufino, for your testimony and for appearing here today. We appreciate the information you're giving us. We're going to go now to the next speaker. It's Nick Incolata Malinowski from the Civil Rights Campaign for Local New York. Proceed, Nick.
Thank you. Thank you to the Senators Rivera and Sepulveda for holding this hearing on COVID-19 in prisons and jails in New York State, and to those senators who are in attendance today. We, along with our colleagues, have been calling for this hearing since March. The legislature in general and the governor have largely ignored their incarcerated constituents during the pandemic to terrible results, including unnecessary deaths. We welcome this opportunity to share our experiences with the legislature, but are also pained that this hearing did not occur soon enough to save the lives of Leonard Carter, Juan Mascaro, Lulu Benson Carter, Michael Tyson, Kevin Del Zario, and so many others. When the pandemic began this winter, we, correctly as it turned out, predicted that prisons and jails would become hotspots because of the congregate settings, substandard medical practices, and the political marginalization of incarcerated people. If the past several years have taught us anything, it is that incarcerated people are held mostly in contempt by the government of our state. Even as a growing consensus across the country is realizing the horrors and racism of mass incarceration, the New York State Legislature has done next to nothing to address these issues. This was made painfully clear last year when the legislature, apparently at the governor's request, spiked the HALT solitary bill in exchange for a weak set of principles which the governor acknowledged recently have not even been implemented. Now people are being held in solitary confinement after testing positive for COVID-19. It's barbaric. The one legislative action taken during the pandemic on these issues was the rollback of bail reform, which triggered an increase in the jail populations around the state. Others have spoken to this, but this hearing must result in legislative commitments to protect incarcerated people from this and future pandemics. What we've learned across the country and here in New York State is that the clearest way to keep incarcerated people and their families safe from COVID-19 is to send them home. All future criminal justice policy discussions in Albany must focus on the single goal. With this in mind, we would support legislation such as fair and timely parole and elder parole, as well as the immediate release of all medically vulnerable people now and forevermore. For the rest of my testimony, I'll just be sharing stories from people that are currently incarcerated who we've been corresponding with throughout the pandemic. Watching the clock, I'm going to pick and choose some, and we'll submit the rest of them in writing. I also hope that there's a way for the committee to either share this hearing on public radio or somehow make a recording available to people that are incarcerated so they can hear what's going on as well. March 27th from Auburn. As soon as I heard about COVID, I requested a test and was rejected. No one's getting tested. When people have symptoms, they self-quarantine in their cells and self-medicate with teas, ginger root, garlic cloves, and cinnamon. March 29, Otisville. They're doing their best, but there's no way to pull off the suggested procedures. There is no way to do distancing. Once a person gets sick, the entire house gets locked down. They're not conducting any testing. I've heard of only one test being done so far. We have no hand sanitizer, but we did get soap and bleach. March 31, Midstate. We read in the news that 2 people at Marcy and 4 people at Mohawk tested positive for COVID-19, but the guards are telling us that it's fake news and that the news is just lying to us. We saw 2 people here in hazmat suits in medical. We are living in a dorm of 35 people, but are forced to sit with one space between us when we eat. I sleep in a 6-man room. None of us have been tested. I'm 64 years old with breathing problems, so I'm very concerned. Any movement to commissary, med runs to eat, we go in large groups, no visits. I've been seriously mistreated and other people have been beaten. April 9th from Collins. I have been following the outbreak on TVs and newspapers. We recently received instructions on hand washing and visits have been terminated. We were told we'd get more JPay stamps and phone calls to keep family connections. All medical personnel who all come from outside the building have never since the epidemic began worn any PPEs. However, we do now have mounted hand sanitizer. We also get bleach, which I clean myself with. We have no testing. May 14, Shawangunk. It's so sad how terrible this pandemic has been for everyone. Being incarcerated, I'm terrified, and I'm sure I speak for most when I say I'm hopeless. I'm sure there are hundreds who've been infected, but so far only 19 people have been tested, all positive, and they were critically ill or had a temperature over 100. I have not been tested, but I'm sure I contracted the virus. I had a headache for 8 days, a terrible ache in my back and legs, and lost my sense of taste and smell for 10 days. We recently just got out of a 14-day quarantine after someone in my unit tested positive. 4 days after we were released from quarantine, 5 men recorded high temperatures and were rushed out again. They also tested positive. Just today, 2 more men were taken to the infirmary. There are no measures in place to stop the spread. It seems like they're intent on developing a herd immunity. July 11th from Fishkill. 1 mask every 6 weeks or so is not sufficient if we are now required to wear it any time we're out of our housing units. Officers and civilians who are the only people who can bring it into the facility are given the option to wear one. I want to wear a mask, but I feel the administration having the option is directly putting me and the rest of the population lives in danger. It feels deliberate at this point. August 17, also Shawangunk. I have chronic asthma and have to use 2 different inhalers, one for emergencies and one I use every day. I fear very much contracting COVID-19
seconds, Mr. Collada.
because I know what it can do with my medical condition. He goes on to say, basically, he's tried everything that he can. He's written letters to his legislators. He's filed for medical parole. He's filed for clemency, and everyone's letters are unanswered. I'll share the rest in writing.
Thank you so much for your information and your testimony. Jerome Wright is the next speaker from Statewide Organizer Campaign for Alternatives to Isolated Confinement. You're on, Jerome.
Thank you. Good afternoon, Chairman Sepulveda and Chairman Gustavo Rivera. How are you doing? Thank you for this opportunity to address this group and to discuss this issue that's long overdue. Like a predecessor just said, too bad we didn't have this hearing much sooner where we could have saved some lives. I am Jerome Wright. I'm statewide organizer for the Campaign for Alternatives to Isolated Confinement, the chief proponent of the Halt Solitary Confinement Act, a bill that we feel and know will make a difference in this COVID response. I want to start this off briefly by reading a quote from an inmate, a prisoner, in Wendy Correctional Facility. And his name is Daniel, and it reads, "Earlier this year, I tested positive for COVID-19. This was a difficult time, not only for myself, but my family as well. Along with the psychological effects of contracting COVID, the living conditions I experienced while quarantined were very stressful. I wore the same clothing for 14 days, lacked any personal property or medical treatment. When asked about treatment, I was told by a doctor to just ride it out. Although I signed a HIPAA waiver, my wife was denied an update or status on my health and encountered hostility from medical staff. Information about living conditions while quarantined reached the prison's population, and many who had symptoms did not seek medical attention. Along with the threat of COVID, I do recognize another issue of concern, the psychological effect many are experiencing due to new protocols and policies that have disrupted the norm. It has been very depressing for individuals not to visit with family, participate in programs, religious services. Phone usage has increased, making it difficult to access them regularly. These conditions have left many, including myself, feeling depressed. Lately, I have been hearing a lot of people in here speak about not wanting to die in prison. This is the reality of those serving lengthy sentences, the elderly, and those with underlying health conditions. Sometimes I wonder why many people die in prison that haven't been sentenced to death, especially men who have turned their lives around and who are amazing mentors, loving husbands, and fathers. The state's primary response to COVID-19 in prison was the massive infliction of solitary confinement in contravention of health experts' recommendations, including as a replacement for medical quarantine and proper medical care, while at the same time failing to release thousands of people in prison, particularly those vulnerable, despite what health experts calling for them to be released. Using prison slave labor to make hand sanitizer, as well as coffins, stopping all programming and visitations without properly giving us any information, without providing free phone calls emails, effectively locking down entire institutions, conducting minimal testing, if any, and failing to provide data to the population and families about COVID and the response. The increased pretrial jailing of people, all of this was a result of the response to COVID, none of which had any appreciable impact. I know we can sit here and talk about there were only 17 lives lost. That is the official number. However, I'm looking at a Times Union article that was published today as a result of this hearing, where they say 46 per 100K versus 39 per 100K were infected in prisons in the state of New York, 46 per 100K, as opposed to 39 federal nationally. So that means the numbers are not really indicative of what's happening. These numbers are listed as, and how I'm only at 45 seconds, and I know I didn't talk that long. I just want to say, in conclusion, the state's COVID response to in prison jails is reflective of the horrible ways in which the state regards and treats incarcerated people in general. Incarcerated lives matter, and what we need to do is there needs to be a massive public health initiative. First of all, pass, halt, solitary, because requisitioning people to solitary confinement in response to COVID is a death sentence and the absolute wrong thing to do. We have majority support in both houses. Let's get it done. Let's get it done now before another life is lost to COVID or any of the other situations that happen in prison. So I will keep going since you didn't stop me. I just want to say, I want to end with this one point, please. We had the acting commissioner on, and he told us that they released 2,000 people, but they didn't come off the count on the prison roll. So how do we know if there's actually 2,000 people been released? Because there's no way to identify that. You can't have, you cook in the books. That would be cooking the books in my profession. And I cannot recall, and I can't remember off the top of my head. These was his constant responses to questions by you senators, by the community. How can you have that? You have notes, you have, come on, you got assistant there. Come on, this is why part and parcel what the problem is today. There's no effective communication. There's no real transparency, and lives are at stake here. Please, let's do something about this and do it now. Pass, halt.
All right, thank you. And now we're going to have Susan Lee from the committee organizer, Release Aging People in Prison, RAP. Susan.
Good afternoon, and thank you all for allowing me to testify before you today. My name is Susan Lee, and I'm testifying on behalf of the Release Aging People in Prison campaign. RAP is a community organizing, grassroots advocacy and organizing group that works to release older and aging people from New York State prisons. I found out that my dad was experiencing symptoms of COVID-19 on the day of my 19th birthday. I'm an undergraduate student at Columbia University, and I'd been studying for an economics exam when he called. On the phone, we made small talk for a bit, and he congratulated me for surviving another year. And oddly, I thought at the time, he sounded less upbeat than usual. So with a little probing, I found out he'd experienced symptoms of COVID for a few days by then. I didn't want to worry him, so I told him to take care and to look after himself. He was vigilant, and I knew he'd protect himself in any way he could. And in fact, we'd urged him to file for clemency earlier. That afternoon, I told him I loved him for what would be the last time. Shortly afterward, he was diagnosed with COVID, and 2 weeks later, at 66 years old, he was dead. My father was not alone. Fishkill Correctional Facility, where my dad was incarcerated, has 5 confirmed resident deaths and 113 cases, some of the highest numbers of any New York State correctional facility. In New York's prisons, at least 773 incarcerated people are confirmed to have been infected with COVID-19, and at least 17 people have died from the virus. But on the phone, my dad highlighted the true misery he had witnessed. He told me about friend after friend who'd been coughing up a lung that week, people who raised their fears only to have their concerns dismissed as they were placed back with the general population, folks who passed away after experiencing symptoms but never having been tested. He told me of the lack of PPE, of hygienic measures, of medical care and communication, and the pervasive devastation, desperation, and the waiting. My dad was not alone in his passing, and I am not alone in my mourning. There are 8,400 elderly people incarcerated in New York State facilities, and each one of them has a family, a community, people who care for them. 1575 have already served their minimum sentences in full. As we know, COVID-19 is particularly destructive and fatal for older people, and elderly incarcerated people generate high medical costs to taxpayers while posing a low risk to public safety. New York State is facing a massive budget shortfall and has elected to dramatically cut budgets in education, social services, and other life-sustaining provisions. In these conditions, it simply doesn't make sense to keep all these older folks locked up and waiting to die. But beyond graphs and spreadsheets, the cruelty of this negligence is incalculable. My dad had a loving family, a home to come back to. Earlier, I'd made plans to drive up and visit him in a few weeks. We would have played a game of chess, talked about choosing my major. We would have been able to see one another and touch and hug. Instead, I watched my father's body laid to rest over a video call. I never got to comfort him as he took his final breaths. I never got to say goodbye. When COVID-19 ravaged New York at the start of this pandemic, we heard Governor Cuomo and other elected officials preach about social distancing and PPE, about the importance of looking after our fellow New Yorkers, the sanctity of human life, and the brutality, the profound collective tragedy of every single death. So as I stand here today, laying bare my loss, one that I relive every single day, I ask, is my father not human, and was his life not precious? Experts anticipate an even more catastrophic second wave of the pandemic. Will you wait by until New York is forced to grapple with its own San Quentin State Prison, its own Marion Correctional Institution, its own Miami-Dade County Jail? How many more fathers, mothers, brothers and sisters, friends and community members is the state willing to sacrifice? How many more sons or daughters like me will be left to pick up the pieces? My dad may be gone, but you all have the power to prevent countless premature deaths in New York State jails and prisons. So far, the Senate and legislature have done nothing to address COVID behind bars, and my family and I, alongside so many others, have paid the highest price. I urge you all to act immediately, decarcerate our prisons by passing bills like elder parole, keep people who are confined safe, and do everything in your power to prevent more needless death and suffering. The specifics of RAP's recommendations are in our written testimony. Thank you for giving me the opportunity to testify here, and I'm happy to answer questions at the end.
Thank you, Ms. Lane. Of course, my condolences to you and your family. Losing a parent at any time in our lives is difficult. And I can only imagine the pain that you feel in your family. So, you know, we certainly, everyone who's spoken today, stories like yours have motivated me and my colleagues. And we have been trying to do things. We have not been sitting on our hands on this. I can guarantee you that. But we don't work alone. We have to work with other branches of government. And so sometimes some of the things that we want to do immediately we cannot do because we have to contend with other branches. So but I can tell you that we certainly are working as much as we can to correct the issues that we have with COVID in our facilities. So we hear you, and we empathize, and certainly we will do the best that we can so that your dad's passing doesn't go in vain and your family can have it. Co-Chairman Rivera, do you have any questions?
I don't know if Jose is going to testify. Saldana.
Yeah, I don't have Saldana on the list yet.
He's all right. I was just seeing him on the screen. So first of all, Ms. Lee, I share all the sentiments that Senator Sepulveda shared. Thank you for being here with us. Certainly has not been easy. Mr. Saldana, you've like.
Yes, if I may,
Yes, you may.
Okay, thank you.
First, you've earned the right.
I will thank you, Co-Chair Sepulveda, Senator Sepulveda, and Senator Gustavo Rivera. We are very, very grateful for this hearing. We've asked for it some time ago. And there's a couple of points that I'd like to make. You know, or I guess all you senators here know that I was released from prison 2.5 years ago from Greenhaven, one of the prisons where we had several people died of COVID-19. And if I was not released, I would be fearful for my life. I was fearful that I may not make it before COVID-19. So with COVID-19, I would definitely fortify myself in the cell and don't come out. That's how I would have handled that. But I want to reiterate what Susan Lee said, that in reference to, we cannot assume, under no circumstances can we assume that the worst of this pandemic has passed us. We have to assume that there's a second wave coming. The experts are warning us about this. So we have to be prepared for it, and be prepared for those who are not prepared. And I tell you from my experience of nearly 4 decades in prison, that the Department of Correction will not be prepared for a second wave. Just look at what they've done with the Adirondack Plan. They were taking elderly men, 65 years and over, all with underlying conditions, and transferring them from a hotbed facility, Fishkill, where most of the fatalities of COVID-19 occurred, taking them from there and putting them in Adirondack with 75, 85 elder men. And astonishing, they were not testing them leaving Fishkill. How could they possibly not test them leaving Fishkill, going into a prison where they're going to be with other elderly men who were 65 and over with underlying condition? This is the carelessness. This is an atrocity. And the fact that it didn't turn out to be a catastrophic nursing home like we've seen in the city, it cannot be attributed to them. It might be some divine intervention, but it wasn't, you can't attribute it to them. So we have to plan for another wave, and perhaps a worse wave. And the other point I really want to make, that we cannot, under no circumstances, separate the impact of COVID-19 from racism and mass incarceration. These things go hand in hand. Anytime there is a pandemic, people of color are disproportionately impacted. Mass incarceration was a reality that still has to be corrected. And this is why we, the release aging people in prison, advocate to release the elderly who have already languished in prison for 3 or 4 decades. Those who have survived. A lot of my mentors are dead. But we can save those who are still alive and have languished in prison, some for 45 years. We cannot leave them all to die in prison. Our bill is a solution to all these problems. It's a solution to the COVID pandemic, and it's a solution to correcting the evils, the injustices of mass incarceration. And we have an opportunity to do this today. And if we don't do it, if we do not do this, if we do not listen to Susan Lee, if we do not listen to all the stories that we heard today, then who will? Who will? Who will legislate laws based on the experiences that we heard about today? No one else is going to do that. So we have to do that. We have to pass these legislation as the only measures to correct some very inhumane injustices that went uncorrected for decades, and to ensure that those that come after will not suffer the same injustices. We have to pass the Elder Parole Bill and the Fair and Timely Parole Bill. Thank you very much.
Thank you, Mr. Saldana. I always recognize the success story that you are, the work that you're doing. And to me, it's an honor and privilege to have worked with you and meet you and continue doing the great work that you're doing. And you haven't forgotten those that are essentially behind. You haven't left them behind. You're still advocating for them. So you're doing God's work. Thank you. Any questions from any of my colleagues?
Yep.
Senator Rivera.
Well, so again, thank you all for being here. And Ms. Lee, thank you for sharing what you shared with us today. And certainly, I assure you that it is not falling on deaf ears. Mr. Tufino, I actually want to actually linger on you for a second. Welcome back, first of all, sir.
Thank you, Senator.
I don't know if you've had the opportunity to hear the testimony for the whole day today, or maybe you haven't.
Absolutely not, no.
Okay. So there was, in the beginning, the first person who testified was Acting Commissioner Annucci. And there were questions that were posed to him related to many of the topics, or probably all the topics that we talked about so far. And there's one in particular that I want to definitely linger on. When he was asked directly, when Acting Commissioner Annucci was asked directly about people who were put into, whether solitary confinement had been used as a way to quarantine people, he corrected me. And he said that is not the case. And I said, okay, why not? And I said, we were using facilities that were used for solitary confinement before. And I said, so what is different between you putting individuals in these cells and solitary confinement? And he said, well, they were redesigned. People were given tablets. They were given contact to the outside world, et cetera. And so I heard this, and that was not the experience of certain stories that I've heard, but I want you to tell a little bit more about your particular experience. So in your case, and again, I am very glad that you are here with us and that you're healthy, but you were tested positive, and then tell us about the instance that you were placed in. What is I'm just saying clearly, is that accurate, what he said this morning, or is it not accurate?
It's not accurate.
Okay.
I was placed, it's not accurate, Mr. Senator. Listen, I was moved from Walk Hill into Fishkill. They put us in Fishkill with all of our property. We had our tablets, but it was our regular JP tablets that they gave us in regular population.
Okay.
When you in the S block, we was put in the S block, which we keep long-term key block. They're supposed to give you a black tablet that has a phone on it. They kept telling me that the tablets that they had a retro system that was down, that it wasn't up. So they wasn't giving me the tablet. They gave me the tablet after a week and a half. And then the tablets were there, but they wasn't providing them for us. So what he's saying, that they give you tablets, yeah, it's accurate. They gave you tablets, but when we were there, they didn't provide any tablets until a week and a half later.
When was that the time that you were actually?
I'm gonna tell you exactly. I tested positive for COVID-19 on April 17th. I went into Fishkill on Friday in the afternoon. I left at 11 o'clock. I was in there about 1:30 in the afternoon.
Hold on a second, because I'm actually going to jump on my. I'm going to go into the calendar here real quick to make sure that I get this. So you said April 19th?
April 17th.
I'm sorry, April 17th, which is a Friday. And so that date, you were then transported to this other facility?
Along with another individual. That also tested positive. We went to Fishkill. And then we was on the second floor. All they did was give us all our property. And the only tablet that they gave us is the tablet that they already provide for us from JP that we already get. After a week and a half, when we kept arguing about the tablet, the sergeant came over and said, the internet is back up, or we're going to give you the opportunity to call your families.
And so you had the opportunity to do it then?
Yeah, that's like a week and a half later.
Gotcha. And in your experience, because ultimately you recovered,
right?
Because were you provided medical care while you were in that place?
All they did was check the temperature. That's all they did.
They just checked your temperature.
Every day they came through. In the morning time, they did 3 rounds. 7 o'clock temperature, 3 o'clock temperature, and 10 o'clock at night temperature. That's all they did. We didn't get no medication. They didn't stop there. They didn't ask you how you just put your head there, cover up.
There was at one point earlier, there was a person who was a gentleman who was also formerly incarcerated who said that he had heard that unless there was the temperature of 104 or above, then people were taken to a medical facility. But I guess Did you ever hear about a particular number like 104, 103, anything like that?
Yeah, well, yes, Senator. There was an individual, an elderly man, elderly gentleman that had like 103, was like 3 cells down from me. They took him out because I guess 103, he was about 60 years old, so they had to move him out to go to an outside facility. I guess you had to put him in a hospital, and he was also at Walk Hill with me, but he wanted coming back, but they put him in a hospital because he had a high temperature.
And then when you got, and was your experience in talking to other folks after you were let out who were also in that situation that they had to basically fight to get, and I know my time is up, but just a little bit more, so that you had to fight to get the tablet so that you could communicate with your family? Was that the experience? That was
my experience. I mean, you had to argue back and forth with the sergeant.
Right. But other people who were in your same situation who had been tested positive,
absolutely,
same thing, so they had to fight for it.
Right, absolutely.
And you were able to communicate with your family eventually, though?
After a week and a half, yeah.
After a week and a half, all right. But again, it just shows that you had to actually fight for it as opposed to having it be given to you,
right.
automatically.
That's where the problem comes in at.
Well, again, Mr. Tufino, I'm very glad that you're here, that you're with us. Thank you all the rest for you being with us, and Ms. Lee, one more time, my condolences to you and your family. That's my time, Mr. Chairman. Thank you.
Thank you. Same here. Thank you all for testifying. Mr. Tufino, thank you for conveying your personal experiences. That really helped us. And Ms. Lee, again, my condolences. I'm sure your father is looking down on you and saying, I raised a real good daughter. So you should be very proud of yourself, Mr. Thank you all for testifying, and we'll go on to the next group of panelists. Have a good day. All right, so our next panelist, Joshua Rosenthal, Senior Staff Attorney for Disability Rights New York, and Kelsey, Staff Attorney for Center for HIV Law and Policy, Tracy Gardner, Vice President of Policy and Advocacy for the Legal Action Center, and Sharon Greist Ballin, Chair of the Prison Relations Advisory Committee for the Town of Bedford. Thank you all. Let's start with Joshua Rosenthal.
Good afternoon, and thank you for the opportunity to testify today. My name is Joshua Rosenthal, and I'm a senior staff attorney at Disability Rights New York in DRNY's program for the protection and advocacy for individuals with mental illness. DRNY is an independent agency designated to serve as the protection and advocacy system for people with disabilities. In our PAMI program, we are mandated by federal law to advocate for people with serious mental illness across the state. Since its founding, DRNY has fought for the rights of incarcerated people, representing them in civil rights litigation, conducting on-site investigations of abuse and neglect in jails and prisons, and publishing reports on the harms that people with disabilities face. The COVID-19 pandemic has in many ways both revealed and exacerbated, worsened the long-standing harms, inadequate treatment, and discrimination that people with mental illness face behind bars. Jails and prisons incarcerate a disproportionate number of people with mental illness, and this includes, of course, Black and Brown New Yorkers with mental illness who are locked up at staggering rates. Like the aging population, many with mental illness are at an elevated health risk from COVID-19, and the pandemic has added to the uncertainty, isolation, and trauma that all people face while incarcerated, as the committees have heard today. DRNY is grateful for the work of our colleagues, and we echo the concerns that so many have raised today, including CCA, Legal Aid, PLS, HALT, REP, and many more. I want to reiterate 3 themes in particular that the committee has heard that are critical to protecting the lives of our clients. First, the state must end the practice of isolating people in solitary confinement. We've been deeply concerned about reports regarding the use of and the prolonged use of solitary confinement as a mechanism for quarantining people. In May, DRNY, together with PLS, raised these concerns, including possible violations of the SHU exclusion law, directly with docs in the Office of Mental Health, but we received no response. Far from constituting a valid public health measure, solitary confinement exacerbates and even causes life-threatening symptoms of mental illness, including psychosis, self-harm, and suicide, and it should have no role in the response to COVID-19. Second, facilities must provide consistent access to programming and mental health treatment. People behind bars have long been deprived of adequate care, as DRNY recently reported with respect to the inadequate mental health care in county jails, including Broome County that I know, the committee heard earlier. During the pandemic, we've received complaints that facilities have halted any out-of-cell programming, including therapeutic treatment, that has led to further isolation and failing to meet the now heightened mental health needs of incarcerated people. Safety measures, of course, have to be taken, but it's critical that facilities meet their obligation to provide these services, and when in-person treatment is truly not possible or too dangerous, that they explore alternatives such as telemental health. Finally, and most importantly, the state must commit to decarceration. As many have said today, reducing the jail and prison population is the single most effective tool to prevent the spread of COVID-19 behind bars. Any steps to decarcerate must also ensure that people with mental illness are not left behind. In late March, Governor Cuomo directed docs to identify for release people held in jails pursuant to warrants for technical parole violations. But in carrying out this directive, docs initially excluded anyone from release who had been diagnosed with a significant mental illness. DRNY found that this exclusion violated federal anti-discrimination laws and needlessly placed people with disabilities at risk of illness and death. While docs later reversed this practice, the exclusion was the latest example of the ugly, unlawful, and untrue biases that continue to result in the unnecessary incarceration of people with mental illness. To stop the spread of COVID-19, we also urge the committee to focus more broadly on the lack of resources in the community, as I know the Fortune Society spoke to earlier. Every year, hundreds of people with mental illness who can leave incarceration are discharged to homelessness or otherwise don't have access to the affordable housing and outpatient care that they need when they get out. This has created a vicious cycle where too often people with mental illness suffer psychiatric decompensation, psychiatric harms, and are left to languish in homeless shelters, psychiatric hospitals, or are even reincarcerated when they can't meet the technical and myriad conditions of their parole. The cycle of incarceration is inhumane, and it needlessly exposes people with disabilities to COVID-19 behind bars. DRNY will continue to advocate on these issues, and I thank the committees again for the opportunity to speak today.
Thank you, Mr. Rosenthal, for your testimony. The issue of mental illness is something that's very personal to me. My mother suffers from mental illness, so I understand a lot of the issues involved. I mean, ultimately, my mother took her life because she suffered from mental illness when I was a young child. So I know the lack of resources that are available, the difficulty is for docs, personnel, corrections officers to deal with people with mental illness. And I know that there's an area where we need a vast amount of resources to deal with individuals that are incarcerated that are suffering from mental illness. So thank you for your information. The next speaker will be Ann Kelsey, the staff attorney for the Center for HIV Law and Policy. Take it away, Ann.
Good afternoon, and thank you, senators, for having me today to testify. As you said, I'm a staff attorney at the Center for HIV Law and Policy. CHLP is a nonprofit based in New York that challenges barriers to the rights and health of people affected with HIV and other chronic health issues. We have heard some amazing testimony today, and I particularly want to note my appreciation for the testimony of formerly incarcerated individuals and family members of incarcerated individuals. With my time today, I just want to highlight a few points. The first that may serve as a resource for you all as you go forward from today's hearing. In May of this year, CHLP, along with other national organizations such as the Association of Prosecuting Attorneys and the National Association of Criminal Defense Lawyers, so a broad-based coalition, published a document called Public Health and Public Safety Pathways for Criminal Justice System Response to COVID. And the recommendations that we make in this document echo much of what has been said today. Our recommendations include release of people and rapid decarceration based on a clear plan, based on public health recommendations and criteria. And we hope that people with disabilities, including chronic health problems like HIV, would be a key part of any such decarceration plan. We need to limit new admissions and limit contacts with the criminal justice system, such as check-ins with parole officers that lead to technical violations and increased incarceration. We hope that violations of COVID-19 related directives, such as mask and social distancing directives, are enforced with a public health approach rather than a criminalization and law enforcement approach that, again, unnecessarily targets Black and Brown communities and leads to higher incarcerations. Specifically today, we would like to highlight something that hasn't been mentioned today, which is conditions at New York psychiatric centers, particularly conditions at Central New York Psychiatric Center in Marcy, New York. Psychiatric centers house a group of highly stigmatized, politically unpopular populations who have been basically ignored throughout this coronavirus pandemic, have been mentioned in daily briefings and have received less support than other carceral settings. But people at psychiatric centers, they're human beings with human rights. And we have serious concerns about what's been going on. Widespread lack of PPE, even when PPE is available, it's not being worn. Family members aren't even allowed to send PPE like masks to their confined family members to make up for what the facilities themselves are not providing. They report minimal social distancing, minimal cleaning protocols. And this is so even though, as in other carceral settings, patients at psychiatric centers are more likely to have disabilities and chronic health conditions that make them highly vulnerable to COVID. Patients are rightly stressed and afraid for their lives. The most recent data that we have is that at Marcy, there were 25 patients diagnosed with COVID and 20 staff members and 1 death of a patient. But we worry that in the future, these sentences of confinement will turn into more death sentences. We recommend that the Office of Mental Health, as well as docs, supply appropriate PPE, make sure that regular testing is happening at these facilities, and that the State Department of Health take an active role in monitoring and protecting the health of people in all settings of confinement, including these psychiatric centers. So the Department of Health AIDS Institute has oversight to monitor conditions in prisons and jails, but there's no equivalent oversight at psychiatric centers. And we'd like to see that change. Thank you.
Thank you, Anne, for your testimony. We're going now to go to Tracy Gardner, who's the VP of Policy and Advocacy for the Legal Action Center. Take it away, Ms. Gardner.
Okay, good afternoon, and thank you very much for allowing me to testify. And I'm gonna try to read from my remarks so I don't go off on a screaming frenzy. This has been so aggravating and heartbreaking. I would point out though that in the beginning, when we knew that nursing homes were being uniquely impacted by COVID, immediately we should have known that we needed to do something about correctional facilities. So just, right, anyway. So the poor health of most individuals in prison and jails mirrors that of communities from which they come and to which 95% will return. And I should say Legal Action Center has been around since the 70s, doing work at the intersection. Our policy advocacy and legal advocacy work is around HIV, criminal justice, and addiction. So we're right in this, and we've been around since Rockefeller drug laws saying the same things. Acknowledging this, that people, correctional health and community health are linked, has helped to diminish the spread of communicable diseases. It can reduce the risk of rearrest and reincarceration and the impact of untreated substance use and mental disorders. Also, the overdose and suicide epidemics did not disappear with the appearance of COVID. COVID's emergence in corrections was clearly no surprise, and all that's been surprising is the slow, inadequate, and unconscionable response to these issues by the executive. As Ann mentioned, in 2009, New York State became the first state in the country to enact legislation requiring that the state health department monitor the quality of HIV and Hep C care in state and local correctional facilities. And almost more than 10 years later, HIV care in the DOCS facilities is now comparable to and sometimes better than that provided in the community. And the treatment of Hep C is exemplary. So we can do this, but the oversight is limited to HIV and Hep C. With these models, we know how to improve the quality of care. And so we support our colleagues in CCA, RAP, HALT, Parole Prep, New Hour, CATAL, their legislative and programmatic approaches for prison release and parole reform, jail decarceration. You've heard from the experts, and their testimony is definitely the right way to go to push the executive to reform what is so broken. Especially on the health issues, we have to do what is standard in the community, or what needs to be standard, which is supply sufficient amounts of PPE and administering mass testing. And prison census has declined dramatically in the last decade, so it's not like we can't repurpose space. We enthusiastically support Assemblyman Dick Gottfried and Senator Gustavo Rivera's proposals to expand the health department's review of all correctional health services, because it should not be separate from the overall health system. And the bill that is on the governor's desk right now, which relates to the review of policy and practices relating to infectious disease outbreaks, which speak to COVID and speak to the structural racist criminal justice policies that have crippled New York's Black and Brown communities' ability to stay healthy. We at Legal Action Center work closely with the ATI and Reentry Coalition. And so bringing ATI Reentry to scale and focusing on health rather than arrest and punishment will keep people out of corrections in the first place. And then we would ask that the legislature continue to push the state to pursue the waiver amendment, the Medicaid waiver amendment that would allow Medicaid to be used during the final 30 days prior to reentry from prison and the 30 days after being admitted to jail. These are more structural recommendations, but I think, as Jose said earlier, this is not even as bad as it's going to get, and we have an opportunity to mitigate that damage. So thank you very much for your time. Thank you, senators, for your leadership on this issue.
Thank you for testifying and not for yelling. We appreciate your testimony and all the information and work that you do. So thank you. And we'll have a subsequent conversation offline. I'd like to talk to you about a few things. So thank you. The next speaker is Sharon Greist Ballin she's the chair of the Prison Relations Advisory Committee for the town of Bedford. Sharon, take it away.
Thank you to the chairs and the committee for both placing enough import on this issue to have this hearing, and also for your fortitude. If my math is correct, I'm the 38th witness. You must be exhausted. So thank you.
Oh, you should try being Gustavo Rivera. Had a hearing for 3 days. So
31 hours.
He's the king. He's the king.
Not one bit of cocaine, nothing at all.
And maybe that's what happened to your hair, right?
This is just a warm up for him. All right, thank you. Take it away. I'll reclaim some of your time. Go ahead.
Thank you. The onset of COVID in our New York State prisons and the impact of the disruption and the suspension of contract and volunteer program services presented obviously problems, but it also presented an opportunity to reimagine what could be done during the COVID pandemic. I'm here to tell you today about something that went right. We recognize the need to address the existing serious conditions in our New York State prisons and support your critical legislative reforms. You heard today about testimony that needs to be addressed. But as advocates for serving the human needs of those who are incarcerated in our prisons and jails, we are bound to address their humanity. not just the structural deficiencies in which they are housed. We specifically want to address the outreach we initiated at the beginning of the COVID pandemic on behalf of the women in the Taconic and Bedford Hills Correctional Facilities in Bedford, New York, totaling about 900 people. Within DOC's guidelines and with the full support of the administrators and superintendents of these prisons, a collaboration was initiated by our organization concerning the needs of women in these facilities. Previously, women were able to earn income needed to buy personal items from the prison commissaries, from programs that were now suspended. The financial burdens on their families, many of whom lost jobs due to the pandemic and who had regularly sent packages to the women, was also prohibiting many families from supplying these needs. In addition, a priority was to address their emotional needs, such as to alleviate their fear and anxiety about their exposure to COVID. They truly were sitting ducks. The loss of family connections and ongoing non-factual news articles that exacerbated both their and their families' fears. I can give you an example of that later if you want. Under these conditions, we initiated community engagement for donations of goods to support their safety. We were able to collect over 11,000 bars of soap that was lye-free and DOCS approved for the frequent required hand washing. And over 10,000 masks were made by volunteers for both staff and the women, to name a very few of the items that we provided. Again, in the interest of time, I can do that later if you want. For the past several months, we've received many letters of gratitude from the women, attesting to the strengthening of their mental health. The women felt hopeful, supported by, and not forgotten by their community. They told me in one of the most touching notes that they were praying for us and our safety. The superintendents reported that these donations contributed to an even more positive environment for both the women and staff within the prison. The women felt better by being given to by strangers expressing care for them. As a result, they treated the staff better, who then also responded by more positive behavior, and it went all the way to the top. The women expressed that they did not feel alone or forgotten during COVID, despite the restrictions in their facilities and policies imposed to promote their safety and well-being. We were then, and are now, aware of the collaboration of organizations to assist DOCS for any and all those released. This includes the release of nursery mothers and their babies to My Mother's House and Our Children residents, where COVID prevention safety protocols were and are in place to receive them. We initiated a COVID program, Bright Hope, that supplies the women with items needed their first day of release, including a mask, hand sanitizer, and a bag. In addition, now that visits has restarted, we are supplying the children visiting the prison with child-sized donated face masks, with a total of over 700 to date, all from volunteers. We collaborated on Operation Neighborhood, a civic engagement project led by Our Children, the Prison Relations Advisory Committee of the town of Bedford, which I chair, and which is the only committee of its sort in the country, and the Adopt a Prison program of the Interfaith Prison Partnership, for which I work. The Operation Neighborhood project provided 600 packages of critical personal items needed by the women.
Sharon, I'm going to give you 30 more seconds.
Okay, but I lost some time with the hair comment.
That's why I'm giving you 30 seconds.
Okay. COVID has been a challenge for services which address the human needs for those incarcerated in our prisons, as resources have needed to focus on keeping those within their care safe. We've been privileged to address some of the emotional and physical needs of the women at a time when it was imperative that DOCS focus on the women's health and safety. Thank you for allowing me to provide some of the positive news.
Thank you so much for your testimony. Now I'm going to have Senator Shelley Mayer, who has some questions. Shelley, proceed.
Let's see. Thank you. Thank you very much, both chairs. Thank you very much. And thank you to all the witnesses that I've heard earlier today and their powerful testimony, which draws attention to why this hearing is absolutely essential. So thank you. I do want to address Sharon Ballin And particularly her comment that Bedford, the town of Bedford as a municipality, is the only municipality which has a governmentally sponsored relationship with a correctional facility in its community. And the point that Sharon made, that because of that institutional presence, together with the faith community, you were able to actually have a very positive influence on both those who are incarcerated and the staff. I wondered, Sharon, how many people from our community of Bedford and North Castle, I think, were also involved, participated in your activities to deal with COVID specifically? How many individuals from the community, do you know?
I do not know. I know that it was many thousands, and it was not only people from the state. We also had people in Oregon and South Carolina volunteering to sew masks for us. So it was pretty nationwide.
And since a visitation has been reinstituted, have the visitations with the, particularly with the Mothers Program and the other volunteer programs at Bedford and Taconic, have they been restarted?
Visitation has been restarted. They're in the process of restarting the programs going in. And of course, some of the college work has continued, as you know, because they were able to do that remotely.
Okay, well, thank you so much. I'm glad you could tell one positive story of a community adopting another community. And thank you for your work in that and your leadership. Thank you so much.
Thank you, Sharon. Thank you, Senator Mayer. And I love the color of the wall in your background. We are now we're hitting the home stretch now. Our last three presenters, the next one will be, I'm going to give you the name, Serena Ligori, from Executive Director of the New Hour for Women and Children, I believe at Long Island. Stephen Hart, PhD from Buffalo, New York, and Lisa Napoli, Supervising Attorney for Appellate Advocates. So let's start with Serena. Serena, are you still with us?
Yes, I am. Thank
There
you.
you go. All right. You can proceed.
Thank you. Good afternoon, members of the New York State Legislature, and thank you for the opportunity to testify. Thank you, senators, for deeming the issue of incarcerated people and correctional staff that they face during the current pandemic relevant and worth being seen, heard, and understood by our community and lawmakers. My name is Serena Ligori. I'm the Executive Director of New Hour for Women and Children Long Island and a co-leader of the Justice for Women COVID-19 Task Force. New Hour is a nonprofit dedicated to empowering and supporting women and children impacted by the criminal justice system. I am a formerly incarcerated Latina and a survivor of solitary confinement. And in my former role as policy director of the Correctional Association of New York's Women in Prison Project, I visited New York State's women's prisons to interview correctional staff, medical staff, and inmates, recording and reporting these findings. New Hour facilitates 12 weekly jail-based programs on Long Island in our jails to support mothers and women. Last year, we provided programming to 1,000 detained women, and to date this year, 600 women. Women who continue to receive services from New Hour upon their release have a 2% recidivism rate, as opposed to the Long Island-wide average median recidivism rate of 65%. According to DCJS, as reported on September 1st, 2020, the total jail population of 1,070 incarcerated people across Long Island's jails is still larger in population than any region outside of New York City. In collaboration with the Suffolk County Sheriff's Department, we applaud Sheriff Errol Toulon, whose proactive approach to COVID-19 created prevention. He mandated temperature checks for all officers and staff, sanitizer use, jail cleanliness, as well as the distribution of PPE at the very earliest onset of the spread of COVID-19. Sheriff Toulon also worked to create quarantine units, and due to these proactive measures and to bail reform, which allowed the jail adequate space to house incarcerated people, the jail suffered minimal infection. Formerly incarcerated women who returned to Long Island homes after serving their time in Docks Prison shared their experiences with us.
Women returning from the prison spoke of little to no education or information shared about COVID, no signpostings, no mass testing, no pamphlets, no comprehensive dissemination of a course of action being taken to prevent the spread of COVID-19 in the prisons. As you've heard today, most incarcerated women attest to receiving PPE some 6 to 8 weeks later after the onset of the pandemic was made public, and not receiving this PPE on a regular basis. Some women received PPE as late as April or the beginning of May 2020. We were told by an incarcerated woman who came home to us that even the pregnant correctional officer had told her they were advised not to wear PPE in the prison at the onset of the COVID-19 pandemic for fear of inciting fear, a riot, and discord among the incarcerated women. This poorly thought out and wanton disregard for inmate and correctional staff lives is unacceptable and creates grave consequences for all of us. The gender-specific challenges mothers and women face behind bars are enormous. 3/4 of women behind bars are mothers, and most were the primary caretaker of their children prior to incarceration. Allowing incarcerated women only 1 to 2 hours of time released from their cell or bunk is not enough time to make phone calls to assuage their children's fears, cook, shower, and do laundry. Women behind bars face lasting, increased mental anguish as a result of solitary, and I can attest to that myself. The use of solitary as a tool to prevent the spread of COVID is not comprehensive. It is our recommendation that all pregnant people, older women, and those at risk of contracting COVID-19 be released during the pandemic. We, along with the Justice for Women Task Force, as Sharon White Harrigan shared, penned a letter to the Governor Cuomo, calling for the release of pregnant women. And yet only a handful of pregnant women within 6 months of their release date were released. So not all pregnant women were released. I ask you, what community safety risk is posed by a new mother with her baby from the nursery being released to the community? Mothers remained in the nursery with their babies and should have been released. We also call for the restoration of educational programming in prisons across the state. And while many of us who spoke today, we remember domestic violence survivor Darlene Lulu Benson-Say, who died of COVID at age 61 at Bedford Hills Correctional Facility. She was a candidate for medical parole, but never made it home. We know that there have been and will be many more victims of COVID behind bars without elder parole reform, and if mass testing is not administered. In closing, I would just like to note that Sharon and I shared cells next to each other when we were at Bedford Hills. I would like to think that today, that I believe in the redemption of all incarcerated people and that I have worth and each person behind bars has dual worth. Thank you.
Thank you so much, Serena, for your testimony. Certainly, again, we'll have more discussion, some of the things you talked about Suffolk County. The next speaker will be Stephen Hart, a PhD from Buffalo. Mr. Hart.
Yes, hello. Good afternoon, and thank you very much, senators and committee members, for hanging in there, especially this far into the afternoon. I'm Steve Hart, and I'm a senior research scientist at Frontier Science Foundation and an adjunct associate professor at UB, but I'm not speaking for either organization today. I hold a PhD from Berkeley, and my professional life includes 35 years in quantitative data collection and analysis. My testimony previews a report that will soon be published by the Partnership for the Public Good. Given the time limit, I'm leaving out the details and nuances, but I'll be glad to answer questions, and I'll file the full report with the committee. The study concerns a pandemic-related program initiated by Governor Cuomo to release people held in county jails on charges of technical parole violations, things like staying out past curfew or having been arrested on a minor criminal charge. The way parole works in New York, in these situations, a person is imprisoned without any way to be released, even on bail, until the parole violation charges are resolved, which takes weeks or months. During this time, people often lose their jobs, housing, and marriages. Unlike other county jail prisoners, their fate is controlled by DOCS, which issues an arrest and detention warrant. In late March, Governor Cuomo instructed DOCS instead to release most parolees awaiting hearings. DOCS announced a release program which ran from about March 27th to April 18th, but we didn't see any releases in Buffalo, so I decided to research the outcomes. The analysis used data from docs that was furnished in response to a query from Senator Sepulveda and Assemblymember Weprin, and also jail population figures from the Division of Criminal Justice Services. The data from docs, unfortunately, is problematic. In particular, its claims about how many people were released under Cuomo's program appear to be badly inflated for many counties. For example, docs claims 10 releases in Westchester, but DCJS shows the average technical population going down only 1 person from March to April. The claim of 10 pandemic program releases just isn't plausible unless the DCJS numbers are wrong. The analysis shows 2 things very clearly. First, if I can get the right page, that far fewer people were released than should have been given the governor's intention. Overall, only about 650 people, or 38% of the approximately 1,700 who were in jail when the release program started, were released, leaving over 1,000 people behind. Even docs only claimed 791 releases. The governor wanted everyone out who was not a risk to public safety. It's inconceivable that 5/8 of the jailed parolees were real dangers. The alleged misbehavior in the vast majority of cases was either non-criminal or a low-level non-violent crime. Most had been approved for release to parole by the parole board, and that doesn't come easily. Of 37 people that we followed in Erie County, none of whom were released under this program, only 2, that's 5%, had allegedly done something raising public safety concerns. In short, docs implemented Cuomo's directive in a minimalist way, thwarting the goal of getting people out of jail during the pandemic. Second, the outcomes varied enormously from county to county. For example, the release rate was 58% in Monroe County, but only 29% in Erie. Are Buffalonians an especially fearsome lot compared with our neighbors in Rochester? Probably not, which means that attitudes of local parole bureaus or particular doc staff must have greatly influenced who got out. That's deeply unjust. Whether race also played a role in who got out can't be determined from the current data, unfortunately. Now to conclusions. The core mission of parole, to my mind, is to maximize the likelihood that returning citizens will successfully reintegrate into the community. That's good for them, for public safety, for taxpayers, and for our social fabric. Given this mission, pre-hearing detention of people charged with technical parole violations is problematic even in normal times. Right now, with many jails, COVID hotspots, and many people on parole having medical conditions placing them at high risk, it's unconscionable, as Governor Cuomo saw. The fact that even in these extreme circumstances, docs clung to keeping the maximum number of alleged violators in jail shows, I think, that this agency is irremediably unfit for the mission of reintegration. Docs is mostly a prison agency. Prisons are its basic tools, just like exercises are for physical therapists. It behaves as if the constant threat and frequent use of reincarceration would enhance reintegration. It also has a conflict of interest in that reincarcerating people on parole functions to keep prisons full. Currently, 1/3 of admissions to prisons come from parole violations rather than sentences for actual crimes. In the long run, the function of helping returning citizens reintegrate needs to be turned over to a completely different agency, one with a social service rather than a carceral mindset. Given that this won't happen overnight, I suggest 2 short-term actions. First, the legislature should permanently ban pre-hearing detention of persons accused of technical parole violations. The Less is More Act would help on this. Second, docs should immediately finish the work left undone by the pandemic release program, releasing all parolees currently held in jails, except the very few whose current actions demonstrate a concrete and serious threat to the public. I believe that these changes would make our state's parole system more effective, fair, and humane during the pandemic and beyond. Thank you.
Thank you, Mr. Hart. I was about to ask you if you can make recommendations based on your research, and you finished with that, so thank you. But I also implore you to make sure that you send me the results of your research.
And us.
Send us, yes, as soon as possible, because that could be instrumental in some of the things that we're conceptualizing as we speak right now.
Very good. Thank you. I will.
Thank you so much, sir. The last but not least speaker for today is Lisa Napoli, the supervising attorney for Appellate Advocates. Lisa, you have the show.
Hey, thanks a lot. My name is Lisa Napoli. I'm a supervising attorney at Appellate Advocates. We're an indigent defense organization located in New York City. Primarily what we do is we represent people on direct appeal from their criminal convictions in Brooklyn, Queens, and Staten Island. So my qualifications for testifying before you today and the basis for my knowledge underlying my written statement, that's all in my written statement, as well as my contact information. And I urge you to contact me because I think there's some things that might be better said in a less public setting, particularly you, Senator Sepulveda. I think that the work that you do is very important and that I might have things that are relevant information.
Thank you.
I'm not going to read my written testimony because it's been a long day and you guys can read that yourselves. But I do want to just highlight a few things that people said throughout the day. It was really interesting. So the primary means of combating viral transmission, specifically the transmission of the coronavirus in a prison setting, is decarceration. Masks, hand washing, social distancing, those are all things that can be implemented, but they're not going to be really effective in a prison. The primary means of mitigating the transmission of the virus is decarceration. And that's not something that advocates came up with. That is the consensus of public health experts, including the World Health Organization, not a fringe organization. This isn't a fringe idea. We pushed, along with other defense organizations and prisoners' rights organizations, sometimes collectively, sometimes independently, we pushed for docs to come up with a release plan. And they simply refused to do it. I think we need to recognize that they reduced the prison population significantly, but it was not through decarceration. What they did is they relied primarily on attrition. So they stopped intake from the local jails, which makes sense. You don't want a conduit for the virus coming into the system. And they just released people in the normal course of business. And then there's this very small group of people, technical parole violators, and people that were released through that order that Cuomo put out in the middle of April that was just this minute number of people. That all grouped together is about 7,000 people were left the system. But that's not decarceration. Decarceration is a coherent plan that we are going to, guiding principles, and you have certain categories of people that fit within those principles. And you would think that those principles would be people who pose the least risk to the community upon their release, and people who are medically vulnerable. And what docs did by not coming up with a coherent plan and by relying on attrition, which by the way came way too late in the game, is they left out the medically vulnerable completely. And there was a lack of transparency to what they did, because the defense organizations like appellate advocates and prisoners' rights organizations were like, how are we going to do release, right? How do you want to do this? And docs implied that they would consider medical parole applications. So we all did medical parole applications. They denied them. They said in their form letter, you should ask for commutation. Well, we're not getting that either. So why tell us to do those avenues if you're not going to consider them, right? It doesn't make any sense. It sends us all in a wild goose chase, and it completely leaves out. They were so restricted in how they viewed things that it left out people, like I said, who were medically vulnerable. Those were the easiest people to identify. And we offered, along with the other defense organizations and prisoners' rights organizations, we offered to help docs because we know they needed to release people who had approved addresses. So we were ready to go and help out. They didn't utilize that offer of assistance at all. As I just want to also address testing, that also was too little, too late. Testing now, this morning, they were throwing flowers at themselves for having, this extensive testing now, right? But everybody they're testing that they think it's so great, they're coming up negative. They're coming up negative because they've already had the virus. This is in my written statement, but we heard from people across the system that they were sick. They were not tested because they didn't have a fever that was sufficiently high, which I think was also some of the witnesses who were formerly incarcerated said the same thing. So you have a lot of people who have had the virus and it was not detected. All the testing that's being done now is fairly meaningless. Can I just say quickly, I know that my time is up, that Adirondack is an example of poor planning on their part. That is a grouping together of vulnerable people by age, and they're medically vulnerable. They did not test, docs did not test people before they put them into Adirondack, nor did they test them upon arrival. I mean, that was just like the logical time you would have a testing protocol in place. And they didn't do that. So what you've seen with docs is too little, too late, sloppy enforcement and implementation of policy that has been erratic throughout the system. Thank you.
Thank you, Ms. Napoli, for the information you gave us. You are the last of the Mohicans. Thank you for your testimony. And I will certainly read your written portion. We're going to close the hearing now, but before we do, I will allow my co-chair to say his closing comments, and then I'll make brief closing comments. And I expect to continue discussions with each and every one of the individuals who spoke today, get more information, get more research information so that we can do a better job at what we're trying to do. So, Senator Rivera, you have it.
Thank you, Mr. Chairman. Ms. Ligori, thank you so much for being with us. Thank you so much for sharing your experience. And thank everyone who shared their experience, particularly those folks who are formerly incarcerated or have family members who are or have been formerly incarcerated. It's incredibly important to have the experience from the actual individuals who either experience this themselves or family members who have. I am concerned about the inconsistencies that their experiences have from the official testimony of the administration, and we certainly will be looking into it. Dr. Hart, I hope that you can get that report to us at some point soon. I would love to look at some of those conclusions. And one thing that I want to make sure that I would mention, I would be remiss if I did not. Even though this hearing today has been specifically about jails and prisons in the state of New York that are managed either by localities in the state of New York or by the state itself, we would be remiss if we did not underline the fact that there are individuals who are currently held in federal facilities in the state of New York, particularly folks who are in immigration detention, who find themselves in very similar situations like the ones that we have here. Lack of information to their family members, lack of information to the public about the conditions of the individuals inside, and in many instances, even worse treatment than the ones that has been pointed out today. And although as a state, we do not have authority over that part of, even though they're physically in the state of New York, we do not have authority to determine what happens within them. I would encourage our federal colleagues to seek information and to really dig deep into what has been happening in those facilities across the nation, but certainly for my colleagues here in New York State, both congressional members of Congress, as well as our US senators, to look into what has happened in those facilities, which are federal in nature, particularly around immigration detention. And with that, I will only say one more thing. This is part of a process to develop, much like we did in the 31 hours, not that I like to repeat it, but it is 31 hours of hearings that we did on impact of COVID-19 on hospitals and nursing homes. The process here is both to determine, to make sure that we hold accountable those folks who have been bad actors in the past, but also, and more importantly, to develop policy for the future to make sure that we can avert unnecessary deaths. As I said at the beginning of our process, people incarcerated are still people. And if we are concerned about this as a public health crisis that impacts all people, then we should make sure that we protect all people, regardless of where they are in our state. Thank you, Mr. Chairman.
Thank you, Senator Rivera, for co-chairing this. It's been a real pleasure working with you and your staff. They did great work. One of the things that strikes me about today's hearing is really the deeply varying views of the agencies, the administration, and individuals that are advocating for people that are incarcerated and people who are formerly incarcerated. There seems to be a large divide as to what the performance of docs or New York City doc and what a lot of the advocates are saying. So I think part of my responsibility as chair of corrections is to look at all the information and data available and really get down to the nitty-gritty about what has happened. What do we have to do? We can ascribe blame later on, but right now we have to see what went wrong and try to fix it and deal with some of the things that we did improperly from the onset. We have to always remember that we were in uncharted waters. The COVID crisis brought difficulties that even to this day we're still dealing with. So you're not going to get, I didn't expect a perfect response from DOC, but I do expect them to be open about information, transparent about information. And I intend to get to the bottom of all the information that perhaps they're withholding. I pledge to everyone who testified today that we will be voracious about reading your testimony, coming up with solutions, and I will contact many of you, either myself or my legislative director, or my chief of staff, will contact many of you so we can have additional discussions about what has happened and how we can make it better. In the interim, please stay safe. Thank you for your patience. Thank you, Senator Gallivan, for being here today all day. And a couple of my other colleagues, Senator Myrie, thank you for being here. And hopefully we won't have to do a hearing like this again. This could be the beginning of something necessary and new at our state correctional facilities. Be safe, God bless everyone, and have a good night.